Buenos días,
Good morning.
mi nombre es Luis Pineda Pastrana y soy el coordinador de diseño instruccional. A nombre de la doctora Daisy Corrales, doctora del Centro Interamericano de Estudios de Seguridad Social,
Our director.
les damos la más cordial bienvenida al tercer día de actividades del seminario virtual Alta Dirección en Instituciones de Seguridad Social.
Social Security.
El día de hoy contamos con la participación del maestro Francisco Díaz Zamudio, nuestro diplomado del módulo 3, así como de los alumnos ponentes Carmen Domínguez del Instituto Mexicano
From the Mexican Institute of Social
y de
Security,
Randall Chavarría de la Caja
Ronald Chavarría de la Caja
Costarricense
Costarricense de Seguro Social.
Cada tema a desarrollar tendrá una duración
Each
de
each
una hora de
presentation will
acuerdo con
have
la
a
agenda
duration of 1 hour
del día y estaremos
based on
finalizando
our schedule,
aproximadamente
and we'll
a
be
las 2 de la
wrapping
tarde.
up today's works at around 2 p.m.
Antes de iniciar y darle la palabra al maestro Francisco
So
Díaz,
before I pass the floor to
me
Mr. Francisco
permitiré leer
Diaz,
su reseña
I will
curricular
quickly
y
read
también invitando
the
a todos
summarized
los
resume. And I would
espectadores
like
que nos
to
están
invite
siguiendo
the
la puedan
broadcast to voice
hacer
out
llegar a
any
través de la
questions or
plataforma.
comments through our platform, through our chat.
El maestro Díaz tiene una licenciatura
Mr.
en
Diaz has
Administración
a
con mención honorífica
bachelor's
por
degree
la
in
Facultad de
management
Contaduría y Administración de la Universidad Nacional
by
Autónoma
the
de México,
Accounting School of
con maestría
UNAM.
en
Has
Administración
a
por la
bachelor's
Universidad
degree in
Intercontinental,
management by Universidad
experiencia
Intercontinental,
profesional con más de
professional
30 años
experience with
en
over
áreas
30
de
years
Administración y
in
Mercadotecnia en
management areas in companies like
Multivisión,
Banamex,
3
Multivisión,
estrellas de oro,
Tres
Estrella
Estrellas
Blanca,
de Oro,
Irving,
Estrella
México,
Blanca,
Grupo
Irving,
Gigante,
Mexico,
por mencionar
Grupo
algunas.
Gigante, just to mention a few.
Profesor distinguido de la Facultad de Contaduría y
Distinguished faculty
Administración,
member of
con
the
20 años
Accounting
de
and
servicio
Management
en las
School,
coordinaciones
20
de
years
Mercadotecnia
service
y
in the
Operaciones,
coordination of marketing and operations.
catedrático en universidades y
Scholar
escuelas como el
in
Centro de
colleges and
Estudios en
schools like
Ciencias de
Centro de
la
Estudios en
Comunicación,
Ciencias de la
Escuela
Comunicación,
Superior de Negocios,
Escuela Superior
Universidad
de
del Valle de
Negocios,
México,
Universidad del
Campus
Valle de
Tlalpan,
México,
Universidad Intercontinental,
Universidad
Universidad
Intercontinental,
Latina,
Universidad
entre otras de
Latina,
manera
among
presencial,
others.
y en la modalidad a distancia o en línea, en la
And
Universidad
in the
Nacional
virtual
Autónoma de
modality,
México,
the
Universidad Nacional
Universidad
a
Nacional
Distancia de
Autónoma de
México,
México, Universidad
Universidad
Nacional a Distancia de
Intercontinental
México,
y
Universidad
Centro de Estudios
Intercontinental,
en Ciencias de la
and Centro
Comunicación.
de Estudio en Ciencias de la
Ha
Comunicación.
impartido cursos de diplomado y
So
seminario de
diploma
titulación
courses
en la Facultad de
and
Contaduría y
seminars
Administración de la
in the
UNAM.
School of Accounting and
Impartición del
Management
módulo 3,
in
Desarrollo
UNAM.
Organizacional,
And
desde
he's taught
2016 a la en
2016
Seguridad
to
Social,
date
antes
for
Servicios de
this
Salud,
diploma course.
en este centro de estudios. Ha dado cursos de capacitación de
Of
manera
training
independiente en
courses
áreas de
independently
mercadotecnia,
in areas like
administración
marketing,
y planeación
management,
estratégica
and
tanto a
strategic
organismos
planning,
públicos
both
como
public
privados.
organization and private
Fue presidente
organizations.
de
He was
la
president
de la
of the
Universidad
Marketing
del Valle de
Academy
México,
de
Campus
Universidad del
Tlalpan,
Valle de
durante
México
3
Campus
periodos.
Tlalpan
Es asesor en la
in
UNAM
3
para
years.
apoyo
He's a
de pymes
consultant
en
in
planes de
one
negocio
support of
y consultor independiente de
mediums and
empresas en el área de
small-sized
mercadotecnia
companies, and
y
independent consultant
administración
in marketing
estratégica.
and strategic management.
Sin más, cedo la
Without
palabra al
further
maestro
ado, I will
Díaz
now
y
pass
a
the
los
floor
alumnos
to
ponentes que a
Mr.
lo largo de la
Diaz
jornada
and
de
the
hoy
rest of our
nos
presenters,
compartirán sus
who will
conocimientos
share
y
their
experiencia en el tema del
knowledge and
desarrollo
experience
organizacional
in
de las
everything
instituciones de
pertaining
seguridad
to
social. Bienvenidos.
organizational development in social security institutions. Welcome.
Muy bien. ¿Qué tal? ¿Cómo estamos? Buenos
Very
días.
well, how are you?
Estamos iniciando
Good morning. So we're just kickstarting
esta modalidad de la
these
clase o la sesión presencial virtual
virtual
que
sessions.
para nosotros debido a la terrible pandemia
And
que
to
todos
us, due to
conocemos
the
y que
terrible
ustedes han
pandemic,
enfrentado
you're all aware
todavía
and
más que
you have
nosotros
faced even more so than us.
en uno de los campos de combate que no queríamos nadie enfrentar y que ahora pues les ha tocado a ustedes estar
In one of the
en esta
fields who
situación
pretty much nobody wanted to
en
face,
una
and
sesión que generalmente la
you
hacíamos
found
aquí en la
yourselves in the
Ciudad de
situation. This type of
México
sessions usually were
en
was
las
carried out
hermosas
in Mexico City in the
instalaciones que
beautiful
tiene
facilities
el CIES
of CISS,
y que hoy dolorosamente
and
lo
painfully,
tenemos que hacer a
regretfully,
distancia, no porque
we need
sea
to do
malo,
this
no porque sea
virtually.
menor
And
en calidad,
it's not that
pero
this
no,
is a bad
lo
thing.
doloroso es que no tenemos el contacto
What's really
presencial
painful is
y
that we
físico
don't
con
have
ustedes, que era
the
maravilloso,
face-to-face contact with
en
you,
el cual nos
which was
nutríamos, en
really
el
a
cual
wonderful thing,
intercambiábamos puntos de vista, no solo en la sesión,
and
sino en
that
los
allowed
momentos que
to exchange
teníamos
point of
un poco
view
más
during the session, but
cuando tomábamos el
during
café, cuando desayunábamos juntos, cuando
while
llegábamos a
having
comer
breakfast
juntos, ahí
together, getting lunch together
la conferencia interamericana, ¿no? Pero bueno, pues esto
at the
también
Inter-American Conference venue.
nos hace reflexionar muchas
Nevertheless,
cosas.
it makes us reflect upon many
Y
things.
O esta parte del seminario
I guess it's part of the
que a mí me
seminar.
toca trabajar, que es el módulo 3, la parte de desarrollo
It's just
organizacional,
module 3, everything
y
pertaining to
que
organizational
seguramente
development,
algunos de ustedes
which chances
lo
are
recordarán
some of
por
you
aquel con,
might,
con
might,
las
might recall
encuestas
that
y las
Diagnose
innumerables
test with it
gráficas que me hicieron favor de subir con sus
and the
análisis,
polls and all the
que me
charts
queda
that you
claro
uploaded with your
que fue
analysis.
un
And
trabajo
it is very clear cut
fuerte,
to
que
me
fue un
right now. It was
trabajo,
strong
no digo
work,
difícil, pero sí que nos
hard.
llevó
I wouldn't say
horas, hombre,
difficult, but it took
y
a
aunado
lot
a la
of
situación a la
man
que
hours.
vivían, pues nos quedaba claro
And
que
together with situation,
mucho,
I mean, your own personal
con
situations
mucho
and
cansancio,
whatnot,
etcétera.
you might have been very
Pero
tired when doing
en
this.
ese
However,
sentido,
it's in that sense
independientemente de esta,
dependent from the
lo
situation.
que sí es importante
And what's really important
es ver que estamos
is
aquí,
to see that we're here,
que a pesar
we're still
de
here.
algo predecible,
And
podemos
despite
decirlo, que no era
something,
impredecible.
I wouldn't like to say
Eh,
unpredictable because it was not
yo les
unpredictable, but
comentaba
I was actually
en las primeras sesiones
only
que
during the
dimos
first
que
sessions of this diploma
bendito
course,
Dios ha tenido mucho éxito porque significa que
which has been very
estamos llegando a un
successful,
grado
thank God,
mayor de
because that
profesionalización
means that we're
en
reaching a higher
aspectos de
degree
alta
of
dirección
professionalization when it comes to
y
top
que la
management,
gente tiene más interés
and
en
that
llegar a este punto,
people's
no
more
porque
interested
la alta dirección
in arriving at
implique
this point, not because
un
top
lugar
management
con
entails
los dioses, sino porque
having
la alta dirección
your
implica
place among the
un
gods, but
punto de
rather
toma de
top
decisiones muy
management
fuerte
has to do with
en
very
una
strong
optimización de
decision-making
recursos que estaba
and
antes de la pandemia.
using even more
Ya
scarce resources. So
teníamos
prior to the pandemic,
datos muy
even
fuertes
we had strong
que ustedes
or
mismos
hard data
en el primer tema del
that you
módulo 3
yourselves in the
conmigo
first
les pedía que
topic of
hicieran
module
una
3 with me.
reflexión,
I
que
asked
hicieran
for
un
you to make a
análisis,
reflection and analysis,
que viéramos el número de camas que se
for you to
requerían
look at the number of
para
hospital
afrontar
beds that
una
we
realidad
would require to
que en ese
face
momento de por
the
sí ya nos
reality
rebasaba, ¿no?
which was overpassing us
Una
back
realidad
then.
en la cual no
A
teníamos camas
reality
suficientes
in
para
which we did
atender
not have enough hospital
todas las
beds
problemáticas de salud que
to
nuestros
deal with all the
diferentes
health
países presentaban.
in our different countries.
Aún a pesar de ello,
And despite all that,
las personas que empezaron con el módulo
people who started
y
out
con
this
este
module
seminario y
and with
diplomado
this
hace tiempo,
seminar and diploma course some while ago
se cuestionaban la forma de optimizar
were
recursos
actually
y
questioning
tomado
resources.
pues una
And they
serie de
saw
herramientas que les
through our
ayudan
diploma
mucho
course,
a optimizarlos. Sin embargo, los
they
recursos nunca
got
eran suficientes
that allowed them to optimize these
y hoy,
resources. However,
para como
resources are
están las
never enough.
circunstancias, está
And
peor.
well, the truth is that circumstances are
Yo
worse today.
les planteaba hace
Around 4 years ago,
señores,
I told you,
sabemos
ladies
que
and
existen
gentlemen,
protocolos
we
en
know
caso de
that
una
there are
pandemia.
protocols in case of a pandemic.
En México, dolorosamente también
In
nos tocó ser
Mexico, painfully,
el
very
lugar
painfully so,
inicial, el lugar cero para
we were
la epidemia del
ground
H1N1,
zero for the
que no
H1N1
llegaba a ser
epidemic,
una pandemia tan fuerte, pero sí llegó a ser una
which didn't
epidemia,
reach
sí,
levels of epidemic.
y ya teníamos,
It
aparte
struck
de la
a lot of
experiencia,
countries.
nosotros
And
fuimos los
aside
que
from the experience,
contuvimos un poco más
we were the
virus,
ones
no
who
era tan letal,
contained
no era
this
tan transmisible,
virus a little bit better,
bueno,
virus
sí,
which
se
was
tuvieron
not as
protocolos, se hicieron
lethal
cosas,
or as transmissible.
pero años después yo
And we
preguntaba
did
en esta
things in
misma
this sense.
sesión en
And
la que nos veíamos
years
cara a
later,
cara
I asked in
y les
this
preguntaba a
one-on-one
ustedes, oigan, ¿y
sessions,
cómo andamos con los protocolos?
I told you, what about the protocols?
¿Cómo andamos en caso
How
de
are we
una nueva
doing
pandemia
in
que
case of a new
seguramente por
pandemic?
lo que dicen las estadísticas, los
Which,
estudios y
I mean,
demás,
because of what statistics and
se va a
studies
volver a
say,
gestar esta
will
pandemia?
will become a reality. We will have a new one.
Pero lo decíamos pidiéndole a Dios y pensando que no nos iba a tocar verlo en vida.
But we said this, as asking God
Y sin
not to live,
embargo,
to actually live it.
pues muchos nos decían, el protocolo existe, claro que
And
existe,
many of you
Organización Mundial
said
de
that
la
the
Salud nos ha
protocol
dado protocolo.
exists. Of course,
El detalle
WHO
es que con los
provided us with a
recursos que
protocol. The
tenemos,
thing
quién
is that
sabe si lo
with the
podamos llevar a
resources
cabo o no.
readily available, I don't know, or we don't know if
Y
we're
esa
actually
era la
going to be able to
reflexión con la
deploy it.
cual
And that was a
iniciábamos
reflection.
todos
We
este
started
módulo
out
hace
this
algunos años.
this module.
La realidad ha sido más
So
grande, la realidad ha
reality
sido más
has
fuerte
been larger, stronger
que lo que nosotros vislumbrábamos en
than what we
aquellas
foresaw
reuniones,
in those meetings,
en aquellas reuniones presenciales
in those
de nuestro
face-to-face
módulo 3
meetings
de
or
nuestro
for our module 3 of our diploma course.
y la realidad pues nos ganó. Y llevábamos 4 años
Reality finally overcame us.
porque
So I've been asking the same
obviamente a mí
question
me
for 4
servía
years
como un aspecto introductorio,
because this served
me
as
servía
some sort of
como un
introduction
aspecto para que
for
vieran
my
todos
module,
los
for my course. It
participantes la
also served
importancia
for
de
all the
optimizar recursos
participants to see the
y
importance
que si
of
de por
resource
sí no
optimization.
teníamos recursos porque las acciones de seguridad social,
And
no solamente los
we didn't
hospitales,
have resources
sino las
because of social
instituciones de
security institutions.
seguridad
And I'm
social,
not only talking about hospitals, but social
que por la
security
misma
institutions
pandemia en todos
because of
sus
the very
campos,
pandemic
porque hemos visto que el
in all
desempleo
different fields, because we've seen
se ha
that
disparado,
unemployment has skyrocketed,
la falta de alimento en algunos lados también se ha
lack of
disparado,
food, some
la
in other
pobreza,
places
si de
has
por sí
skyrocketed, poverty
Latinoamérica dolorosamente
in Latin
somos
America.
países hermanos y todos
Regretfully, we're
padecemos
all
el mismo flagelo de la
brother
pobreza y de la desigualdad social se había disparado
nations, and we saw how
y las
poverty and
instituciones de
social
seguridad
inequality has
social en todos
skyrocketed.
los ámbitos,
And well, then social
obviamente
security institution
incluyendo
in every
el
single field,
médico,
obviously including medical,
pues ya se enfrentaban a unas
we're faced
a una
against
problemática
some problems,
impresionante.
like impressive problems.
Con la pandemia a
With
nosotros,
the pandemic,
América,
at least
nos ha
to us
puesto en
in Latin
jaque
America,
muchas
it has proven to be
y el diplomado
very complicated in many
entonces, que de
different
por sí
areas,
tenía
many different playing fields. So the
una
diploma
valía
course, which
impresionante,
was already very
que
valuable,
de por sí había permeado en muchos de los directivos,
and it had seeped to many
de
of
esos
the directors.
directivos que en algunos casos
These directors,
y
which in
algunos de
some
ustedes
cases, some of
a
you
nivel nacional e internacional
at a national, international level,
ya se habían ido convencidos de la
about
herramientas,
the need of applying these
no
techniques
como
and
la
all
como
be old,
panacea para
so that after the diploma course
100%
with
iban a contribuir
an accrual of to
en
this fight
de obtención
struggle
de recursos para poder atender a nuestra
better tend to the
sociedad.
population.
La pandemia vino
And this is no
todavía
casing
la imposibilidad
problems that
por
many countries
afrontar
faced.
una realidad social.
Trying to find reality in Latin America. Again, terrible.
Nosotros hablábamos de profesionalizar muchas cosas.
So we were talking about
Lo seguimos
professionalizing
haciendo.
many things, and we're still talking about this.
En muchos de los casos tenemos
In
nosotros
many
aquí
cases,
compañeros que han sido han tenido que laborar todavía
we
mucho
have
más
peers
derivado
that
de esto.
have had to work even harder
Y
because of
también
this,
compañeros
because of
que
this
se han
situation,
visto
and
envueltos
some
en
other
la propia
peers
enfermedad y aún así han
have
participado y siguen participando
been infected
en
by
sus
the disease and
labores
they're
y
still
también en
working.
el diplomado, cosa que les admiro
I mean, they're still holding
y
their job
les
position and
respeto
they're also
y les
part of the
agradezco
diploma
mucho,
course. I respect that tremendously,
porque
and I
implica
would
un
like to thank you
compromiso
for it
enorme
because that means that you have
y a los
tremendous degree
que
of commitment.
por fortuna, por
And
suerte,
those,
porque seguimos
fortunately, because
con
of
los
luck,
protocolos,
because we follow the protocols and
porque
whatnot,
no nos hemos tratado de
because we
exponer, pero
haven't tried
ustedes
to
sí les ha
expose
tocado en
ourselves,
muchos casos.
but you
Este,
are actually there
enfermos que no nos
on the
hemos
field.
enfermado
So, well, I mean, those
de
of us who
este mal.
haven't been
De
infected
todas formas,
by this
no ha sido
disease,
fácil
it still haven't been easy
en todos nuestros países, en una
in all
economía
our countries,
a nivel global que ha tenido
in a global
esta
economy
caída y que también ha representado una lucha
that
por
has
la
fallen,
búsqueda de nuestros ingresos, ¿no?
and that this has also
Y eso
meant
hace que se
a
mantengan o que
struggle
al mantenerse más bien
for
en
us
el
for us to
diplomado,
get income. So that
pues
makes
todos
staying
los
the
admiremos
diploma
y los
course.
reconozcamos.
I mean, you all deserve
Sobre todo
our
por los
admiration,
altos índices
especially because of the high
de
index
desempeño que han
of
demostrado.
performance that you have showed
Se identifica un
so far,
compromiso
you've shown so far. So
que
that,
es el
again,
mismo compromiso
that
no
means that you have
solamente
a
que han hecho
higher
con el
degree of
diplomado,
commitment that
sino que han hecho con las propias instituciones en las que
commitment to
están
the
y con
diploma
los
course
países que
and to your
ustedes
institutions
representan.
and to the countries that you represent.
Esta reflexión inicial,
So this
mi
initial
claustro,
reflection,
yo generalmente siempre he sido pues mucho más sonriente y
I mean,
dicharachero al
I've always
principio, en nuestra
been like
primera
more
presentación cara a
easygoing,
cara,
you
pero
know,
no
always
podía
with a
ser de otra
smile
forma
in our first
al estar padeciendo lo que estamos
when we
padeciendo en
first
la
meet.
actualidad.
But right now, I cannot do that because of what
Y
we're
al estar
undergoing.
frente a mí, de alguna u otra forma, todos ustedes que han representado el esfuerzo más grande
And
que han
being
hecho
here,
los países
all of you who represent
por enfrentar a un enemigo que
major
no vemos,
efforts by
pero que está
different
acabando
nations
con
facing an enemy that we
cientos de
cannot
miles de
see, but
vidas
it's putting an end to
a nivel global
hundreds of thousands of
y
lives
obviamente en cada
worldwide,
uno de nuestros países.
and obviously in each of our countries.
Este diplomado
This diploma course
les ha otorgado herramientas,
has endowed you with
herramientas para tomar decisiones
tools for better
administrativas y
decision
tal vez
making
alguien diga, y ahorita lo administrativo no es
in
tan
the managerial
trascendente.
areas. And some might
Lo
say, well,
trascendente
management is not
tiene que
as
ver con la
transcendent
parte de
right
salud.
now,
El
as
problema es
important
que la
right now.
parte de
I
salud
mean,
sin
management does have to
recursos,
do with health. However, health
sin
without
recursos
resources,
económicos no
without
funciona.
economic resources, cannot work.
La parte heroica de los médicos, pues claro que se identifica y claro que todos los vemos como
Of course, I mean, we can identify
ya los veíamos
medics
antes
as
como héroes,
heroes,
imagínense ahora, ¿no?
and if we thought of them as
Pero a todos los
heroes
demás prestadores de
before,
servicios
imagine right now,
sociales
really,
que han
all
apoyado a la población y que también se han
social security
expuesto a
officials
este
have
virus y
supported
que se han
the
enfermado
population and have
y que han
exposed
tenido
themselves
que
to
dar
this
la cara
virus and
para
have
que
gotten
la
sick,
sociedad no se
and
muera de hambre,
that they've had to do their jobs so
para
the
que siga
society won't
recibiendo sus
starve,
servicios,
for them to keep
para que siga
receiving their
recibiendo todos
benefits,
sus
their
apoyos.
services, for them, to keep
Ellos que
receiving all
también
types
no son
of,
tan
of
reconocidos, pues
economic
también hay que
support.
darles en ese
I mean,
sentido
are not
reconocimiento.
so acknowledged, but
Claro,
they
los
should be.
médicos son los que han estado
Of course,
en la
doctors,
primera línea
physicians are
y
the
siempre
front
seguirán
line,
siendo los héroes en esta pandemia.
and well,
Pero
they'll always be the
requieren,
heroes during this pandemic.
todas las instituciones han requerido de
But all
material
institutions have required
adicional,
having additional material,
de uniformes adicionales,
additional uniforms,
de equipos adicionales para enfrentar
additional pieces of equipment
esta
to
pandemia.
better
Y
face
eso,
this
pues la
pandemic.
única forma de obtenerlos es con
And the only
recursos.
way of getting that is through resources.
Y si de por sí ya optimizaban ustedes los recursos,
And if you were optimizing
pues
resources
ahora la exigencia de la
as
optimización
things
es
were, now
mayor.
demands in terms of optimization is way
El día
larger.
de hoy, en nuestra sesión de aquí a
Today,
las 2 de la
in
tarde
our session from here until 2
aproximadamente,
p.m.,
vamos a ver algunos elementos y algunas
we'll get to see some elements,
herramientas
some
adicionales que les
tools,
pueden servir,
additional tools that
que
might
algunos de
serve you.
ustedes ya utilizarán, otros apenas conocerán,
Some of
pero
you
que el
may
enfoque que les
already be
damos
using
pues
them.
tendrá que ser
Some of these tools are new to some of you.
bastante para que le vean nuevas aplicaciones y
Should be
los
a
que
little
los
bit new
conozcan
for you
por primera
to
vez los
come up
identifiquen
with
como
new
grandes.
applications. And for those of you who are
Esto
getting to
en
know them, you
búsqueda
should
de la
identify them and
optimización
think of them as great options.
clara
Everything look for clear
de los
optimization
recursos
of resources
para enfrentar lo que se viene,
to be able
porque
to better
todavía
face
esto no
what's
se
to come,
acaba
because
con la
this is not over.
pandemia,
This is far from over, this pandemic.
todavía aún teniendo las vacunas que no las tenemos,
Even having the
de
vaccines that we
menos en
don't
volúmenes
have,
suficientes
at least
para
not
atender
in
a la población más rápido,
adequate volumes, to better
van a
tend to the
venir
population.
retos porque va a quedar
We will
mucha
still have
población
challenges because there will be
con
a
daños
lot of
derivados de la
population,
pandemia
damaged because
que
of the
requerirán
pandemic.
que la sociedad los
And these people
apoye
will
y
require
que
from
apoyen las
support of society
instituciones de seguridad social
and for society
para que
to
se
also
puedan
support social
valer
security
y
institutions
sobrevivir.
so that they can
Algunos
survive.
con terapias nuevas
Some
que tendrán que
using
enfrentar
new
por la
therapies
cuestión pulmonar.
that they will have to
Algunos
face
otros
because of lung problems.
lo tendrán que
Some
hacer
others
desde, desde la perspectiva
will have to do this
de tener
from the
que ser
perspective
licenciados, es decir, que se les tenga que jubilar o cesar de sus
of
trabajos porque
having
el
to
daño
be
pulmonar,
terminated
el daño
from their
pulmonar
companies because
es
of
muy
lung
grave
damage, because
y
their lung
estos
damage is too severe.
tendrán que pagar indemnizaciones
And
y la
well, we would
nación
need to
tendrá
pay
que pagar
indemnization
dichas
for them.
indemnizaciones.
Shall be paid by
Entonces
again social security
tendrán
institutions.
ese reto
We'll have
adicional
that additional challenge
que
to
no
the
es
mix.
solamente dar este,
Things
sino a
like
la
medical
par
follow-up,
sociedad
but also contributing to the
se
society.
reintegre a una nueva realidad
We
porque lo
can
que es
reintegrate
cierto
to
es
this new
que
reality because what's
las
really
cosas ya no van
true
a
is
ser
that
iguales.
things will not be the same.
Yo creo que en 5 años tal
I
vez
think that in 5 years'
veremos que
time,
estamos
we
relativamente
might
cerca
see that we're
de lo que
relatively
es
woods
antes, pero no va a ser lo
in
mismo.
terms of
Seguiremos
living a
con
normal
muchos
life, but things won't be normal
aprendizajes que
again.
tuvimos
We will keep
en
learning.
esta
We've
época
learned a lot
y con la aplicación
during this time,
de muchos de nuestros
and with the
eh, sobre todo de nuestras técnicas y herramientas
and by using many
que
of our
necesitamos
techniques
para
and
poder
tools,
optimizar los recursos que sabemos
things
que
that
en
we need to be able
Latinoamérica
to
nunca han
optimize
sido
resources
vastos
that we
para
know that haven't been
la
like
parte
really
social,
vast in Latin America, at least not for the
Siempre ha hecho
social
falta,
arena.
somos países ricos,
There's always been
con muchos
scarcity. We
recursos, pero
are
la gestión que
rich
se ha
countries.
hecho
We
de
have many
ellos
resources, but
por
the
diferentes
management,
cuestiones
poor management of said
no
resources
son
because of many reasons,
en este sentido
is far
las
from
mejores.
optimal.
Pero bueno, iniciamos con esta
So,
reflexión.
I mean, I leave you with this
Inicio
reflection, this
pues
food
con
for
la
thought.
añoranza de verlos,
And I start with,
con
of course, a longing
la
to be
gran
able to see
expectativa
you
que
face to
tenía yo de
face. I
saludarlos.
mean, the great
Si
expectation
no
that
de
I
mano en
had,
mano, porque ahorita no se puede, de
shaking your
menos
hand.
cara a cara,
Well, at
pues
least
bueno, ni modo.
I have to settle with
Así es esto
seeing you over a
y
screen
tenemos que enfrentarlo. Y es
nowadays.
ahora
But there's the
cuando,
reality, and we need to face that reality.
señores, todo lo que están viendo en su
So, ladies
diplomado,
and gentlemen,
si
everything
antes
you're
pedíamos
studying your diploma course, if we
que
used
lo
to really
usaran,
ask you
ahora es
to
una
use it,
exigencia, ¿no?
now we're not asking, we're
Es una
demanding that you
exigencia
use it.
porque
We're
la
demanding
situación
that
ha
you
estado
use it
muy
because
fuerte.
it's very
Este
grim.
módulo 3, que habla
So
de
this
desarrollo
module number
organizacional,
3 talks about organizational development.
habla también sobre el clima
Also
organizacional,
talks about the
una de
environment,
las partes que genera problemas
which is one of the
y que
topics
de
that
acuerdo
are a little
a
bit
los modelos que
controversial
vimos
based on the models we've seen
de desarrollo organizacional
on
durante el módulo,
organizational development
pues
during the
identifica
whole
que este es un
module.
factor
We can identify that
que
this is a
puede
factor
generar que todo lo
that
que se vea
might
en una maravillosa planeación
make that
estratégica,
everything that
bien
we can
regulada,
see
bien
marvelously in
analizada,
a very well
bien
calculated,
sustentada y
analyzed, very
fundamentada,
well
todo
fundamented
eso que se ve en una hermosa
organizational
planeación
planning, everything
estratégica
that we can have in
es
this
muy
beautiful
factible
strategic planning is
que
very
cabo. ¿Por qué?
that won't become a
Porque el
reality. Why?
personal al tener puntos
Because
en
personnel,
los cuales
when having
muestre su desinterés, su
points in
molestia,
which they show lack of
sus
interest, that
inquietudes,
they're bothered, that
pues
they're
no sigan
well, chances are that
la parte
they won't
funcional
provide
y
follow-up to
operativa
the
de
functional
todos
or
aquellos
operational
maravillosos
portion
planes
of all these
estratégicos
wonderful strategic plans
que ustedes han desarrollado y han generado.
that you have
Y es por
developed
eso que este
and
módulo
drafted.
de desarrollo
And that's
organizacional
why this module in organizational
también
development
tiene esa porque los
also
otros
has
módulos
that
también,
important
obviamente,
component
todos
because the other
excelentes
modules,
y manejados por
of course, all
excelentes
of them
compañeros,
excellent peers of ours,
doctores, profesores, etcétera,
physicians, professors,
pues
you name it.
llegan a topar de repente con el punto de, ¿y si la operación no los quiere hacer?
Sometimes
¿Y si la gente
they're
no los
faced
quiere
against
operar?
things like, well, if people don't
¿Y si la
want
gente tiene
to
otras
carry them out, what if the operations area doesn't
preocupaciones
want to carry them out, if people have
que
other
le
concerns
impiden
that
llevarlo a
won't allow
cabo?
them to carry them out,
Entonces, aquella magnífica planeación
then that great
desaparece.
planning will go away.
Y es por ello que mi módulo, en el módulo 3, bueno, en el módulo de todos
And
ustedes,
that's
en el
why in this
3,
module, in
al
module 3,
presentarse el análisis de diferentes áreas de trabajo,
when you find the analysis of
obviamente
different
yo no podía hacer
work
una
areas,
reflexión de cada una en el
I
sentido
cannot
de
make a
que no
reflection of each
supieran
one of
que
them.
había alguna intervención de mi parte.
In the sense, I don't want to
Obviamente
tamper with
yo
it.
solamente calificaba la parte técnica en ese asunto,
I mean, I only
pero lo que
graded
sí es un
technical
hecho
aspects of the module, but
es que
what's a fact
independientemente de todo,
is that irrespective of everything,
yo veía el esfuerzo que habían hecho
I
y que
saw
habían encontrado
the
cosas
effort
muy
that you've
interesantes.
made, and you find very interesting things.
Ahora también había áreas que no tenían ningún problema, que presentaban cuadros
Things that
maravillosos,
had
realmente
no problem. They
todo era
presented
satisfactorio,
great cadres
cosa que
and
yo
everything
halago,
was fulfilling.
cosa que yo
Something that
felicito,
I
pero
commend.
en términos generales y
However, in
porcentualmente
general
hablando eran
terms
los
and in
menos.
percentage
Eran
terms,
el
there
porcentaje
were
menor
the
de todos
least.
los que me
It was
presentaron
the least
sus trabajos.
or the less
Esto
percentage of all
implica
the ones
que
that
el ser
presented
humano,
their works.
que es tan complejo,
This means that the
pues
human being
presentaba
is
muchas
very
problemáticas,
complicated and it presented
presentaba
a lot of problems.
muchas
It
dudas,
presented a lot
presentaba
of
muchos recelos.
concerns, a lot of
Y estos recelos son pues, evidentes, sí, forman parte del ser humano, pero
concerns
también formaban
that are
parte de
part of
alguna
the human being.
administración
And they were part of a
que
management
dejaba de ver
of an
algunos
administration
aspectos.
that was
Por
disregarding
ejemplo,
some
algo
um,
que
aspect. For example,
causa siempre,
something that
siempre, desde que iniciamos
always,
con
since the
estos
very beginning that we started
diplomados,
with these
me causa siempre
studies and diplomas,
mucha curiosidad es
being a
identificar que el
great question
reconocimiento de
for
la
me
toma de
is
decisiones,
identifying that,
el
recognizing
análisis de las decisiones hechas
decision making,
anteriormente,
the analysis of
las
previous decisions
posibilidades y
made
las
before,
problemáticas que se enfrentaron y se
responsibilities
resolvieron.
and problems that were solved.
Dolorosamente en Latinoamérica
Unfortunately,
no
in
quedan
Latin America,
registradas en
they
ningún papel.
haven't been recorded in paper, none of them.
Y esto pues es muy triste,
And this is very
porque si de
sad
por sí vivimos
because
en países en donde la lectura
we
y el
are
registro de la
living
historia
in
no es tan
countries in which
trascendente,
reading and recording
solamente hablando para
history
el
is
volumen
not
importante de la población,
relevant
obviamente. Pues
according
imagínense
to the
nosotros que
volume of the
estamos en
population.
áreas de
Well,
seguridad social
let alone
y que no
us that we are
tenemos el
working
registro
in
de
the
cómo se fueron
environment of
resolviendo los
social
problemas
security,
anteriores
and there's no
y cuáles fueron los
registration and
éxitos,
record about
si
previous
no se tuvo
successes,
nunca ese
how
registro.
things were implemented before. If
Entonces,
we don't have this
esa
registry, if we don't
memorabilia,
have this documentation,
entonces, ¿cómo
all
enfrentamos los
these
que vienen?
memoirs,
Y dentro
how are going
del
to
modelo
help
de
us
desarrollo
to
organizacional, ese era uno de los
identify the ones
puntos
that we are going
que
to
más se
face.
planteaban.
And this is one of the that we were
Casi nadie
addressing.
registra cómo se tomaron las
Almost
decisiones.
no one
Se toma, se resuelve
documents the
y ahí
way
está,
they made
se
decisions. They
arregló.
made decisions and they
Pero
solved the
¿cómo?
situation and that's it.
¿Qué
But
pasa
how
si
it
a
was
este
done?
director
What
que resolvió
happens
la
if
problemática de manera
to
exitosa
this
lo
director that
promueven a otro cargo y llega
made
un
that
nuevo
successful
director?
decision is promoted to a new position
¿Cómo
and is
tiene que
replaced by
enfrentar las
another
problemáticas
director?
él?
How he
Pues
is
otra
going to
vez,
face,
como
well,
Latinoamérica
the
dolorosamente,
same way we do
a
it in
prueba y
Latin
error,
America, unfortunately.
dilapidando
Trial and
recursos que no
error,
tenemos.
spending
Y
resources
no
enough.
tampoco,
And
porque
we
no hay
don't have to
nadie que le haya
blame
dicho
him
cómo
because
enfrentar.
no one has told him how to
En nuestro propio
face this.
país,
In our own country,
ni siquiera la administración actual le
not
preguntó a
even
la
in the current
administración que
administration,
enfrentó
they
la
dare to
H1N1
ask the previous
cómo se
one
tenía que haberlo
how
hecho, ¿no?
to do something, how
Muy
they have
lejos
to
de
face
ello, se
things.
pensó en algún momento que el H1N1,
Uh,
este virus que hace
at a
algunos
certain
años
time,
nos espantó a todos
when
y
we
que
were
nos dio un
facing
primer
the
aviso,
NH1
y un
crisis, that
aviso
it
que a
was
nivel
a
mundial
first
nadie volvió a oír.
warning
¿Por qué no le preguntaron
that
cómo se
nobody
contuvo en
heard,
México, no?
they never asked us
Y no porque
about
hayamos
how it
tenido
was
demasiado
contained
éxito
in
en
Mexico,
contenerlo, pero
and
ya
not
habíamos
because we were
tenido
very
errores, entonces
successful
de menos
to
para no cometer los
contain
mismos.
it, but
Pero ni
because
siquiera
we
nuestro
made
propio país
mistakes,
se
they
volteó a
can
ver
learn
a la
from
historia
those
de
mistakes.
nuestras
But
propias
not even our
decisiones,
country was
siendo
considering
nosotros
our
el
previous
lugar
decisions.
cero
We
de
were
aquella
the
epidemia,
zero,
con la
uh,
cual todavía
the
estamos
place where
coexistiendo.
we had the zero patient uh,
Esta
of
falta de
that
reconocimiento,
previous pandemics. This lack
esta
of
falta
recognition,
del
this lack
latinoamericano,
of
incluso a
um,
veces podría decir que del iberoamericano, porque hasta los españoles y
res- lack
toda la
of
zona de Portugal
response
también
in
tienen
Latin
estos
America
defectos
and
de
in
no registrar lo que se hace,
Portugal,
que es
for
uno de los
example, they
puntos que
don't
en el desarrollo
document
organizacional se
everything
socava.
that is done. And this is
Es
an
lo que
item
nos
that
hace
is being
caer una
addressed in
y otra y otra
organizational
y otra vez
development courses because this
en el mismo
is
problema que ya
a
se había
cause for
zanjado,
us
que
to
ya se
fail
había
once and again.
arreglado y que nos hace volver a caer
And now we
y que
are
nos hace volver a tirar
falling
dinero
again and
y nos hace volver
spending
a
money,
tropezarnos.
and we are
Y esto yo podría
facing the
decir
same
que no
problems.
solo en las instituciones de
And not
seguridad
only in
social,
social security
estamos hablando
institutions,
que
because we are
es,
talking about
pareciera una
the
maldición
fact that seems
en
to be
todos
that
los
it's a
organismos e
curse
instituciones
in
públicos y
all the
privados,
public and private
de lo que
organizations
sea.
and
Yo
institutions
que
that
soy
deal with
asesor y
different matters.
consultor,
I am advisor,
pareciere que lo
consultant.
que hizo
Seems
el
to be
director
that what
anterior
the
en
previous
cualquier
director
empresa, organismo,
made
institución,
in
no
a
se quiere
company,
volver a
in an
tocar, está
institution,
maldito.
is cursed. No one
Cuando
wants
pues
to
cada
talk
quien
about
aportó
that.
algo y en lugar de
But the
retomar
truth
lo
is that
bueno de una persona
anyone
y
is
sumar,
contributing, and
pareciere
instead
que
of
estamos
adding
condenados a
forces, seems
restar y
to be that
dividir.
we are
No sumamos y
focusing only
multiplicamos,
on
no
subtracting
sumamos
things. We
esfuerzo y
don't add up
multiplicamos
and
éxitos, sino
multiply
que
efforts and
vemos lo que hizo el anterior y
successes.
estamos
We just
decididos a demostrar que nosotros somos
criticize
mejores y que el
what the
otro hizo lo
previous
peor.
one
Y
did,
entonces las
and that
cosas
we are
buenas que ha hecho el
better,
anterior las
and the good
ocultamos, las
things that the
disminuimos o las
previous
olvidamos.
or that our predecessors
Y
made
la
are
consecuencia de
forgotten.
eso ha sido terrible.
And the consequence of all of this
En la parte
has
de
been
desarrollo
terrible.
organizacional, las personas
Regarding
en
institutional
una buena
development,
parte
people
demuestran en nuestros análisis
show in our
que hay
analysis
descontentos,
that there are
que
people
hay
that are not
descontentos
happy,
derivados de una mala gestión, independientemente de los
disgruntlements
descontentos
from a
normales
bad
que el ser humano
management.
tiene, ¿no? Pero una mala gestión de los
A
recursos
bad
genera también
management
muchos
of
descontentos.
resources generates a lot of
Una
disgruntlement.
falta de equidad en la
A lack of
aplicación de los
equity
recursos,
buying resources
que a
generates
alguien se le pague más
disgruntlements.
que a los demás por
If
hacer lo
someone
mismo genera
makes
descontento.
more money than
Que
others
a
to
alguien
make
se le
exactly the
reconozca y no se
same
le reconozca a los
generates
demás
disgruntlement.
genera
If
descontento.
you recognize someone and not the others, this
Que
is
se
going to
identifique que
create a
alguien
lot
llega
of
en una estructura
disgruntlement.
organizacional a puestos que no tendría por qué, porque no
When
tiene
someone
la
reaches
estructura o porque no
the
tiene el
top
perfil, pero llega,
without having the structure
también
or the
genera
profile,
descontento,
and they
brincándose
get
todos los
to
planes de
high
carrera
ranking positions,
que se
that
tienen.
generates a lot of
Es decir,
disgruntlements.
la gestión de los recursos no
Resources
ha sido
management
eficiente
hasn't
en
been
muchos de
efficient
los casos.
in many cases.
Sabemos que hay instituciones que lo han
We
hecho
know
muy bien.
that there are institutions that have
Eso
done
sí,
this correctly.
generalizar y decir que el 100% de las
When we
instituciones han hecho
generalize
las
and
cosas
we
mal,
say that
es un
100% of
error.
institutions have
Pero
done
decir que la gran
things
mayoría
wrongly, it's
sí
a
ha tenido
mistake.
este problema es una
However,
realidad.
reality is that the vast
Eso es
majority
una
of
realidad.
institutions have this mistake, and this is
Hemos
a
venido
reality.
trabajando
We have
los
been
diferentes
working
módulos para tratar de
in
que la
in
alta
order to
dirección,
have a
que se
professionalization
apliquen
in
técnicas y herramientas que la hagan
high-ranking
profesional,
management, so they can
que hagan
use
que esta
tools
alta
that make them
dirección
more
fluya
professional, so this
y
uh,
que tome
higher
decisiones lo más
management
adecuado
can
posible
be
y optimice los
able to
recursos de
make
mejor manera.
decisions
El
appropriately
reto
and maximizing
es muy
resources.
grande
The event is
y
very
es muy
large,
grande
and
porque
it's very large
también
because
sabemos que
we
tenemos
also
una
know that
cultura
we have this
en la
culture,
que muchos
a
directivos
culture in
podrán haber
which
tomado nuestro
directors
diplomado
have
convencidos,
taken
pero no
this
faltarán los que lo tomaron
diplomate
porque fueron
because they
obligados
were
o por algún
convinced.
otro tipo
However,
de
there are
compromiso.
others that had to take it for other
Y en
type of
algunos casos se
commitments.
podía
And in some
identificar
cases, we
en
can
algunas de las entregas
identify
de trabajo.
this when they submit
Para
their
aquellos que no
works.
estaban
For
comprometidos
those
con el
that were not
diplomado,
committed with the diplomate, with
creo
the
que muchos
study,
no llegaron a esa, si no es que todos los que estaban ahí
they
y
didn't
no
get
tenían compromiso, creo que no llegaron a esta
here.
instancia.
They didn't get to this
Para los que
momentum.
llegaron, significa
For
que
those
ustedes
that
sí
they
presentaron compromiso.
reach
Los que
the
están aquí ahorita
end is
significa que
because they're
presentaron un
committed.
compromiso enorme
If you are here, it's
y
because
que
you
este
were
diplomado les tiene que ayudar.
showing great
Y uno de
commitment
los
and
elementos que
engagement.
vamos a
And
trabajar
this
en
diplomate
la
is going to
segunda
be
etapa
useful
de
for
nuestra
you.
sesión de hoy,
Another element that we are going
que
to
vamos a
address
ver
in the second
indicadores,
part of this
eh,
session is
tiene
that we
mucho
are
que
going
ver
to
con
be
el resultado
that
de
has to
este
do with the
diplomado.
result
Es
that
decir,
you will get from this
uno de los
diplomate.
indicadores y
One of
precisamente con
the
lo que vamos a
indicators,
terminar
and it's
nuestra
going to
sesión del
be
día de hoy más
the
tarde, es el de
the item
productividad.
by the end of this session
Y
is
yo
productivity.
generalmente les pido
Usually, I
en las
ask
organizaciones gubernamentales, en las
governmental
empresas,
organizations,
etcétera, que
corporations
antes de
that
un
I work
curso
with,
se les haga
I
un
ask them
análisis
that
de productividad
before
para que
organizing
después
or
del
giving a
curso
course, we need to have a
se
productivity
identifique
analysis. So
si la
once
productividad
the
subió
course
o no.
was given, they can
Y
identify
esto
if
se les hubiera
productivity
tenido que aplicar a
increased or
ustedes, ¿eh?
not. And this should be
En el sentido
applicable
de
to
que
you as well,
necesitábamos
because
saber
we
si
needed to
después
know
de este
if
diplomado
after
ustedes iban a
this
incrementar su
course you were going
productividad,
to be
es
able
decir,
to increase your
iban a
productivity. I
mejorar
mean,
la relación
you were
entre
going to be
resultados
able
contra
to
inversión.
increase the
Ya
ratio,
lo vamos a ver. ¿Y
results,
por qué era
and
necesario que se les
investments.
calculara antes del
Why
diplomado?
it was necessary
Para
to
que
analyze this
después,
before the course.
conforme fueran
So
regresando, trabajando
afterwards,
en sus
as you
lugares
go
de
back
trabajo
to
habitual,
your
se viera
working
que realmente hubo cambios
stations,
derivados de este
you
diplomado.
can notice that you
Los que
really
tomaron el diplomado
had
como una forma nada más
changes
de
out of this
conocimiento
diplomate.
general,
If you just
pues señores,
had
según
this
yo,
course to
si
learn
no mal
more
entiendo,
knowledge,
muchos de ustedes, si no es que casi
as
todos,
far as I understand,
este
the vast
diplomado fue
majority
pagado con
of
dinero
yours,
de sus
this course was
instituciones
paid
y
by
muchos
your
de ese dinero de la
institution,
institución, si no es que
and
todo, ha sido pagado por la
that
sociedad que
money
ustedes
was
representan.
paid by the society that you
Es decir,
represent.
la responsabilidad
The
es muy alta.
responsibility is very high.
No vinimos
We are
ni
not here,
trabajamos
we are
en
not
este diplomado
working in this
solo porque
diplomate
tuviéramos una
just
estrella más en nuestro currículum.
because we wanted to have
Estamos en este
another
diplomado en pandemia en donde el
certificate
diplomado
in
toma un
our
realce
file.
tan grande
We are
que
facing a
deseamos ver
pandemic,
mayores
so this
resultados en
course
la aplicación de los
has more
servicios
relevance.
de
We want
seguridad
to
social,
see
si
more
no de
impact
inmediato, los
in social
primeros meses
security
posteriores al
services.
diplomado.
Maybe not immediately, but
Desgraciadamente no les
some
podemos dar
months
seguimiento,
afterwards.
desgraciadamente no tenemos los
Unfortunately, we
indicadores
don't have
previos de su
previous
gestión,
indicators of your
no
management.
solo
We
suyas, sino de
cannot
sus áreas, de
follow up
sus instituciones que
this, not
representan.
only your
No tenemos
uh,
datos, deberíamos
or the
haberlos tenido
performance
para
of your
poderlos comparar
institution, because we don't have previous
y
information.
establecer que este
We should
diplomado ha
have
valido la pena.
this
Y decirlo
information
con
to make
palabras
sure
que la
that
verdad es
this
que aunque
course
nos
was
halagan,
worthwhile.
quisiéramos
We
ver
have
mejor los
received a lot of
resultados y
good
esos son los
comments,
que nos hacen
but
sentir
we
todavía mejor.
rather see results
Hay
because that will make us
instituciones
feel
que se
very
han
good. There are
volcado
institutions that
gracias a lo que han
had
visto en este diplomado y aunque en el diplomado solamente se
evolved
toca de
thanks
manera
to the
general
things
muchos
that they
puntos,
have
les hemos
learned in
abierto la
this
puerta.
diplomate. We have
Les hemos abierto
addressed
la
many
puerta al
items, but
conocimiento
we
de
have
técnicas y
opened the
herramientas que en
door
algunos casos
to
habían oído pero
knowledge.
que
We
no se
have
entendían.
provided them with tools, with
Como aquel
instruments that they didn't
famoso concepto
understand
de
before,
visión
like the
que si
so
no está
famous
calculado
concept of vision. If it's not estimated, if it doesn't have a scope, then they are just going to be motivational phrases that no one reads. When you ask the staff, what is the mission, the vision of the company? No one can understand it, or they just repeat it by heart, but they don't get it. When we are talking about techniques, tools that can help them to accomplish results. But when they are stated in a general form, they say nothing. Being the best. What does that mean? Better tell me that you are addressing 200,000 people and that you are going to address and to attend 250,000 people. That is going to be better. If we don't include, if we don't measure and we don't include indicators, we don't know how much we are progressing. How much are you going to use the resources? How much services are you going to increase? Have you analyzed this before? Do you have an idea? Well, this is the right time to do it.
Yo no me caracterizaba por tener estos discursos tan dramáticos, aunque
I was
generalmente
not
yo decía
popular
que
for all these
en esta sesión
dramatic
me pagaban por
discourses.
regañarlos, ¿no?
Uh, I was
Y
told that
sí,
I was paid
aunque
to
había regaño,
uh,
era también
scold all my
clima
students in these pep talks.
de festejo, de felicidad
Yes, it
por
is a
estar
time for
con
celebrating.
ustedes y por estar
It is a time for
disfrutando
me
su
to be
presencia, pero el
happy,
día de hoy es
enjoying your presence.
algo que
Yes.
nos
However,
compromete,
today
es algo que nos,
it's an
nos
important
llena
day for us.
de mucho pesar ver
And
cómo está la situación
unfortunately,
de todos los
we can
países
see
y ver
the
que lejos de
status of every
que se hubiera
country.
incrementado
And
los recursos
instead
para
of
afrontar esto,
increasing
en muchos de los
resources to
casos
face
hasta
this,
se
in
disminuyeron.
many cases,
Y
resources
entonces el
decreased.
reto que están presentando
Then
ustedes es
the
mayor y
pace that you
entonces
are,
también necesitamos
the
presentar
challenge that you
números
are
y
facing is
decir
even higher,
cuántas
and we have
personas
to
más se van a
present
atender
figures. We need
con
to
lo que
mention
yo
how
haya
much
podido
people
sacar de este
are
diplomado.
going to be
Porque lo que se
served.
pagó para el diplomado,
What
pues
was
igual
paid
hubiera
for
sido para
the
jeringas,
diplomate
¿no?
could be used for
Entonces,
syringes,
señores,
for
si aquí se
example. So
invirtió algo para que ustedes lleven
they
conocimiento, es para que lo
invested
apliquen,
a lot of money for
para
you
que
to
ayuden a que ese personal que tiene
implement
y
all
que
the
está
knowledge so you
teniendo
can help the staff
sentimientos, que
that
incluso en este momento
are
hay
having
ansiedades, en este momento hay depresiones,
anxieties,
ya en este
depressions,
momento hay
and
circunstancias
currently they
adicionales
are facing
a las
additional
que de por sí ya se
circumstances to
presentaban en
the
el
ones
personal.
that they presented
Pues ahora
before.
llegó el momento de que las estemos
Now is the
identificando con
time for
estas
us to
técnicas, herramientas
identify
y que
them with these
procedamos a
techniques, with
optimizar el
tools.
recurso,
And the idea is
ayudándoles
to
a ellos
maximize their
en
resource,
diferentes campos,
helping them in
haciendo
different fields,
intervenciones, porque
making
si no mal recuerdan,
interventions, because
el
if you
desarrollo
remember,
organizacional son
institutional
estos
development,
cambios
organizational
planeados,
development has to
estas
do with
intervenciones planeadas para
planned
mejorar. Y
changes,
es aquí donde el reto se ha
plan
convertido en algo
interventions
mucho
to
más
enhance.
importante.
And that's why this
Este
challenge is even
diplomado,
more important.
con estas
This
técnicas,
diplomate
herramientas,
with
por
these
eso tenía
techniques,
el
with these
objetivo de que se
tools,
pusieran
had
a
the
practicar.
objective to
Yo sé
put into
que
practice
claro que se
all these
acuerdan de mí,
elements. I know
porque
that you will
seguramente trabajaron
remember me
hasta muy
because
noche
you were
para hacer
working
las
hard,
famosas
you
gráficas.
were working
Claro que se acuerdan de
late
mí y no
to
se
make the
acuerdan con
graphs.
mucho
Of
cariño,
course, you will
que
remember me,
hicieron los análisis,
and not
pero
very
¿saben
fondly
qué? No era
because
el
you
objetivo
made the analysis. But
que
that was
ustedes
not the
me
purpose
recordaran como,
for you to
como la
remember
reina de la
me as
primavera.
the queen
El
of
objetivo era
the spring.
practiquen.
The purpose
Oigan, pero
was to
estamos en
practice.
pandemia, estoy
But
trabajando
we are
tres
in
turnos y además me está
pandemic.
exigiendo usted que
I am
practique.
working
Pues
three
señor
shifts
mío,
and you are asking me to
la nación le
practice?
está
Well,
exigiendo a usted que
let me
practique.
tell you that
Y
the
la
nation
nación le
is
exige a usted que
demanding you
practique
to
para que usted
practice,
pueda
to
dar
put into practice all these
respuesta
elements so you
a
can
muchas de las
respond to many of the
circunstancias que le
circumstances
está exigiendo
that
el
the
país.
country is demanding
Y
in
el
this
hecho de que
pandemic.
hayan
The fact that
desarrollado y
you
lo hicieron de muy buena forma, yo estoy
developed something very
admirado,
good and you did it quite
estoy
well because
admirado
I am really
de cómo trabajaron y
glad
de cómo
to
se
see the way
desarrollaron
you
en
worked and
estos días
the way you
y
developed
cómo
yourself
además de
during
eso han
these days.
enfrentado el
And
diplomado y han
besides all
cumplido
of
en
this,
tiempo y
you
forma
have been uh,
y aún
in
así
compliance with this
han cumplido
course
también con sus labores.
and with your
Señores, yo
work.
les doy un aplauso,
I
les
would
doy mi
like to
admiración,
commend all
pero
of
no
you.
les voy a
I
pedir que bajen la
admire you,
guardia.
but I'm not going to
No
ask
está que
you.
les tengamos ni piedad, ni
less of you here to have to be
Señores, es la realidad que
mercy
nos
with
tocó
you.
y si esta es la
You have to
trinchera que hay
work
que pelear para
harder.
sacar
This is
adelante a
the
los países,
reality
pues nos
that
vamos a
we
partir el
have
alma
to
todos
face.
como lo estamos
And
haciendo.
this is the trench that
Y
we are
usted es un
working in. And you
ejemplo
are
y
an
un gran
example and a
ejemplo.
great
Por
example
eso este diplomado
for
lo
that.
tienen que
That's
aprovechar,
why
por esto este
you have to
diplomado lo tienen que usar.
maximize
Por
this
eso cuando
course.
lleguen otra
That's
vez y
why
se
when you go back
reintegren
to your
de
work
manera normal a
and
sus
when you
labores,
start
después de
working
este diplomado se tiene que ver
after
que saben
this
lo que están
course,
haciendo. Por
you
eso lo
have
practican.
you know
Por
what
eso
you are
exigimos
doing.
que lo
That's
practicaran en
why
las
you
madrugadas,
practice it. That's
que
why
no
we were
durmieran
very stringent.
para
We were asking you not
poder
to
cumplir con
sleep
este
in order
diplomado,
to be in
porque era también
compliance
una
with this
responsabilidad para
diplomate, with this course, because it was
cumplir
a
con su patria.
responsibility for you to
Los momentos
fulfill with the
es
needs
la
of your
única que nos va a sacar
country,
adelante, pero con
because this is the
conocimiento.
only thing that we need that we have in order to
Y
move forward
tenemos que
and to
profesionalizar
overcome this
nuestras
crisis. We need
instituciones de
to
seguridad social.
professionalize our social security
Necesitamos que
institutions.
las instituciones de
We
seguridad
need
social
social security
cada vez sean más
institutions
grandes, cada vez sean más
to become
profesionales y cada
larger
vez
and
toquen
increasingly
más
more professional, so
a más personas,
they
cada
can
vez mejoren
outreach
más la
more
calidad de
people
vida de la
and they
población,
enhance
cada vez
the
afronten
quality of
mejor
life of the
los
population
retos
and that
que
they
ahora
can face
eran
better the
impensables
challenges that
y
were
que nos ha tocado
unthinkable
vivir.
before, but that
Les toca a
now we are
ustedes
facing them. It is
dar la
your
cara.
role to face it.
Este es un diplomado de alta
This is a course
dirección
of management
donde se toman decisiones muy
where
fuertes,
we have to make
en
very
donde hay que
important
aprender a
decisions,
tomar, a
where
calarlas.
we have to learn.
Este precisamente ha sido un diplomado que les ha enseñado a tomar decisiones y que muchos de
How
ustedes,
to
aunque ya
make
lo hacían,
decisions.
ahora tienen más
You were used
herramientas
to make
para
decisions
poderlas
before,
enfrentar de
but
una
now,
mejor forma
after this
y
course,
obtener
you
mayores
have more
resultados.
tools to face them better and to get
Toda
better
la metodología
results.
que han visto en
All the
todos los
methodology that you
módulos
have
es
learned in
importante.
every module
A mí me ha
is
tocado la de
important.
desarrollo
I
organizacional
was in
y
charge of
esta
talking
nos
about
ayuda precisamente al
institutional
enfoque de cómo
organizational
operar
development,
todo lo que se ha
focusing on how
planeado.
to operate
Que lo que se ha
everything that
planeado no
has
se
been
quede
planned.
solamente en
So
filosofía, que
it's
lo
not
que se ha
only
planeado no sea solamente un
words,
esquema vago
that it's not
y que
only
nunca se lleve a
a
cabo.
vague
Es
scheme that is not
aquí
going to be
donde todas
fulfilled.
las
In this
problemáticas que
module,
tenga el
all
personal
the
se tendrán
problems
que
that the
subsanar
staff
para lograr los
faces have
objetivos.
to be
Es aquí
overcome
donde
in
vamos a
order to
tener que
accomplish
optimizar los recursos
objectives. We
y
have to
también vamos a tener
maximize,
que tomar
optimize
decisiones muy
resources,
fuertes.
and we will have to make very
¿Ok?
important decisions.
Es aquí donde precisamente
This
tenemos
is
nosotros
where we
que identificar
have to
el gran reto que
identify
nosotros
the
tenemos.
great challenge that we face.
Y señores, pues para
Ladies
haber
and
sido una
gentlemen,
introducción, perdonarán la solemnidad,
I was
yo
very
siempre
official
llegaba
in this
vacilando,
ceremony.
riendo
I was
y
always
todo
joking,
lo demás
laughing, but
en los otros años, pero el
that
momento,
was in previous
la
years.
situación
This current
nos ha pedido que
situation
esta reflexión
has
sea todavía más profunda el día de hoy.
demanded us to be more official
Mi
and
admiración para ustedes que
elaborated
llegaron a
in
esta
this
instancia,
session.
mi tristeza por no poderlos
Congratulations to
abrazar,
all of you that made it
pero
till
qué
this
gusto que iniciemos
stage. I am sad
esta sesión
because I'm not being
con esta
able to hug
reflexión.
you. But I am also
Y yo
glad
sé
to
que
start
ustedes
with
mismos ya se la
this
habían hecho,
food for thought. I know
pero
that you
que
were
no está
always
por
asking
demás
this yourselves.
volverla a reiterar.
It is important to reiterate that. We have some technical problems in the booth. I cannot
Y
listen
de la
to him.
misma
We have
forma,
technical problems.
Maestro Díaz, ¿me escucha?
Professor
Maestro
Diaz?
Díaz,
Professor Diaz, can you hear me?
tenemos un...
pero que ellos sean la
We have no sound in the booth, in the translation booth. Sorry.
Hola, maestro, ¿nos escucha?
Sí, 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 estoy viendo que
Vamos.
se
Welcome
trabó
again.
algo, ¿no?
I noticed that I was frozen, so you can continue. Let's proceed.
Ahora
I
sí,
apologize.
les comentaba que si yo
Well,
les
as I
había
was
hecho una
saying,
introducción dramática, yo creo que
in my
esta
introduction, I was very,
técnica por un momento me
but
ha dado
this technical
el
glitch
toque que alivia un
was
poco
very
nuestra primera
timely
intervención. Y le ha dado un toque porque pues nos da una
because
posibilidad de
now
reflexionar unos segundos
we had
independientemente
time
de que las
to
cuestiones
thought
de
about
las
it,
conexiones pudieran o no
independent
brincar, ¿no?
from
Pero nos da tiempo de haber
the
reflexionado un
connection.
momento.
We had time
Eh,
to think.
chicos, les decía yo
Well, ladies
que
and
vamos a
gentlemen, I
proceder
was telling you that
a
now we are
trabajar
going
la
to
próxima hora con dos de sus
work in
compañeros
the
que
next
los
hour
representan
with two
con
of
relación a las
your colleagues
problemáticas
that
que
are
tuvieron
representing
en
you.
la
They are
presentación
going to be
precisamente de ese
talking about the
diagnóstico
problems
famoso
that
que
they
hicieron,
face in
en el
this
cual nos desarrollaron
diagnosis that they
gráficas y nos
made. They had
desarrollaron
to
varias
develop
cosas,
graphs and
sobre
several
todo
things.
para analizar todo este modelo de desarrollo
And the
organizacional.
idea was to
Vamos
analyze this
a tener el gusto
organizational
de tener a dos de
module.
sus compañeros que
Two
los
of your
representan,
colleagues are going to be
aunque
representing you.
personalmente me hubiera encantado oírlos a
Personally,
todos.
I would love to hear all of you,
Desgraciadamente,
but unfortunately,
pues no se puede por los tiempos.
this is not the
Entonces,
case. We have some
seleccionamos a
time
dos de
constraints.
sus compañeros
Therefore,
que los
we
representan. De igual forma, podríamos haber seleccionado algunos más de ustedes.
selected two of your
Este,
colleagues. We could
pero
have
seleccionamos a dos
selected
que
more,
nos
but
pudieran,
we focus
pudieran
on
apoyar
two
mucho en
representatives
decirnos
that
qué
could
hicieron, cómo lo
walk us
hicieron, a qué
through
se
what
enfrentaron
you did it, what
en
did
el
you
proceso de la aplicación de su
face
diagnóstico,
in the
de
process
aquel
of your
famoso diagnóstico
diagnosis
de clima organizacional que tenía los
regarding
elementos del desarrollo
organizational
organizacional.
environment
Mis
containing
compañeros que nos acompañan,
organizational development
serán
elements.
Carmen Domínguez
Carmen
Hernández
Domínguez
y
Hernández
Randall José
and Randall
Chavarría
Jose Chavarria are the
Flores.
colleagues that are going to represent you.
Y ellos nos harán
They,
el honor, bueno, yo tengo el honor sobre todo,
well,
de
this is an honor
presentarlos
for me.
y de
It is
leer
an
una
honor for me
pequeña
to introduce them,
semblanza de cada
to
uno de ellos.
read their
Y le vamos a pedir en
resume,
primera instancia, primero
and
leeré un poquito su semblanza,
I am going to read
porque la verdad
their
es que siempre es un
resumes
orgullo
because it is
hablar
always an
sobre,
honor
sobre
to
gente
talk
tan
about
querida, ¿no?
dear
Y
people.
ellos los representan a ustedes como
They are
pudieron
going
haber
to
sido cualquiera de
represent you,
ustedes.
but you
Me voy a
can be
permitir leer un poco
representing
de la
others as well.
semblanza
I am
de
going to
cada
read
uno
this resume,
y ya los están viendo
resumes.
ustedes ahí a cuadro. Ahí está Carmen,
They are
Diana,
already
Randall.
here. You can
Y
see in
ahorita
the
vamos a ceder
screen
ya la palabra a alguno de ellos,
Carmen,
pero primero
Randall,
leeremos
and we
una
are going to
semblanza
give
sobre
them the
cada
floor
uno de
in a
ellos.
moment. But first, I
Nos
will read the
acompaña
resume.
entonces Carmen Domínguez
Carmen
Hernández,
Domínguez Hernández
médico
is here
cirujano
with
por la
us,
Facultad de Medicina
surgeon
de la
doctor
Universidad
by the School of
Autónoma de
Medicine by
Campeche,
the
con una
Autonomous
especialidad
University
médica en
of
medicina
Campeche,
familiar realizada en la
specialty
coordinación
in
de posgrado de la
family
Facultad de
medicine
Medicina
with
de la
a
Universidad
uh,
Autónoma de Campeche
post
también.
degree
Fue
by the
coordinadora
University
delegacional
of
de
Campeche.
Educación en Salud del Instituto Mexicano Social y
Regional
coordinadora de planeación y
representative
enlace
of the
institucional también
Social
del mismo
Security
IMSS
and
del
liaison
2016 a la
of
fecha.
IMSS from
Cuenta con el diplomado
2016
en
up
gerencia
to
en
date.
los
She
sistemas de salud
has
por la
a
Universidad
diplomate
Nacional Autónoma
school
de
by the
México.
National Autonomous
Y por
University.
otro lado,
On
tenemos
the
también
other
con
hand,
nosotros
here
a
we have
Randall
Randall Jose
que aquí
Chavez.
me sabrás tú corregir, mi querido Randall, siempre te he
And
dicho
correct
Randall,
me if
pero
I am
¿es
wrong.
Chavarría
I
o
know that your
Chavarría,
name
Flores?
is, your last name is
Ya me...
Chavarria or Cavarria.
Perfecto, sí, porque aquí se me
Chavarria,
fue
Chavarria. Yes,
algún
excellent.
dedito, perdóname, mi querido Randall. Randall José Chavarría Flores. Él es licenciado en medicina
Randall,
con una especialidad en administración en
physician with
servicios de
a
salud y una maestría en
specialty
administración
course
de
in health services
servicios de salud.
and another one
Los
in
dos
management of
casos
health
que aunque
services.
los
So
pudieran
both
haber
cases,
representado
even
o los representan a ustedes y que
if
pudo haber sido
they're
cualquiera de
representing
nuestros
you,
compañeros que
or
llegó
it
a
could
esta
have been
instancia,
any of
pero
our
ellos a su
peers
vez
arriving
en la
to this
problemática
point,
que
but
presentaban también tenían algunos aspectos tanto personales como profesionales
some had
que su
you know,
gestión
personal,
fuera
professional
trascendente sobre todo en el desarrollo desarrollo de estos diagnósticos. Y más, les voy a suplicar.
Work not possible to be presented in terms of this diagnosis. So before your peers start, let me tell you, after they make their presentation, we will have the possibility, and if you'd like to share some of your experiences, we cannot devote a lot of time to this because we have a tight schedule. But after your two peers are done, if some of you would like to briefly talk to me about your experience, please raise your hand. To do so, you have some control buttons to be able to do so. And at that point in time, personnel from CISS we're experiencing technical difficulties. Please stand by.
Tenemos un poco de problemas con su conectividad. ¿Sí nos escucha, maestro Díaz?
Can you hear us, Mr. Diaz?
Sí, para su diagnóstico. Ok. Entonces, sí.
No se escucha.
Sí, bueno, sí me alcanzan a oír.
Lo
No.
último no le escuchamos, maestro, si nos pudiera nada más repetir de favor ahí.
Could you please repeat the last thing you said?
Sí, que lo interesante de esto es que los compañeros nos van a
Technical difficulties. No sound coming to the booth.
Si quieren intervenir.
problema ahí técnico de su conectividad, pero adelante, por favor.
Okay, so go ahead, please.
Gracias. Y miren que tengo dos conectividades, pero bueno.
Yeah, I even have a backup internet connection, but
Disculparán
you
aquí
know, technical difficulties.
el problema técnico, pero creo que ya estamos. Y ahora sí ya.
So I do apologize for technical difficulties, and without further ado, I will now pass the floor to our peers who are rather anxious.
Primeramente a Carmen.
Carmen will be your first presenter, and she will talk about her experiences on diagnosis. If you'd like to share your screen, so we can see your presentation, everything you worked on. The floor is yours, Carmen. Thank you very much. Thank you very much, Doctor.
Buenos días a todos. Un gusto
Ladies and gentlemen, it's my genuine pleasure
nos presenta el doctor el día de hoy.
to greet you. And well, actually, Doctor's forward today was something really interesting. The participation, my participation today really makes me think because we're living a moment that's really transcendental, something that we need to think about it because when we talk about social security, in which objective
No se trata de cualquier situación, sino se trata de la calidad de la
is really important. We're not talking about any objective, but rather the quality of medical attention, apart from the patient security. So the objective needs to be very linked or very related to it. That's why the human assets are extremely relevant. Nevertheless, many times aspects of human beings allow the achievement of a goal, but especially when it comes to the quality of attention to a patient, that's when it is pertinent for us to analyze and clearly see which are these points in organizational development and even in organizational environment for us to be able to work with it. My presentation is shaped like this. The first part has to do with why carrying out this analysis of the organizational environment at IMSS Campeche in Mexico. That's where I work. Second stage, diagnosis of organizational environment. And the third item has to do with the intervention plan. This first moment, which is organizational environment, I would like to make reference and how to carry out this diagnostic. We can have different models. We saw the waste model, in which we have 6 areas for us to assess organizational environment, or another model with perspective for us to analyze it. So in this sense, we're thinking of how to analyze an organizational environment. But at this point in time, I will show you the work that we carried out in the Mexican Institute of Social Security in Campeche in Mexico. The importance of assessing the organizational environment was carried out in 3 stages. First, we gathered information. So we use the Lichtensteiner tool, which takes into consideration 6 relevant aspects for us to have a more complete sphere on how the organizational environment is manifesting itself. This was applied to all workers in the education coordination of this family medicine unit in Campeche. Afterwards, once we got the data and the surveys, we processed these 25 surveys. This was a Likert survey that allows to do or to run a statistics analysis. This was done based on each one of the items and in each of the 6 dimensions or aspects that the tool handles, the Likert Striker tool. Each of these dimensions is mentioned as it
A
pertains to each of the
continuación se
25
aplicó
items
una
it
de las
takes into
herramientas
consideration.
técnicas
Finally,
que
we
permite
applied
hacer
another
un
technical
análisis de
tool that
priorización
allows
después
us
de
to
agarrar
make a
marcadores para
prioritization
identificar del total de todos los
scheme,
ítems
which is a
cuáles eran los
Pareto
que
scheme
mostraban
for us to
el más bajo
identify which
desempeño en relación
items
a la media que se
had the
obtuvo
lowest
de acuerdo a cada
performance.
dimensión.
It's super
Y
related to the
finalmente,
means of each
llevar a cabo un
dimension,
plan
and
de acción
finally, to carry
muy
out an action
dirigido
plan
a cada una de las
geared to
dimensiones de
each
forma
of the
específica a
dimensions,
los
and a bit
ítems con
more
más bajo
specifically, the items
desempeño
with the
para poder
lowest
establecer
performance to be able
objetivo,
to establish
acciones, cuándo, responsables
objectives,
y
objectives,
lógicamente un diseño.
responsibles, and obviously providing follow-up.
En relación a este diagnóstico,
Now, as it
vamos a
pertains to
iniciar
this
con la parte
diagnosis,
del
we should
análisis de
start
cada uno de los ítems.
with the analysis of each
Para
one of
la
the items.
dimensión de estructura se
For the
contempla
structure dimension,
5 ítems. Este es el primero
this
que va en
foresees
relación
5
a las funciones
items,
del desempeño.
and this has to do
Podemos
with
observar cómo los
functions of
resultados
performance, and we
de
can
la
see how the
encuesta
results
estuvieron entre
of
bueno
these
y muy
surveys
bueno.
were between good and very good.
Para la segunda dimensión se
For our second
encontró que las
dimension,
funciones que
we found
desempeñan
that
los
the function carried
colaboradores
out by the
están bien
collaborators
establecidas y de forma por escrito.
were
También los
established
resultados
correctly
fueron
and
buenos
in
y muy
writing, and
buenos.
the
Y
results
frente a
were
ello me voy a
both
permitir
good and
señalar que esta
very
es
good.
una de
And
las
here I
fortalezas que
should
tenemos
highlight
en el
that
IMSS en
that's
relación a
one
los
of the
procedimientos
strengths that we
son
have
de
at
detalle cada
IMSS
una de esas actividades.
regarding
En
these
el
these
ítem 3, en
procedures.
las líneas de
Item number
comunicación
3
con tus jefes
is
es
the
de qué
communication
manera se
line with
maneja.
your bosses,
Aquí
how
tuvimos respuestas
these
de
are handled,
regular,
and here we have
bueno y muy bueno.
answers that range from regular good to very good.
En las líneas de comunicación con tus
Now, in terms
colaboradores son
of
manejadas
communication
de
lines
manera
with
adecuada, tuvieron
your
respuestas de
collaborators, are they
regular,
handled
bueno
accordingly and
y
adequately?
muy bueno.
We also had regular, good, and very good responses.
Y el último ítem
And the
de la
last
primera
item
dimensión de
of
estructura
the
es mi
first
puesto está
structure
designado con
dimension,
relación a las
which is
actividades de
my job
desempeño,
position design based on
estuvieron en
the
bueno y
activities that
muy
I
bueno.
carry out. The responses go from good to very
Para
good.
la segunda dimensión, que es la de
Now, for the next
responsabilidad,
dimension, which has to do with responsibility,
esta va de 6, del ítem
this
6
goes
al ítem
from
9.
item
Iniciamos con el
6 to
primero, que
9,
es la
starting with the first,
responsabilidad
which
de
is
tus
responsibility
actividades
of your
es
activities,
la adecuada
is
en
adequate
función a tu
based on
puesto.
your
Las
job
respuestas
position.
estuvieron
Responses
en bueno y
range.
muy. Tengo libertad para la
Number
toma
7, I
de
have
mis propias
freedom to make
decisiones,
my own
estuvieron de
decisions.
regular,
And this
bueno
went
y
from
muy bueno.
regular to good and finally very good.
En relación a cuando se presenta la
Next,
toma de decisiones y
when
se
there is
respeta en su
decision making,
opinión,
is my opinion
estuvieron de
respected?
mal, regular,
This range from
bueno y muy bueno.
bad, regular, good, and very good.
En el último ítem de la
And the last
segunda
item
dimensión de
of the
responsabilidad, las
second
decisiones que
responsible
tomamos han
dimension,
llevado a cabo
decisions that I have made
fueron
have been
malas,
carried out.
regular,
This go
bueno
from
y
bad,
muy bueno
regular,
en relación al total de
good,
los
and
ítems.
good.
Y pasaríamos a la tercera dimensión,
And third
que en este
dimension,
sentido pues es el de remuneración y
this
este
has to
consta
do with
pues
pay.
de el ítem 10 al ítem
And
13.
this
El
goes from
primero de
item
cuando he
10 to
tenido logros
13
y
first. When I've
reconocimientos
had an
estuvieron de muy
achievement,
mal,
my effort
mal,
is
regular,
acknowledged. That goes
bueno
from
y muy
very
bueno.
bad, bad, regular, good, and very
La
good.
manera en que soy evaluado es
The
la
way I'm
correcta y
assessed is the
tuvieron las
correct
respuestas
way.
entre regular,
The
bueno y muy
answers
bueno.
were arranged between
En
regular and
el
very
ítem
good.
12 de mi
Item
remuneración
12,
es
my pay
respuesta de mi actividad y
is a response to
responsabilidades
my
estuvieron
activity
de
and
regular,
responsibility,
bueno
or was
y muy
accordingly to
bueno.
my activity and
Y el
responsibility. This
último de
goes
los
from regular
ítems
to very good. And the last
en
item,
esta tercera
number
dimensión
13 in
de
the third
remuneración
dimension,
fue la forma de motivar mi
is
desempeño,
the way to
es
motivate
la
my
correcta, entonces
performance
estuvo
is
de mal,
correct. And
regular,
the
bueno y
answers
muy bueno.
went from bad to very good.
La cuarta dimensión es
The
la
fourth
de riesgos.
dimension that has to do with
Los
risks.
riesgos estuvieron desde el ítem 14 hasta
And
el
risks
ítem 16.
go from
El
item
primero
14
dice
to
los
16.
riesgos en mis decisiones están
First,
bien
which says the
establecidos por
risk and my
escrito,
decision are
estuvieron de muy mal, mal,
correctly
regular,
established and
bueno
in
y
writing,
muy bueno.
and this go full range from very bad to very
Los
good.
riesgos de mi actividad están
The rest of
debidamente
my activity
identificados,
are
estuvieron de
duly
muy mal,
identified,
mal,
again going
regular,
from a very
bueno
bad to
y
very good.
muy bueno. Y el último de los ítems de
And
la división
last
de riesgos es
of
los
the
riesgos
items
de
in
mis
this risk
decisiones
dimension, or the risk of my
afectan a mi
decisions,
equipo de trabajo,
affect
estuvieron
my
de mal,
work
regular,
team. This goes
bueno y
bad,
muy bueno.
regular, and good.
La dimensión número 5, que es
Now,
en relación
dimension
al
number
apoyo y las
5,
relaciones entre los
and that
compañeros,
has to do with
que
support
va de los
and
ítems
co-worker
17
relationships.
hasta el
And this
ítem
goes from item
21.
17 all the
La
way to
comunicación
item
con los
21.
compañeros de trabajo
Communication
es
with my
abierta, estuvo de
coworkers
regular,
open.
bueno y
This
muy
ranges
bueno.
from regular,
La
good, and
comunicación
very
con
good.
mis
Next,
colaboradores
workers
estuvo
adequate.
de
Again,
regular,
ranging from regular to good
bueno
and very
y
good.
muy bueno. La comunicación
Number
con mis
19,
superiores
communication with
es
my
la
bosses is
adecuada,
correct,
ese estuvo de muy
and
mal,
that goes from
mal,
very
regular,
bad,
bueno
bad,
y muy
regular
bueno,
to
tenemos
good.
como desempeño en todas las respuestas.
So we had almost full range
El
of
trato del
responses.
personal
Number
administrativo
20,
es amable, estuvo de muy mal,
treatment
mal,
of admin
regular,
personnel is
bueno y muy bueno.
correct or kind. It goes from
Y
very bad to
el
very good.
último ítem de
And
esta
last
dimensión
item,
de apoyo
this
y de relación
support
entre los compañeros
dimension,
es la transmisión del conocimiento de
this
los
transmission
colegas
of
es
knowledge
constante
of
y de buen
colleagues is
modo.
constant and
Estuvo de
done in the
regular,
proper fashion.
bueno
This
y muy
goes
bueno.
from regular to good and very good.
Y la última dimensión, que
And
es la de
last
conflictos,
dimension,
que va desde el
which is
título
conflict,
22
runs from
hasta
item
el
22
25.
to item 25.
Las formas con las que se resuelven los conflictos son adecuadas.
The way
Estuvieron de
conflict
mal,
resolution
regular,
are
bueno
adequate.
y
It
muy
goes from
bueno.
bad, regular, good, and very
Se
good.
lleva un registro
There's an
adecuado de las
adequate
causas de los
log
conflictos.
of the
Estuvo
costs
entre
for
muy
conflicts,
mala,
and that
mal,
goes
regular,
very
bueno
bad,
y
bad,
muy bueno.
regular, and good.
Prácticamente no hubo ninguna. En las resoluciones de los conflictos han beneficiado
In
a la
conflict
mayoría de los
resolution have benefited
compañeros. Ese
most
estuvo
of
en muy
your
mal,
work.
mal, regular y bueno.
It appears that goes from very
Y
bad
los
to good,
conflictos se resuelven a
and
tiempo.
conflicts
Estuvo en muy
are
mal, mal,
solved
regular
in a timely
y
fashion.
bueno.
It goes from very
Esto
bad to
sería
good.
en razón a la parte de este análisis. En
Okay, so
este
that's
momento
it
se
for
lleva a
this
cabo
portion
ahora
of the
el análisis de
analysis.
manera conjunta por cada
Now
una
we
de
have
las
the joint
6
analysis
dimensiones que incluye
by each of the
la
six
herramienta
dimensions
de búsqueda
included
y
in the
estrellas,
Lidwig
en
and
donde
Steinhardt
se
tool,
identifica
where
cómo
we're
de acuerdo a las
identifying
respuestas de
how,
esta dimensión
based
de
on the
estructura,
responses to
estuvieron
this
entre alrededor
structured
de
dimension,
regular, bueno y muy bueno, de acuerdo a
the
los 5
responses
ítems
were,
que considero.
between very bad and very good, based on the 5 items that were
En
taken into
la segunda
consideration.
dimensión de
The second
responsabilidad
dimension,
individual identificamos
responsibility, we
estuvieron en
identified that
regular, bueno y
responses
muy bueno, de
were
acuerdo a
between
los
regular,
4
good, and very
ítems
good, based
que
on the
las
4
clasifican.
items
En la
that
tercera
make up
dimensión
this
de
dimension.
remuneración,
Dimension number 3 has
las
to do with
respuestas
pay
oscilaron
for
igual
your
en
job.
desempeño, sin embargo ya empezaron a ver de mala percepción
So
hacia
responses
esto.
started going a little bit more towards bad
En la
perception.
dimensión número 4 de riesgos,
Dimension number
también
4,
estuvieron
risks.
con respuestas hasta de muy mal,
We had
como
responses
podemos
very
identificar
bad
en
that
estos
we can
ítems,
clearly identify in
y
these
por lo
items,
tanto estuvo prácticamente en un 34%
and that's
en
why
esta mala percepción.
we arrive at 34 having bad
En la
perception.
dimensión número 5 de
And
apoyo y de
dimension number
relaciones
5,
también hubieron
support and
respuestas muy mal
relationships, we also
y
had bad
resultaron prácticamente en un 40%
responses,
la
and
mala percepción.
we arrive at 40% bad
Y
perception.
en la división número 6 de
And
conflictos,
dimension number 6
identificamos
has to do with
también
conflict.
hasta
We
en
were
un
able to
50%
identify around
la mala
50%
percepción
bad perception
en relación a cómo se maneja.
as it pertains to how the
Por lo
institution
tanto,
handles
pudiéramos decir aquí
conflict.
que de una manera global,
So,
el clima
in
organizacional
general, the
y la
organizational
coordinación de la
environment
educación de
for
calidad de
the
medicina familiar
education
de IMSS en
coordination
Campeche,
for IMSS's Family
prácticamente
Medicine Unit in Campeche
obtuvo un resultado menor de 1000 para considerarlo bueno, por lo cual
got
lo
a
pudiéramos
result
estar
under
indicando como
1000.
regular. Y
So,
vuelvo a decir aquí en el punto
we
de lo
could
que nos
say
señalaba
the result is
Dr.
regular.
Francisco en relación
And like
a
Dr.
que
Francisco
el
before me
servicio
mentioned,
social no
the
basta
link
nada
to
más con
social
estar
security is not
trabajando,
enough
pudiéramos decir de una manera
about
conformista, que
just
bueno, es regular,
working. And
pero ¿qué sucede ante los
we might
cambios?
tell saying, okay, this is
Necesitamos
regular, but what
tener
happens when
esa
we need to have that
recursos humanos,
certainty
esa parte del
that
desarrollo
our human
organizacional
assets, that the part
realmente
of
está
organizational
logrando los
development
objetivos
is actually
de una
achieving
manera de
the
tengamos
objectives
calidad en la
in
atención
such a
médica,
way
que
that
tengamos
gives us,
seguridad en el
still gives us
paciente.
quality in medical attention and security for our patients.
A continuación se llevó a cabo la priorización de cada
Afterwards,
uno
we
de los ítems y
prioritized
podemos
each of
observar
the
en la
items,
serie
and here
de
we
la
can
línea
see
roja cómo dónde se ubicó el
in red line
80 del Pareto de los ítems que mostraron el desempeño en relación a la
for
mayor
these items on the
frecuencia
Pareto
de
diagram.
negativos. Entonces, en esas respuestas negativas
So,
estaríamos ubicando
negative answers
prácticamente nosotros lo
go around
analizamos por ítem.
80%. And if
Serían
we
los
analyze
ítems
this on an
que
item
tienen el
basis,
más bajo
these are
desempeño
the
y
items
que si lo
that perform the low.
dimensión,
And
pues
if we
serían básicamente la dimensión de
break this down in
riesgos,
dimensions,
y de
I think
relaciones
that
y de
risks,
conflictos.
relationships,
Esas
and
tres
conflict
dimensiones.
resolution will be three with the lowest performance indexes.
Para ello, entonces, establecimos la tercera parte, que
And
es
for this
la de
purpose, we
la
came up with the
intervención
third
en
part, which is an
relación
intervention plan.
a este levantamiento de la encuesta.
regarding this survey
hacia la
gathering,
priorización.
analysis, and prioritization.
En este primer punto identificamos el
So,
trato
in this first
personal
point,
administrativo. Y
we
si nosotros nos
identify
referimos al
treatment
trato
of
del personal
admin personnel.
administrativo,
If we talk
este
about
es algo
this,
fundamental
I think
porque
this
no
is
solamente se trata
fundamental
de
because it's not
mejorar ese
only
trato
about
amable, sino de
improving
fortalecer
that
el
kind
clima.
treatment,
Y si
but to
hacemos un
strengthen the
recordatorio acerca de lo
environment
que
as
nosotros
such. And
manejamos
we make a reminder of what
en esta dimensión de
we
apoyo y
handle
de
in this
relaciones,
support
podemos
dimension
nosotros
to
identificar que es
relationships, we can
necesario
identify that it
mejorar
is
esos
necessary
canales de
to improve
comunicación y que no
upon these
nada más es
communication channels,
formal o informal, sino que también tenemos que
because
establecer
it only
un
shouldn't be formal
sistema
or
de
informal,
servicio
but
porque
rather we should
nuestro
establish some
cliente
sort of
interno son
service system
precisamente
because our
ese
internal
recurso
customer
humano en donde se trabaja en medicina familiar,
are
que es
these
quien va a brindar esa
human
atención.
assets who actually
Entonces,
work
de tal
in the
manera
family
que se
medicine unit
propone
providing the
llevar
attention.
a
So
cabo un taller
what
en
we
donde se
propose is
vuelva
carrying out a workshop
a establecer esas políticas
where
de
we
cómo se va a
reestablish these
trabajar
policies on how
y
we're
con un
supposed to
taller
work
de una manera totalmente que quede claro cómo se va a llevar a cabo
for
la
everybody to be on the
comunicación,
same page
tanto
regarding how
formal
the
como
communication should
informal,
happen, both
cómo
formal
va a ser ese
and
sistema
informal,
de
and how
reconocimiento
this
para
acknowledgement
ese
system
cliente interno que son
should happen
nuestros
for this
trabajadores.
internal customer, which are
El
our workers.
segundo punto que se tiene
Now,
que
the second
trabajar,
item that we need to
de hecho
work on,
ya se trabajó, es
actually it
la
was
parte de
worked,
los riesgos de las
has to do
decisiones que
with
afectan en
risks
su equipo de
about
trabajo.
decisions making
Recordar que
an
la parte de
impact
los
on my
riesgos es
work team.
fundamental
Of
porque
course, we need to
aquí
remember
fue
that
una de las
risks,
dimensiones
or this
más
portion is
bajas
fundamental. This
en
was one of the
Argentina de
lowest
menor desempeño en
scores
cuanto a clima
in terms of
organizacional
performance when it
y lo
comes
cual
to
denota que existe mucho
organizational
riesgo en las
environment,
decisiones,
which
de
showcases
tal
that
manera que hay que
there are
hacer
many
una
risks
búsqueda
in decisions. So
intencionada
we need to
de
make
esos
an
riesgos en la toma
intentioned
de
search
decisiones,
for
pero
these
no
risks
nada más
in decision-making
identificarlas, sino que
process,
hay
but
que
not only
hacer un
pinpointing them,
análisis
but
estadístico
rather coming up
de
with
estos
statistical
riesgos que se estén
analysis of
identificando
these
para que
risks that
entonces
we
a
have
través de esta
identified.
matriz
So
en
through
donde
this
se van a priorizar
matrix
en
in
relación a
which
su
we will
impacto y
prioritize
la
them based
probabilidad
on
de lo que
their
se esté
impact and the
mostrando
likelihood of
de
what we're
cada uno de
showing
estos riesgos, entonces
for each of
permitan
these risks, then
abordarlo de una manera
we can
adecuada. Y
tackle them in
que
a better
entonces
fashion.
esto se va a relacionar más adelante con los
And
otros
this
ítems que también
will
fueron
relate to
afectados.
the other items that
En
will
relación
also
al
affect
tercero, que
it.
se lleva a
Now, as
cabo
it
un
pertains to
registro
the third
adecuado de los
item,
conflictos.
whether
Esta es una
an
parte sumamente
adequate log
importante
of conflicts
porque al
is
momento
maintained,
de
this is very
identificar estos
important because when
conflictos, pues
identifying
se
these
necesita
conflicts,
analizarlos,
we need to analyze them.
identificar cuáles son
We need to
esos conflictos
identify
que para
which
ellos
are
es
these conflicts.
relevante que los
And
documentemos.
for that,
Porque
it's
si no, pues
extremely
nada más
relevant for
quedan
us to
en la
document
memoria
them
y se
and log them.
olvidan y no se llevan a
Otherwise, they're
cabo
left to
acciones
memory,
específicas
they're
para mejorar
forgotten, and
estos
no
riesgos.
specific actions are
Entonces,
carried out to improve on
el
this.
análisis de esas causas de los
So the analysis
conflictos
of
y
these causes for
documentárnoslo nos va a
conflict
permitir entonces
and
que podamos
documentation
clasificarlos
thereof will
y
allow
de
us
esa
to classify them.
clasificación que se
And
obtenga,
out of that
ahora sí,
classification that
establecer
we get afterwards, we will
metodología,
be able to establish
para ese
a
análisis. Y que en
methodology
este
for
punto
this analysis.
pues es fundamental.
And
Aquí
this
se
point
habla de qué
is
patrones pudieran
fundamental because
estar
here we're talking
considerando
about
para el
which patterns
establecimiento de
might
algunos
be
conflictos o qué
uh,
tendencias pudiéramos estar identificando
aiding
en algunos
certain
momentos o
conflicts
de la inercia del
or
mismo
increasing
trabajo que se va
conflicts,
llevando a cabo.
or whether it's the very momentum of the day-to-day
El
work.
cuarto ítem
That's one of the
que se
factors.
trabajó fue los
Item
conflictos
number
se
4 that we
resuelven a
worked on
tiempo.
has to do
Al
whether
momento de
conflicts are
establecer
resolved in a timely
la
fashion. So when we
documentación y
establish the
una
documentation
metodología de
and
análisis,
a methodology for
entonces
the
debe de
analysis,
existir un reporte
then
de atención de los
there needs
conflictos y
to
que
be a
coadyuva
report
prácticamente
attention to conflict,
para la
something that would
solución
help
de estos.
to
En
reach
la
a
parte
solution
del
of said
ítem número
conflicts.
5 que se está trabajando en
Item
este
number 5 that
plan
we're
es
currently
los riesgos
working
en
in
actividad
this action
están
plan
debidamente
are risks
identificados y es
in my
aquí en
activity
donde
are duly
se
identified.
establece
And this is
un
where
plan
we
de
can
acción,
establish
un
an
plan de
action
acción
plan.
en donde pueda haber un
An action
sistema
plan
que
where we
permita
can
establecer
find
los
a
tramos de
system that allows to
responsabilidad de cada
establish
uno de los
the
trabajadores
different areas
para
of
que entonces
responsibility of
se
each of
pueda
the workers
mejorar ese clima organizacional.
so we can actually improve
Las
upon this
formas en las que
organizational
se resuelven los
environment
conflictos
and
son
ways in
las
which conflicts are
adecuadas. Entonces,
solved
no
are
basta nada
adequate.
más con
So
documentar, no
it's not
basta nada
only
más
enough
con
documenting,
analizarlas
it's not
o
only enough
colocarlas,
analyzing
sino que
or
también la
classifying them,
metodología de la
but
resolución de
the
los conflictos.
methodology of
Y
conflict
aquí es donde surge,
resolution
por ejemplo, la
needs to
negociación
be in place. That's
y la
where
participación de
negotiation
manera
comes from,
bilateral
and
entre la empresa, el
you know,
sindicato
the
y el
link
recurso
between the
humano que lo
company
vamos a
and
tener en
the
medio de
employees
esta
or human
responsabilidad. Entonces,
resources.
es fundamental
So it is
esta acción.
fundamental
Y por
taking
último,
taking carrying out this action. And last, the rest of my decision are properly written down. So this negative impact, in which in one word or the other we can stigmatize the risk actions of
no debe de
role
quedar ahí, sino al
taking
contrario,
place shouldn't be
debería
left
quedarse en la
there,
solución
but on the
de estos
contrary,
riesgos,
that
haya
should
una
also be
especie de
part of the
estímulo que
solution.
permita al
I
trabajador
mean,
el
there
reconocimiento
should have
y
be
que este
some sort of
coadyuva con la
stimulus
tercera dimensión, que es la de remuneración y de
linked also to the third
reconocimiento
dimension,
al
which has to do
trabajador.
with payment and acknowledgement of one's work.
Con base a esto, pudiéramos
So
entonces
based on this,
concluir que
I could
la
say, or we could
percepción
say that
de la
the
coordinación en ese
perception
momento puede
of the
regularse en
coordination
relación
at
a
that
las
point in
dimensiones
time
con más bajo
is
desempeño, que fue
regulating
la de riesgos, la de apoyo de
items with the
relaciones
lowest
y la de conflictos.
grades.
Sin embargo, con el plan de acción
However,
se
with the action
permitió
plan,
coadyuvar y
we were able to
mejorar el
help,
clima
thus
organizacional
improving the
de esta unidad de
organizational
medicina familiar.
environment in this
Con el
family
propósito
medicine
de
unit with
acuerdo a que es una
the
institución de
purpose.
seguridad social,
And this is
lo que
a social
podamos
security
otorgar sea una
institution, so
atención de
for us to be
calidad
able to render
para el
a high
derechamente, para sus
quality pension
familiares
for the right
y
holder
sobre
for
todo
his or
ante
her
una
family
situación tan
members,
detonante
especially before
como son los
such
cambios
an
eventos
important
epidemiológicos
situation like
con los cuales se está
epidemiologic
enfrentando este sistema de salud
situations we
y
have been
detonar el
faced
miedo en los
against.
trabajadores a que de repente se pudiera tener una negativa de atención hacia nuestros propios pacientes. Y en este momento nos
And at this
gustaría hacer
point in time, I would
una
like
reflexión
to
acerca de la
make
cita
a
que
brief
incluso Warren y
reflection
Bernis en uno de
of
los
Warren
documentos
Bailey's
que
quotes
tuvimos oportunidad de leer
in one of the
desde
documents that we had a chance
1969
to read.
señalaba
These dates back
que
to
uno de los
1969.
principales puntos
And
es la respuesta al
they
cambio.
said that one of the
Es una
main points,
compleja
most
estrategia
important points,
educativa
response
estudiar
to
el
change.
desarrollo
This is a
organizacional
complete
porque es lo que va a permitir
academic
que
response
podamos
in
adaptarnos a esos
understanding
cambios, a
organizational
esos
environment that
retos,
will allow
a
us to
estos ritmos
adapt to these
vertiginosos en los
changes,
cuales
to these
nos
very fast
encontramos hoy
speeds
en día.
of
Esta
response in
cita es de
which we were faced
1969, pero es
against
muy
today.
ad
So
hoc
this quote
a la situación
goes back to
epidemiológica a la cual
1969,
nos
but
estamos
it's
enfrentando
very
hoy
pertinent to
en
the
día
epidemiologic
y en el
situation
cual
we're
es
facing
imperativo
nowadays, in which
mejorar
is
y
imperative. It is
fortalecer el
mandatory
clima
for us to improve and to
organizacional
strengthen
en
the
todas las
organizational
instituciones,
environment in every single
más aún
institution,
en aquellas que
even
están
more so
vinculadas
in
a
those
la atención a la
institutions
salud.
linked to
Gracias.
health services. Thank you very much.
Mi querida Carmen, muchas gracias.
Thank you very
Nos
much.
has mostrado, nos has mostrado muy bien
You very clearly
cuál
showed
fue la
us
metodología, los puntos que
which was the
encontraste.
methodology, important points
Volvemos
you took into
al punto
consideration.
que
And
hay muchas cosas que tienen a
I mean,
favor,
going back, there are many
que han
things
trabajado muy bien y eso es bueno.
for your
Pero
work.
tú
That means that
misma
you've
detectaste una
worked
serie de áreas de
very good,
oportunidad
but you yourself
que
detected a series of areas
precisamente
of
para el
opportunity.
desarrollo organizacional es
And
básico
precisely
para generar un
are
plan de
basic
intervención.
for
Y
the
la propuesta
organizational
que haces del
development to
plan de
come up with an
intervención,
intervention plan.
a mí
Your
me
proposal
gustaría,
of
claro que
intervention
habrá
plan,
que
I would like,
profundizarla,
of
pero me
course, we
gustaría
would need
que
to go deeper in this,
realmente la
but I would
pudieras
like for you to be
mencionar,
able to
llevar a
mention it a little
cabo,
bit, to carry it
presentar
out, to
con
present
quien tuviese que ser
in some
para que
way,
se
shape, or
mejore.
form with whichever
Desgraciadamente,
stakeholders.
volvemos a ver que hay muy
Unfortunately, though,
poco
we see again that there's very little
registro de las tomas de
registry or log of
decisiones
decision making.
que se han hecho. Ya hay que empezar a generar
And we need doing something
los
about it because
países
I don't know
salones sí,
what's wrong with
todo lo registran y nosotros nos burlamos de
with
ellos, pero
Anglo-Saxon
a la hora
countries.
de la
They
hora
log
es cuando ellos
everything.
dicen, este modelo generalmente nos da resultado así.
But
Y
at the end
nosotros
of the day,
estamos
they say,
viendo
"Oh,
que
usually you get
hay
good
tomas
results
de
with this model."
decisiones que
And
han
we
sido
see
muy
that there are some
exitosas y otras
decision-making
terribles
processes that
que
turn
al
out
no
to be
quedar
very successful,
registradas, como
and
bien
some
lo
others
mencionas
that because
también
they're not
en el
logged,
caso
like you
tuyo,
correctly mentioned in your case,
pues no nos ayudan tanto para
don't
las
really
próximas
help that
decisiones
much,
a
at
tomar,
least
¿no?
for the next
Sin embargo, el
decisions
ejercicio que
to be
hiciste
made.
a mí me gustó
Nevertheless,
en el sentido de que
your
entendiste la
work I
metodología,
really like
que la
because
puedes
you understood the
replicar, que lo
methodology.
puedes
It's you can
comparar los
replicate it.
escenarios que
You
estás
can
presentando ahorita
compare the
con el
scenarios that
mismo
you're
estudio
presenting right now
hecho en un
with the
periodo
same
más
study,
adelante,
but done in a
ver
further
realmente si va a
time
haber
period, and see if there's
si
actual
hubo en el
correlation
plan de intervención, que
and
además
what happened with
ahorita
the
que
intervention
terminemos,
plan.
vamos a empezar, yo les voy a empezar a dar una serie de
And
indicadores que les van a
further,
ayudar a
afterwards,
tomar
I will give you a
de
series of
estas
indicators
decisiones,
that
de estas
will allow you to make out of
decisiones
these decisions
y acciones
or
que
actions
tienen un costo.
that, of course,
Vamos a ver qué tanto se
have a
mejoraron
cost.
después del plan de
We'll be able to
intervención
see how much
para
improvement
entrar a un
there was after the
sistema que
intervention
de
plan so that we
desarrollo
can go into
organizacional
a system
propicie la mejora
that's
continua.
in that organizational
Entonces,
development
esa es la
provides for
idea
continuous
y
improvement.
por eso
So
para
that's the
mí ha
whole
sido
idea
muy
behind this,
valioso
and
que
that's why
nos
It was very valuable that that you shared your work with us, and I mean you've done your work great in your medicine family medicine units, and that goes for everybody. We cannot only stay or stick with what we've done correctly. So all my customers and all the people we provide support to. I mean, whatever you've done correctly, that's why I pay you for, and you need to correct what you've done wrong. So again, congratulations, congrats on your presentation. You've been a great representative for the rest of your peers, and I will complement what you said with Randall's work. He's in Costa Rica, and he will talk about how he developed this, how he came to be, and the compliance to what we've established so far. I mean, this virtual session has to do a lot with development and growth, organizational development and growth of institutions and personnel to be able to achieve this organizational development as a change strategy, something that actually triggers that continuous improvement process. And that's with the tools that we'll see in just a couple of minutes after Randall's presentation for us to be able to complement diagnosis. And ladies and gentlemen, we need to professionalize management even further. Carmen, thank you very much. Now I will pass the floor to Randall.
Con esta agenda que tenemos muy apretada, pero con mucho gusto. Randall, adelante.
Bueno, muy buenos días a todos, maestro, doctor, panelistas, compañeros. Un placer aquí desde Costa Rica. Pues igual el tema corresponde a clima organizacional. Antes de hablar del clima, pues no podemos dejar de lado lo que corresponde a lo que es cultura organizacional. Y este es un tema sumamente porque esto me recuerda el hecho de que
it's a reminder to me of the fact that I started working in the health area and now I am the director of that area. And I was promoted from the hospital in the border to the hospital in San Carlos. Now my position is director of the network. I am talking about this because the culture depends on the location that I am working with, the values, the way I need to treat others, the users, the staff varies a lot according to the place that I am working with, because this is defined not only by the way we perceive things, but also by the people that we work with. So the organizational environment is just an element of the organizational culture. With this, we can see how we can deal with different environments according to the place that we are located. So we can find some elements, and I am not going to elaborate in the theory because we all know all of this. However, it is important to mention the mission that we have as on an organization in every place. Mission, vision, value systems, and working habits. We have been working about that. Ceremonies, and these are the ways that we are going to incentivize and recognize users and staff. Organization, communication, as I was telling you, this is going to vary according to with whom we are dealing with. If we are talking about with collaborators or if we are talking with an external user. And the characteristics of the top management. And now let's talk about organizational environment. It's the result of the influence of different culture factors, the way we develop as people, as director, the way we behave. This is a mixture of qualitative and quantitative elements that are going to give us a way to face different situations in our jobs. What are the aspects that we need to take into account for our work? The professor was very stringent. At that moment, I was uh, sick and I had to work. We will remember a professor because he was very stringent. But here we are going to be talking about a structure, individual responsibility, and the money that you are receiving back from your work, risk from your work, support, relationships, and at the same time, conflict. Within the organizational environment, we have important elements to take into account: resistance to change and conflict, because these situations can split people. When I was a doctor and I became uh, staff, well, you notice that there is resistance in the middle management levels because they have a specific way to work. They have been working like that for many years. With the change, of course, they felt afraid, they were concerned. However, at the very end, we were able to show to all of them that if we all work together as a whole, we can accomplish all the objectives. So we have noticed that there is always resistance to change. This is a characteristic of human being. It's understandable. And there are different types of modifications. How to fight against this? With education, a great communication with officers and with users, because at the end of the day, the way one director works can vary. So if we have an open communication, people could understand us eventually. And in order to have engagement and commitment from the teams, they have to be interested and we have to facilitate everything in case sometimes you need to negotiate with them because not all the time the top manager has the right answer. All the stakeholders have to be involved in the decision making process: manipulation, election, and coaction. Conflict, as I mentioned before, conflicts are generated for because there are some different points of view of, or the institutional environment was already affected. And now let's elaborate on how to diagnose the organizational environment. We need to collect information, process all the data. We did that because the professor requested us to do that. This is an important part of the process. And we found different steps: defining objectives, defining the staff that is going to be answering the questionnaire. We are going to be collecting information. We have to collect the data because what is the purpose of having a questionnaire if you are not going to analyze? Otherwise, it's going to be dead letter. And institutions, intervention plans to define the strategy, identify action points, schedule activities, defining participants, identifying sequences and resources that are going to be necessary. From there, we can have our analysis, and I did the analysis in the health area of the Santa Rosa Hospital where I work in. In this slide, you can see the location It is surrounded by the main districts, and we are in the border with Costa Rica. Uh, 1,500 and 5,000 kilometers. These are long distances that we need to cover, and we covered 33 100,000 inhabitants. You can see in the slide the location where we are. North, we have Nicaragua, and we have a border with the other country. In Santa Rosa, we have 29 officers. This is the organizational chart. Medical director in the top with the management. We have good communication with the health board, the health committee. It's an external entity. The people telling us what are we doing good, the administrative part and the medical part, external consultation, medical logs, supporting jobs like social work, nutrition, pharmacy, lab, and we did an interview with doctors in the ER and in their offices. This is one of our nearby communities. You see how our officers are multitasking. On the right hand side, you see the microbiologist doing some tours around the communities, and we are outreaching the community. We have a great team. In the Santa Rosa Hospital, we had to work hard. This is the table of content. Uh, my study included 55 pages from the introduction till the references, including all the aspects that the professor recommended. The instrument that we used had 25 questions broken down in different aspects. And we had a color coded system um, according to their points that were allocated. The medicine service in Santa Rosa, as you can see in the screen, was in green. So we didn't reach the best score. However, we were close to that. Maybe you will remember that the scoring, if it was between 2 points, the highest and the lowest one, you can have a ratio. Look for goals for improvement. So we considered that everything was fine in the medical service because 4 years before, I was one of the general doctors of this team, and then I became the boss. So we consider each other as friends. When we have to make decisions, we'll do it, of course. But we have a way to work that is very open and friendly. So we work as a team very good. This was very important. We also did the information analysis, including the 5 concepts that we mentioned before. We included staff doctors. The maximum score was 1,250, and in total, we get 1,129 scores. I don't know if the professor considered this, but the 10 doctors that we analyzed in this study, one of them had the lower score, 84 out of 125. So this is one of the specific situations that we noticed. I don't want to elaborate in this area. These are just tables. Here you can see some figures and numbers, but you can see that the structure was the one that had a better score with 230 scores. And of course, there is individual responsibility, 170 scores, where that's why it's located in the column of good scores. A doctors were always having this sensation that they didn't make enough money and that they that the risks were higher. However, the score resulted in a good score. Relationship support, together with a structure, were some of the highest scores. Doctors are recognized in along with all their peers, but when they have some feedback to receive, this is done individually. At a national level, we have been improving because we were in the first percentile, the lowest one, and now we are in the third one. So we have uh, increased 60 positions thanks to the effort of the doctors and the staff that has been a work team comprised by doctors, nurses, pharmacists, and another item, conflicts, 179 scores. How did we define in which aspects we were going to be working with? Well, we were focusing on structure, individual responsibility, um, profit, risk, support, conflict. Support and relationships were one of the best. The medicine service is working quite well. They perceive that they have the support from the top management, not only from doctors, but from the administrative side as well. We have worked hard on infrastructure, medical equipment, comfortness, and that makes them feel valued and they can work in better conditions. We have prevented this. This type of suggestions are eliminated. Move from here. I can do it better than you. You have to do it as I do it. We eliminate this type of advices because this is not going to help us to accomplish our goals. And this is one of the items that maybe was very interesting for the professor, even though we are in a very appropriate level in the green line, we are considering the lowest scores so we don't go back to the yellow stage. We want to move forward to the better position. So we are the leaders of a work team. And in this questionnaire regarding the organizational environment, we apply it every quarter so we can have improvements in everything that we found. Support, communication, and infrastructure were the best one. Uh, Conflict and individual responsibility are items that have to be that can be improved. We need to find a way to deal with them differently. Conflict. Some doctors felt that they were managed differently. So now we are going to focus on standardizing everything and the intervention plan. We built a work team and we work on the three most important aspects. We surveyed 10 doctors. The lowest score was 84 over 125. We discussed this with the doctor about what are the things that we have to improve, or what are the things that he has to improve. We reached a score of 1,129 out of 1,250. The idea is to reach the 100%. That's the goal for every institution, I think. And as a conclusion, being a top manager applies not only in our work, but in every area of our work. For there's not a great chef, but a great team. At the end of the day, the top positions have to work even better. I would like to thank all of you for your participation. I would like to thank Professor for selecting me, and thanks. Thanks so much.
Muchas gracias, mi querido Randall.
Thank you so much, my dear Randall. Thank you.
Ya nos dio hambre lo que estabas preparando ahí como chef.
Now I am
Oye,
hungry after watching all these delicious things that you were preparing as a chef. Well, that was just an image, just a brush of my other activities. What is interesting about this case? Well, usually we were analyzing cases that were located in cities that face a very important problem because of the large number of users. But in the case of Randall, it is important to mention that he developed his work while he was sick. And that was a very important aspect because he was an example. There were other colleagues that were sick, but I remember his job of his work, the analysis that he did. And I remember that he was sick while he was doing all this analysis.
No que haga un sacrificio hasta la muerte, ¿no? Pero sí que hagan, que tengan ese compromiso y que el compromiso haga que se trascienda, ¿no? El diagnóstico que efectuó considero que le puede servir a él y le puede servir a los otros que vengan detrás de él. Cuando Randall, espero yo que crezca todavía más y que se vaya a otros ámbitos y que digo estas metodologías para aplicarlas en otros ámbitos y que deje esa huella, esa metodología de trabajo que esté identificada. Algo que decía el esquema de remuneraciones. Señores, nos queda claro que estamos optimizando recursos, que no hay dinero para otorgarle más a la gente porque lo queremos, pero no siempre se puede. Pero el esquema de remuneraciones son muchas cosas. Una remuneración puede ser una remuneración en dinero que todo el mundo la necesita, pero que también 15 días después o 2 meses después, pues la gente si gana más empieza a gastar más, ¿no? Entonces está comprobado que sí hay que dar estímulos económicos, claro, no los vamos a negar, pero que el estímulo económico pues hace que también de repente no sea la única forma, ¿no? La forma de remunerar también al personal puede ser de muchas formas, ¿no? Nosotros teníamos incluso en algún lado, implementamos torneos de dominó, de ajedrez, ahora con los videojuegos, hasta de videojuegos si el personal era joven, y había muchas formas de hacer que ellos, digo, estos son ejemplos burdos que tal vez dirá, bueno, eso no se lo puedo dar a un médico que tiene 24 horas trabajando, pues cómo lo voy a poner a jugar, ¿no? Pero a lo que voy es que puede haber muchos otros estímulos si se identifica qué se quiere, de qué es aficionado la gente y con base en ello tratar de apoyarlo, ¿no? Dar un espacio para que tenga una oportunidad de estar con su familia, con su esposa, tal vez una vez al mes, también puede ser una forma de reconocer, remunerar el esfuerzo. Hay muchas oportunidades que se pueden manejar para subsanar esto, porque sí es un hecho que recursos no tenemos. Eso es tal vez la constante de las instituciones de seguridad social en toda Latinoamérica. Recursos no tenemos. Y no va a haber más. O sea, por más que estemos platicando, que aquí hagamos una disertación de muchas horas, no va a haber más recursos. Y dentro del esquema de desarrollo organizacional, pues nos damos cuenta que esa va a ser una constante todo el tiempo. Entonces, ni modo, a presentar lo que tenemos y con lo que hay que hacer maravillas. Y pues ese es el reto, ¿no? Carmen nos presenta un escenario también muy fuerte, pero con muchos logros, igual que Randall, en dos escenarios completamente diferentes y sin embargo tienen muchos puntos de confluencia. Carmen, que aquí ya la vemos, qué bueno que ya me la ponen ahí para que la veamos y muy bien cumpliendo con su protocolo de seguridad. No me resta a los dos más que agradecerles mucho. Les pido que no se vayan de la cámara si es que hay oportunidad en un momento, porque le voy a pedir a algunos de sus compañeros, no tenemos mucho tiempo, unas 2 o 3 intervenciones, que nos ayuden también tanto a comentar lo que ellos vivieron y que podamos efectuar una pequeña mesa de
Perdón, tenemos un poco de problemas con la conexión del maestro Zamudio. Vamos a
la que se cayó.
Adelante.
Veamos. Digo que la que se cayó con mis conexiones. ¿Ya me oyen?
Así es.
Bueno. Les digo que ando brincando en mis dos conexiones que tengo para precisamente trabajar y bueno, siempre pasa eso, ¿no? Es la ley de Murphy. Pero bueno, entonces, si alguien tuviera por ahí alguna intervención o ganas de participar adicionalmente, si quiere poner por ahí su manita, para que nos pudiera complementar de todo lo que también ustedes hicieron y por lo cual no durmieron, adelante, si gustan poner ahí su manita para que les habiliten el micrófono. A ver aquí si hay algún compañero que quiera participar adicionalmente. Mi querido Randall, mi querida Carmen, parece ser que sus exposiciones fueron tan contundentes que sus compañeros se han quedado maravillados, recordando lo que ellos mismos hicieron. A ver, tenemos por ahí a alguien, a Carlos Alberto, por ahí, o alguien que quiera por ahí participar.
Buenas tardes a todos y a
¿Qué
todas.
tal? Adelante, Carlos.
Bueno, profesor, pues gracias por su módulo. Realmente fue de gran aprendizaje durante el periodo que estuvimos realizándolo. Lo del clima organizacional es algo importantísimo siempre en toda centro de salud o organización. Hay que estarlo trabajando, no es algo que está estático, sino hay que estarlo siempre supervisando. Me interesó mucho tanto la intervención de la doctora Domínguez como del doctor Chavarría en el sentido de que resaltaron exactamente la importancia de ese recurso humano que ellos tienen y cómo ir fortaleciendo exactamente esas debilidades detectadas para ir mejorando cada vez más. Como dijo el doctor Chavarría, es importante, si bien es cierto, la remuneración económica, a veces no podemos desde nuestros ámbitos, pero sí tratar de ir buscando esas formas de remunerar al personal de una forma de incentivarlo a seguir trabajando y que eso pues genere mejor producción y mejor clima organizacional para todos. Más en instituciones como las nuestras que están al servicio de personas y que debemos de que nuestros funcionarios estén realmente en un verdadero clima organizacional adecuado para que su servicio hacia la comunidad sea mejor. Me interesó mucho que el doctor Chavarría dijera que detectó a un funcionario que realmente tenía unos parámetros diferentes al resto y que ese pues llegó y se sentó a hablar con él para ver exactamente qué era su perspectiva y qué era lo que estaba pensando y cómo manejar exactamente esa situación que él estaba en ese momento. Tal vez que con, no sé, desconozco mucho el fondo, pero muchas veces a veces mala comunicación que se da y una mala interpretación y a veces es acercarse a hablar y a conversar con lo que uno necesita en estos casos para mejorar. O sea, algo muy pequeño a veces puede ocasionar una gran tormenta. Entonces, esa es la gran importancia. La doctora Rodríguez me gustó mucho su intervención. Realmente se ve que trabajó con los colegas, con los médicos de familia. En mi clínica yo trabajo mucho con médicos de familia. Sé la mística y el trabajo que ellos desempeñan y por su especialidad y formación realmente tienen muchas habilidades blandas que se pueden desarrollar y explotar en ellos. Entonces fue muy interesante también su intervención.
Y mi querido Carlos, y
So,
tú, de lo
Carlos,
que tú viviste,
out of what you lived,
platícanos un poquito.
out of what you experienced, please
Ok.
tell us a little bit
Curiosamente, cuando
since we
ustedes
have the
nos mandan la
opportunity.
herramienta,
Okay, so
la
when you sent
institución
out
nuestra
the
también nos
tool,
manda a
our
hacer la
institution
evaluación del
also
desempeño que se hace a nivel de toda la institución. Son dos herramientas
started
diferentes.
out deploying
Exactamente me
their
dieron los mismos
yearly
resultados.
assessment, and I got
Las
these two
dos
tools,
herramientas me
and
dieron el mismo
I
resultado,
got
la
the
misma
same
cifra.
result
Calzaba
verbatim from
exactamente igual.
both
Y
tools.
entonces fue muy interesante porque
So it
entonces
was
si fue
actually
bien,
very interesting
yo fui desarrollando exactamente
because
el plan de trabajo
I started
para,
doing the rollouts
para el instrumento y el trabajo que
of
usted
the
nos
work plan
desarrolló,
for
pero
this instrument
paralelamente
and
me fue
for your
ayudando
work,
para
but
ir
at the same
trabajando
time,
con el programa que
that
yo
also
tenía que
helped me
desarrollar y
to
el
start
plan
working with
a
the
nivel
program and the plan that
institucional
I
para
had
dar
to
respuesta al clima organizacional.
roll out
En una época de pandemia,
in my
pues
institution.
realmente yo tenía unas expectativas de que
So during
el clima
pandemic, I had the
organizacional fuera
expectation
a
that
venir
the
siendo
organizational
diferente
environment
porque
would change for it
estábamos
to be
ante una
different
situación de
because we were
estrés,
faced
las
against a
personas
situation
sobrecargadas,
that caused a lot of stress. People were
veníamos
burned
con
out,
unas incertidumbres por esta
and we had a
enfermedad
lot of
y hasta
uncertainties
dónde eso
because
podía
of
perjudicar
this
el
disease.
clima organizacional.
And how much
Comparando
so
con los
would it be able
resultados de otras
to
evaluaciones
affect
en mi
the
unidad,
organizational
realmente no vi tanta
environment?
la
And as compared to
diferencia
other units in my
del
institutions,
impacto
I
que
didn't
genera
really see that much difference in
¿cómo
terms
se
of
llama?
impact
La pandemia, pero sí
because of
se
the
demostró
pandemic.
exactamente
But
cómo
we were able to show
el personal sí estaba
exactly
evidenciando
how
ese agotamiento y ese
the
exceso de trabajo.
personnel were
Que
under
al
a lot
final,
of stress and burnout.
obviamente se ve reflejado tanto en el desempeño como en el
Yes,
clima,
and at
¿no?
the end, that's reflected both
La
in
gente ha
performance and in
madurado
organizational
mucho, también
environment
se
where
vuelve
people are
irascible, se
exhausted,
vuelve
they get
incluso,
irritable,
explota muy rápido, pero no solamente eso, sino también explota sus emociones.
short-tempered, and that
Sabrá
there
que
are a
usted que
lot
está
of
muy sensible,
emotions
sensible porque ha visto y ha convivido con la muerte de
in the
cerca,
work
o
environment
alguien
because
familiar cercano
they
convivido.
either experience the death
Creo
of
que
a
nadie de
family
nosotros
member, a loved
pensaba
one,
que
they
no
see death,
solamente
they
aquí
have to
tengo
stare death
médicos
right in the face.
que viven la muerte dolorosamente día con día,
I
pero
have
los
some
que estamos en
physicians
otra trinchera,
who
ver que de
see
repente familiares muy cercanos,
people
amigos muy
dying
cercanos, compañeros de profesión muy cercanos han muerto por
and
esto, a
they've
todos
had
nos ha
to
vuelto muy
experience death of
sensibles, nos ha
peers,
vuelto
colleagues, loved ones. That's why
irascibles en
I think
algunos
very
el
irritable,
confinamiento para algunas personas también ha generado
very
que
sensitive,
su familia se
and
esté en un estado
the
que cuando él
lockdown
regresa del trabajo con el cansancio, con las ganas de abrazarlos, también la gente ya está
has
de uñas y
provided
eso hace
for their
que
family
al otro
members to
día el
be also
desempeño
stressed,
laboral haga una
comes back,
disminución en el
tired and
rendimiento,
stressed
que eso
from
es
work.
algo que también vamos a ver
Chances
ahorita
are there will
en
be
los
conflicts
indicadores.
inside
Mi
the
querido
household.
Carlos, no sé si quieras ahondar
But
algo
we will
más.
take a look
Te
at
agradezco
that
muchísimo
a
tu
little bit
comentario.
in more in depth
Randall,
in the
Carmen, no sé si
indicators.
quieren
So
hacer
thank
algún
you very much for your
comentario
comment,
al
Carlos. Now, Randall,
compañero,
Carmen, I
a
don't know if
Carlos por
you
su
have any further comments
intervención.
to Carlos after his intervention.
Sí, lo que dice Carlos, muy cierto.
Yes, Carlos, what you said is completely true.
El trabajo suyo del desempeño,
So
lo
you
mismo, la
have
misma situación,
performance
más bien
assessment
ayudó
with your
el
work,
trabajo de usted
and
para
actually the work you
ir
had to
generando los
do
planes de
helped to be
intervención
able to
y
generate
así fue como
these
lo
intervention
fuimos
plans,
manejando.
and that's also how we
Muy
handled it.
interesante el módulo.
The module I think is very interesting. The work was very interesting, and actually having to apply it to a current situation to our workplace, and we shouldn't remain there or become stagnant, but striving to achieve our all our goals and objectives. Carmen, something you'd like to comment?
Acepté los comentarios del doctor Carlos y efectivamente
Well, thank you very much,
trabajar
Carlos,
en una
Dr. Carlos,
organización
for your
es
comments. And
una
actually,
clave
working in
para el logro de
organizational
los objetivos
development,
de
that's
cualquier
key
organización.
if you
Es
want
la
to
parte donde
achieve
el recurso humano necesitamos que se
goals
alinee para que podamos
of
tener
every institution. That's why we need alignment
ese
with the human
servicio
resources for us
que
to be
se le
able
está
to render
otorgando
that
a los
service,
pacientes
that
o a
type
los
of service, or
derechohabientes,
better
como es en
type
el
of
caso del
service
Seguro
for
Social,
patients
pues
or
sea
right
realmente
holders in
de
the case of
calidad y segura.
social security
Hoy en día, pues
institution
esta
in
contingencia es algo
Mexico.
adicional
And then
porque lo
nowadays, the
perciben como una sobrecarga de
pandemic is
trabajo
something
y un
additional because
temor a
people
la
see this
atención del paciente
as
cuando siempre como
an
médicos
overload
sabemos
of
que el
work.
riesgo está
And
persistente
I
y
mean,
que
as
tenemos que
physicians, we
apegarnos a
know
los protocolos de atención de
that
manera
we need
estandarizada para una
to really
atención
follow
adecuada y
protocols in a
oportuna,
standardized
porque
fashion
lo vemos
to
con las altas
provide
tasas de
a
letalidad que se ha enfrentado el país.
timely service
Entonces
and
yo creo
attention.
que es realmente muy interesante ese
So
módulo
all
de
in all, I
formación, me
think that
llamó mucho
this
la atención porque
module
no
is very
solamente
interesting. It
nos
really
dice
called my
el
attention
por
because you're
qué,
not
sino que
only
además
telling
nos
us why,
compartió,
but you
y ese es
shared
un punto
your
adicional, ese valor
experiences
agregado,
with us, and
esta
that's an
herramienta
additional
donde
point, an
podemos
additional value.
identificar
This
cómo de
tool allows
diferentes
us to
autores
identify
podemos
how,
tener diferentes
from different
dimensiones,
authors,
diferentes
we can get
aspectos de
different
evaluar,
dimensions and
pero que eso
different
de
aspects
una
that we
manera
need
mucho
to
más
assess.
empática nos
But
ayudó. En mi caso, por ejemplo,
in the
fue
case
una
of,
sorpresa porque
in my case, it was
consideraba de que el equipo de
surprise because
trabajo
I thought that
estaba
the
bien, estaba
team
motivado,
was
y
okay, that they
cuando
were motivated.
adicionalmente identificamos
But
que
when we
había
finally
ciertas
identified that there
dimensiones
were certain
eh,
dimensions
que estaban con bajo desempeño y que lo percibían
that
mal y que de
came
repente
out low
decíamos,
in
es
performance
la
and
contingencia,
they
pero no, es
perceived
algo que ya
something
se
wrong,
venía
we thought it
arrastrando
was
desde el
COVID, but
día a día.
no, this was
Y
something that
entonces el establecer una
came
matriz
from
de
long
riesgo,
ago. So
mecanismos,
establishing these
análisis,
mechanisms,
documentación,
analysis,
darle
documentation, a
seguimiento,
risk
porque
matrix,
tampoco se
and
trata nada
providing
más de
follow-up to that,
identificar,
because it's not
analizar,
only about
sino que se
identifying
trata
and analyzing,
establecer un plan de acción,
it's
pero que
about
tenga un
establishing
seguimiento
an
para
action plan,
reevaluar
something
posteriormente
that can be
cuál es el
followed
efecto de
up
las acciones
upon
que
to
se van
be able
teniendo.
to
Y
reassess
pudiera ser de
what's the
manera
result of
directa,
the
le supongo
actions
que eso
we've
lo vamos a ver
undertaken.
con indicadores donde podamos
And that can
medir
be tied in with the
el impacto
indicators.
que tenemos
Indicators
como
allow
usted
us
lo
to
señaló
measure the
antes de que
impact, like
nosotros
you
entráramos
mentioned,
a este diplomado
before
y después de
us
este
coming
diplomado
into this
cuál es
diploma
nuestro
course. And
desempeño, ¿no?
so that will
Pero
be
que
the
también
ideal,
lo podemos
and that's the
hacer
correct
nosotros
thing to
mismos
do.
al
But we
autoevaluarnos
can
en
do that
cada uno de
ourselves
los estudios
by
en los cuales
assessing
nos
us
desempeñamos.
with
Pero
each of the
esta
items
herramienta
we
es muy
we
beneficiosa y
perform
útil,
against.
sobre
But
todo.
again, I think that
Gracias.
this tool is
Muy
great and
bien,
it's very
muchas
useful.
gracias, Carmen, Randall,
So
Carlos, le
Carmen, Randall,
agradecemos
Carlos,
mucho
thank you very
su
much.
intervención,
Thank you
muchas
very much for your
gracias.
participation.
No sé si
Gracias a ustedes.
tengamos alguien más antes de pasar a la parte de nuestros indicadores.
I don't know if there's
Alguien más
anyone else
que
before
quisiera
going
por
to
ahí.
indicators.
Sí, por ahí luego nos están comentando. Ahí, los
Buenas
datos
tardes.
en el chat también están muy buenos, ¿eh? La plática que tienen en el
Yeah,
chat.
I'm reading the.
Si nos ponemos el chat ya se nos va todo el tiempo, pero
What
bueno.
you're saying,
Oigan,
chat's
tenemos
great.
a Carlos Zúñiga. Carlos, ¿cómo estás?
So we have
Muy
Carlos
bien, todos,
Zúñiga
Carlos, qué
here.
bueno. A ver, mi querido Carlos, ¿qué onda? ¿Qué cuentas? Platícanos.
Mucho gusto.
Hello.
Muchas gracias por las enseñanzas y el
Thank you very
compartir.
much for sharing
Yo solo quería dejar una reflexión
and
muy
for your
interesante
teaching. I just wanted to make an interesting comment
la valiosa herramienta que tenemos,
about the
la
valuable
metodología.
tool that
Yo
we
todo
have in the
lo
methodology.
desarrollé en
I mean,
base
I developed the
de
whole
un
module
funcionario de supervisión de la
based
institución que represento, que es la
on being
Superintendencia de
an
Bancos del
Overwatch
Ecuador, en donde el proceso nuestro es hacer
officer
control y supervisión al
in
sistema de
Ecuador,
seguridad
and
social.
I get to
Y de
overwatch
esto le
the social
enfoqué todo
security
mi
system
análisis,
and or my whole
tanto desde el
analysis
primer módulo hasta el último
from the
módulo, y
first to
con
the
esta
last module.
herramienta
And
lo
using this
enfoqué la
tool, I
importancia que
focused
tenemos nosotros
on
como
the importance
supervisores
that we
al
have a
sistema
super to the
cómo
social
se
security
debe
system,
ir minimizando
on
los
how
riesgos que se presenta en
we
un
should
sistema de
minimize
salud
the
que existe aquí
risks
en el Ecuador, que
that
lo
we
administra el
find
Instituto
in the health
Ecuatoriano de Seguridad
system
Social.
in
Esta
Ecuador, which is
herramienta a mí
managed by the Ecuador
el módulo en
Social
sí, yo le
Security
siempre le induje
system. So I started using this tool as a supervisor to understand the organization because the organization is not me going supervising and demanding results. Rather, I need to understand its reality. So it made me have a broader vision because first we need to understand the reality of the social security system, understanding the reality of its organization, like corporate governments. And this tool allowed me to understand that if I want to supervise an entity like social security or providing health services, what's valuable is how this methodology allows us to see the work environment because that environment, and like Randall mentioned, I mean, in practice, that tool allows them to determine that there might be an official that's going through a certain situation. So this methodology allows me to correct and to mitigate the infamous management that has this contingency called payroll. But there's also this mystic we will talk about in the past 2 3 days of the course. I mean, we need to go the extra mile, try and understand the organization. And just in wrapping up, I would like to mention that this tool is extremely important because it makes us see the performance of our officials to be able to get in line with the strategic planning and strategic objectives to get in line to compliance of its mission and vision of his workplace and also try and correct that performance. I think that's something that we've lost, and these tools allow us to see that. If I determine something and you have that mystic of going back to trying to regain the official's motivation, like Mr. Francisco before me mentioned, is not only about being paid. We've seen the American experience. I mean, them corporately, they have everybody satisfied not only from the wage standpoint, but they have a coverage of insurance policy, which in turns allow the official not to have to pay for this out of pocket because that's one of the French benefits coming out of his work. So that's also important, and we shouldn't forget that during life, when somebody pays a compliment, that motivates you to carry on, to move forward. I want to congratulate you because the tool helped me to better focus in overwatching the performance of my institution and to understand what's going on in real life, and that tool can determine the structure of the work environment where I work. So the results that allow that this tool, this methodology allow are very flattering because it allows to correct deviations while at the same time minimizing risks.
Mi querido Carlos, otro placer, un gusto enorme
Mr. Carlos, it is my genuine pleasure
hace un momento,
to
hablando
have
acá en
met you,
México.
and thank you
No,
very
me
much for
hubiera
your
gustado
contribution.
conocerlos a todos
I
y
would have loved
platicar
to
en
have met
vivo,
you in
porque
person
todo esto que nos comentas
because all this you're saying
desde
right
la
now,
perspectiva que tiene Carlos
I mean,
desde
just
Ecuador,
just
porque él le toca
try to
estar
grasp
supervisando,
Carlos'
le toca estar
perspective from
yendo a ver
Ecuador. I mean, he needs to
cursos,
overwatch, and
y esos
he's
recursos
there
son los que estamos pidiendo que se
to allocate
optimicen.
resources, and
Entonces,
we're
es
asking
una
those very
perspectiva
resources to
diferente
be
del que está
optimized.
operando, ¿no?
So,
Los
I mean, it's a
recursos.
very different
En este
perspective
sentido,
from the person who's
yo
operating
te
with those
agradezco que
resources.
hayas
So, in
utilizado, que
this
le hayas
sense,
puesto
I want to
interés. La
thank
herramienta
you
cuando la
for
diseñé,
placing so much
obviamente
interest in
basada
this tool. When I
en
designed this
en las
tool,
teorías
obviously based in
y en las
theories
técnicas explicadas,
and
tenía que
the
ser muy
techniques I've
sencilla,
already
pero tenía que
explained,
darnos resultados.
I mean, it
Tenía
should be
que
very simple to use, but
decirnos
at the same time, it should be render
cuestiones que
results.
tal vez
It
ahorita
should
que
tell
vamos a
us
ver indicadores
things
las
like,
vamos a ver
I
con
mean,
números, pero cualitativamente hay
we'll see
muchas
this
cosas que
indicators
no
and
se
we'll turn
podían
into
llevar tan
numbers, but
fácil a números
qualitatively,
y
there
teníamos
were
que
things that
ponerles una
weren't that
ponderación.
easy to put into numbers, and
Entonces,
we need
creo
to
que
weight
nos
them.
ha servido
So I think that again, this tool served a lot. I've actually tried this with many clients. And when I gave the tool to you, when I tried to explain it to the best of my ability, I knew that the challenges you'd be facing wouldn't be easy. That actually gathering all that information and the analysis will be hard work. But I think that the results have been wonderful so far because all of you have provided different perspectives, like Carmen mentioned a while ago. And Randall and Carmen, I don't know if you would like to comment on what Carlos said. What's your perspective? Because I mean, he's from an overwatching perspective, and you come from an operational perspective. So, what do you think, Carmen? You can start.
Eh, a mí me parece fundamental el hecho de que,
Yeah, I think this is
de
fundamental.
acuerdo al organigrama, cada
The
uno
fact
de
that
los que
based on the
integran
organizational
esa
chart, each
estructura
person
organizacional
comprising this
estén
organizational
convencidos de la
structure to be
importancia
deeply
que es el
convinced
desarrollo organizacional y
of
que dependiendo
organizational
del
development and
servicio o el
depending
producto que
upon
se tenga
the
que entregar
service
en las
or the
diferentes
product that you need to
organizaciones,
deliver in the different
se tiene que
organizations.
trabajar en razón a ello. Y
I mean,
entonces,
you need to work
esta
based on
herramienta
that.
permite hacer una
And this
autoevaluación
tool
cuando ellos hacen
allows
una
to make
planeación
a
estratégica, una
self-assessment
planeación
whenever
operativa,
they
y entonces
do
en
a
el momento de
strategic
hacer el despliegue de esas actividades,
or
toman en cuenta
operational
a
planning.
el
And
personal
before
operativo.
deploying
Uno
these,
de los
they do take
elementos
into
claves que
consideration the
existe aquí
operational personnel.
es
One of the
precisamente
core
la del
requirements
apoyo y de
here
las relaciones, en donde
is
se tiene que
precisely
fortalecer
the support
esa
of the relationships
comunicación formal
where
e
the
informal
communication,
y
formal and
cómo a
informal,
través
should be strengthened,
de
and
reuniones en donde se
how
pueden tener el
meetings
establecimiento de
where
políticas de
you
puertas
can
abiertas, en donde
establish
se puede
policies
tener
like
una
open doors,
metodología de
where you can
escuchar al
find a
personal y de
methodology
recibir
of actually
también sus
listening to
puntos de vista
personnel
para
and getting feedback from them
fortalecer la
to be
planeación
able to
operativa, que
strengthen
no tiene que ser
operational
una
planning.
inercia
I mean,
durante uno, dos,
it
tres años,
shouldn't
sino que
need to
sabemos
be like a
que esta
one,
va a
two,
tener un despliegue de
three-year
autoevaluación de
momentum,
manera
but rather
permanente
there will
y
be
a
a
través de
permanent
las metas
deployment of
no
self-assessment,
solamente de algún
and
indicador al
through
final
goals, and not
de
only through an
cierre de
indicator
actividades.
at the end of the
Entonces yo
day,
creo que
closing activities.
esta
So I
dimensión, por
think that
señalar
this
una
dimension, just to point
es
one out,
el hecho de estos mecanismos de establecimientos. Y mencionaba uno de los compañeros en el chat, voy a permitir
does
hablarlo,
I'm one of my
el hecho
peers
de
in
que
chat, and
en las
I'm
organizaciones
going
del
to
área
take
de
the
la
liberty
salud,
to comment on
en
this. In
donde lo que se
organizations
busca
in
es el
health,
bienestar social,
what
pues
we're looking
estamos
for
en
is
una
social
contingencia en
well-being, and
donde
of course
una
we're
de las
undergoing a
dimensiones que
contingency
pudiéramos
for
tener
one of
por
the
esa carga
dimensions
de
that we might
trabajo
have due to this
es
workload
precisamente esa remuneración económica
is
que se les
precisely
debió a alguno de
that
los compañeros
economic
en
or
esta
that
contingencia.
payment.
Yo creo que es atinada porque no estamos
And I
haciendo una
think that
toma de decisiones al azar, sino que coadyuva
that's really
perfectamente bien con el
pertinent. This is
que
not
nosotros
random
estamos
decision making. I
estableciendo.
mean, it
Pero no es la
completely
única,
goes hand
no
in
es la
hand with the
única
model
que
we're
se
proposing,
trabajó
but it's not
y
the
lo
only
puedo
one that
decir
we worked on.
porque formo
And I
parte
can
de
say
esa
this because
institución
I'm
que es el
part of
IMSS
this
y
institution,
en donde se
which is
trabajó
IMSS.
cada uno de
And
los elementos que
here
se
we work
tuvieron en
with each
esta
of the
herramienta. Entonces
elements
yo
that
creo
we were
que fue
requested by the
perfectamente
tool,
bien.
and I think
Resaltan algunas
that
por parte de
some,
comunicación
of course,
social,
are
en donde
highlighted.
resaltan
Social
algunos puntos,
communication,
pero no es lo único.
some items
Gracias.
came to light, but these are not the only items.
Ok,
Thank you.
pues mira, Carmen, que como bien dices, sí está lo de la generación de los bonos de pandemia, yo diría que
Yeah,
obviamente,
Carmen. I mean,
además
having
están
this
trabajando horas extras, ¿no? El tema de repente es
bonuses
preguntar, ¿y de dónde sacamos los recursos?
are needed because they're working
Porque
during a
claro que
pandemic, and the
todos
question
estamos
is where
a
we're going,
favor
where
de
we're
que
getting the
el
resources
personal
from, and
médico
of
y de
course,
primera línea, que no
if
son médicos,
you know,
enfermeras, sino todo el personal
medical
que
staff,
trabaja,
first
limpieza,
responders,
todo el
and all the
administrativo que está
janitorial
todos los
staff,
días,
admin staff,
requieren.
nurses
El problema de
working
repente es
on the
pues, de
daily,
dónde se
they
toman los
require
recursos, ¿no?
getting extra
Y
bonuses. The
esa
problem is where
perspectiva
we're
también
going to
habrá
get the
que
resources from.
identificarla
So we will need to
porque
identify that perspective
desgraciadamente
as
los
well, because
presupuestos de todos los
unfortunately,
países son muy
budgets from
limitados. En
our countries are
el
very limited.
primer capítulo, bueno, en la primera parte del módulo, o sea,
So
vemos
in the first
cuántas
part,
camas pide la Organización Mundial de
we
la Salud,
saw how many
cuántas
beds are
enfermeras y
requested by
cuántos médicos
WHO, how many nurses and how many
persona o por
physicians
más por 10,000 personas en
per
un país
10,000
deberían de
people
tener. Y
in a
toda
country.
Latinoamérica salimos reprobados,
I
¿no?
mean, and those numbers,
Terriblemente
Latin America
reprobados.
keeps
Entonces,
failing.
la asignación de los recursos
So the
para eso
allocation of resources will help in that.
no ha sido adecuada y
because
desgraciadamente hay
it
que
hasn't been
enfrentar eso.
adequate.
Y la
Unfortunately, we
perspectiva
need
que
to
se tiene,
face
por
it,
ejemplo,
and the
desde el
perspective
punto de
that
vista de
we have,
Carlos, que tiene que
I mean,
decir,
from
tengo este
Carlos's
dinero, pero
point
tengo
of
que
view, I mean, he would say,
invertirlo,
I have
primero
this
tengo que
much
ver en qué
money,
se usa
but I have to
y sentir,
inject it and then see where it's
identificar
going
las
to be
necesidades
used.
de la
I mean,
gente
he
que lo
needs to
usa. Pues
identify
obviamente
the
lo hace
needs
más
of the
humano,
people
pero
using
también
that money. I
genera
mean, this
una
humanizes the whole
controversia.
chore, but at the
¿Qué
same time, it
hacer?
generates controversy.
¿Qué hacer para optimizar esos
What do we have to
recursos?
do to be
¿Cómo
able to
coadyuvo
optimize these
a optimizar
resources,
los
or
recursos
how
con
can I
ustedes? O
help
sea, la parte que
in
fiscaliza contra la parte
optimizing
que opera.
resources? I mean, the
Porque
fiscalizing
también ellos
portion to the
tienen un
operational
dilema,
portion,
¿no? Te doy
because
10
they also
monedas,
have a dilemma. I will
repártelas
give you
entre
10 coins,
600. ¿Y
distribute
a
them
quiénes doy
among
más?
600 people, and who
Entonces,
should
creo
I
que
give
este
more
ejercicio es
to?
muy valioso
So I
porque
think
nos
that this
está
exercise
nutriendo de
is very
cómo
valuable in
todas las
nature because it's
perspectivas,
really
todas las
nurturing us from the
problemáticas
different perspectives,
y todos los
all the
dilemas que
different
nos tenemos
problems
que
and all the
enfrentar
different
por el
dilemmas
uso de
we're
una
faced
herramienta
against.
hasta
That's why the
inclusiva.
usage of a
Y si
tool
les dieron
is
otras 20
precisely meant for
herramientas,
that,
usen las 20, ¿no?
to be used.
Y
And if
nos
you have
faltan
other 20
500,
tools used
bueno,
and
de
we're
ver
missing
20 ahorita.
500, well,
Entonces,
right
estas
now,
20 hay que
right
seguirlas
now
optimizando de manera
we could
continua
only
y
get
propiciar
to 20, but you
que
should
no
use
son
them
las únicas, ¿no?
continuously and
Y que hay un
really
crecimiento más
foster
fuerte en esta parte. Mi querido Randall,
for
¿tú
a
qué
higher
opinas?
growth
Perspectiva,
in
por
that
favor.
sense. We should use more tools. So, what do you
Igualmente,
think about this, Randall?
interesante.
Yeah, it was very
Y les
interesting.
cuento mi
And
situación.
well, my
Y
situation,
es como cómico a la vez porque
it's a little bit funny
yo, como les había contado, mi puesto de titular
because,
es como director de un área de
like
salud
I
de
told you,
primer
I'm
nivel.
director of a
Sin
health
embargo,
area,
hago
first
ascensos
level.
a hospitales, que serían segundo
However,
nivel, pero
I
también
also
me
work in other
corresponde el
hospitals,
ascenso
second
de la
levels.
dirección de red. Es decir, la supervisión general
And again, I'm in
de los
charge of
hospitales y
general
las áreas de salud.
supervision of hospitals and
Entonces,
health
hay
areas.
momentos donde estoy
So
en un
there
hospital
are
y
some
al día
points where I'm in a
siguiente me toca
hospital,
pasar a la
and the
dirección de red.
next
Solo me falta como regañarme
day
y lo que
I'm
hice mal en
going
el otro
to another hospital. I mean, I sometimes
me da
need to
esa
scold
oportunidad de
myself,
conocer todos los niveles,
but at the same time,
el
I get
primero, el
the
segundo
chance
nivel
to
y desde
knowing
la
all
parte
levels,
meramente
first, second,
administrativa,
and
y eso
those levels
le
which
abre
are
a uno la
merely
posibilidad de
managerial,
entender
and that opens
no
up
solo
the
a
possibility
uno
of
en la
understanding not
parte
only
cuando uno está abajo
one
y tiene
side.
que entender a los superiores,
I
sino
mean, it's
cuando
not
uno está
me
en la parte superior y tiene que
being
entender a los
downstream and
operativos
having to
todas las
understand
situaciones
the
que se
bosses
sufren en la
about being
parte
a
de
boss
más abajo,
and
las situaciones
need
que
to
cada uno de
understand
ellos
the
tienen que
people in
enfrentar.
operations.
Y esto a mí me abre esa
So
posibilidad
this
de
has
tener
opened up that
un
possibility to
pensamiento
me
más
of
crítico
having a more critical
y
thought
poder entender
and
de
to be
cómo
able to
manejar la
understand how to
situación
better deal
desde
with
todas las
situations from all the different
perspectivas.
perspectives.
Entonces, sumamente interesante
So again,
esto,
extremely
su
interesting. This
módulo,
was extremely
la
interesting
forma
module,
del
the way
cuestionario. Esto nos permite también, a mí
in
me
which the
permite
survey was
autoevaluarme
presented.
cuando
That allows
estoy
me to
en el
self-assess
primer nivel y cuando estoy en el segundo y cuando estoy
either I mean when I'm in first
como en
level,
la parte
second
más alta
level,
por
and
ejemplo, de la región
you
Norte.
know when
Y
I'm
esto
in the
es
highest
interesantísimo,
portion
¿verdad?
of or the highest echelon.
Hago una línea de abajo hacia arriba y de arriba
So
hacia abajo
I
y
can
permite que
work
tengamos
upstream and
una mejor
downstream,
interacción
thus
con
allowing
cada
me to
uno de
have
los
a better
directores.
interaction with each of the directors.
Te agradezco mucho, Carlos. ¿Algún comentario final más? Y proseguir. Mi querido Carlos Zúñiga.
Again,
Sí,
Carlos.
realmente es muy valioso, como bien citaba Carmen, nos permite tener ese análisis, ¿no?
Said, this
Y
allows to
Randall
make
confirma
this
una
type
cosa
of
que me
analysis.
parece bien interesante.
And Randall, I'm
Nosotros
confirming something
construimos
that's
de
very
abajo hacia
interesting.
arriba,
I mean,
incluso nos
we build
permite esta metodología conocer,
from
por
bottom up,
ejemplo, en
and
el momento de
this
la toma de
methodology
información,
allows to
los
know, for
procesos
instance, so
en que
when
se puede
we're
estar
gathering
desviando
information, the
mis
processes
planes
where my
operativos,
plan,
mis
my operational
objetivos.
plans,
Entonces
my
es una
objectives might
herramienta
be
que no solo te
deviating.
permite
So this is a
identificar
tool that
y
does not only
cuantificar
allow you to
estadísticamente
identify and statistically quantify
en sí la situación, el clima laboral, sino también todo
the situation
involucrado en la
or the work
organización, su
environment, but
planificación,
everything
sus
pertaining
procesos,
to the
cómo se
organization,
está
their
controlando,
plans,
mitigando
its
estos riesgos,
processes,
cómo
how
puede ir
we're
mejorando
controlling or mitigating
para
risks,
cumplir.
how it can
Algo muy
improve
importante
to be
que
able to
a mí
meet
me gustó bastante
its
de
goals. And
este
something
diplomado,
I really liked, I
me
really
ha
enjoyed
dejado
about this
reflexionando
diploma
mucho
course, and that really
sobre
made
la
me
calidad de
reflect,
los planes de salud que se tienen que hacer. Para mí eso es,
everything
me ha
regarding
tocado, porque me ha tocado
the quality
en
of
las
the
lecturas
plans
que
that we need
hicimos
to have. I mean, if
por ejemplo, en Estados Unidos, que
And
tiene un
of course, it's
sistema
important to
muy,
see the
muy
case of
bueno
the
de
United
salud,
States. They
pero
have
tiene un riesgo muy altísimo
a good
en unas
health
enfermedades
system in the
como
United
lo
States,
que
but
es
they have huge
la
risk to certain
diabetes.
diseases like
Entonces, a
diabetes.
mí me ha tocado porque realmente lo interesante de todo
So
esto
what's really
que
interesting
aprendemos con
behind all this
metodologías, con
is,
herramientas, es
us
cómo
learning
yo
through
puedo
tools and
dar
methodologies
con los recursos
is
limitados que
how,
tengo
with the very
una
limited resources that I
calidad
have, how
en
can
la
I
prestación de
provide
salud
good quality
o en esos planes de salud.
in
Yo
health
creo que
services
con esto para mí ha
and
sido
even
muy
these health
importante
plans.
como ciudadano,
So
como
this to me has been very important
una persona que no la ha visto
as,
todavía esa importancia de la
as a
salud,
citizen.
la prevención que tiene que hacerse
We also
para
need to think
entender
about prevention
que
work
esto
that
me va
needs to happen.
a facilitar mitigar ese
To
riesgo de
understand that this
recursos, de la
will
dependencia de la
facilitate
caja fiscal que
mitigating
tiene todas las
this
sociedades latinas,
the
en
risk and
Europa
dependency
y el
on
propio Estados
resources.
Unidos,
And that
Asia.
doesn't only
Entonces
go
son cosas
for
que
America,
nos
but the United States,
permite
Europe, Asia.
reflexionar,
These are
nos
things that
permite
pretty much
reflexionar.
allow us to reflect upon many things.
Mi querido Carlos, te agradezco, no sabes cuánto tu
Carlos, thank you very much.
intervención.
I really feel
Muchas
thank you for
gracias.
your participation.
Vamos a tener que proceder ahora con Jocelyn como última.
Thank you very much.
Vamos
Now
con Jocelyn
we'll
y desgraciadamente
go
Teatro
to
va a ser nuestra última
Jocelyn.
intervención
And
de ustedes para que podamos terminar
that's our
también
last
con
intervention
los
for us to
indicadores
be
que
able
quiero
to
enseñarles
finish the
por ahí.
indicators I
Nos
want
vemos, Carlos,
to show you.
Jocelyn, adelante.
Hola, ¿qué tal? Buenas tardes a todos, compañeros.
Hello, afternoon.
Bueno, la aportación que a mí me gustaría hacer en primer término es una reflexión más sobre la importancia del eco, pero visto desde un punto de vista un tanto operativo.
I have a
Aquí la
reflection on the
diferencia
operational
que yo tengo
side of
con
things.
bastantes de los compañeros que están aquí es que, bueno, mi
The
perfil no
difference that I
es
have
el
with
perfil médico como
my
tal.
peers here is
Yo
that I
soy
have a
abogada,
medical
me
background. I'm a
desempeño en el
lawyer
Instituto Mexicano del Seguro
and I
Social,
work
pero
at
lo que a mí me
IMSS.
motivó a tomar
But what really
este
motivated me
diplomado,
in taking this diploma
obviamente,
course,
es que efectivamente la dirección de estas instituciones de
obviously, I
seguridad
mean, the
social
direction of
siempre se
this
va más
social
enfocado
security
a la
institution
médica.
will be
Si bien
more
es
geared
cierto,
towards
la
the
seguridad
medical
social
area.
es un rubro muy
And of
amplio
course, social security
y
is a
lo
very
principal es
broad
la atención médica.
field,
A
and
veces
what's most
nosotros como
important is medical
trabajadores
attention. And many
pasamos
times,
por
us as workers
desapercibido que tenemos muchas
sometimes
obligaciones y
tend to
que también
neglect
como
that we have
servidores
many
públicos
obligations.
tenemos que
Also, as public
contribuir
servants,
a dar
we
un
need
buen
to contribute
servicio
in providing
que en esto que es la
good
seguridad social.
service, the
Entonces, bueno,
social
nosotros dentro
security.
del instituto tenemos,
So,
cada año
us
nos aplican una
at the institute
evaluación,
we're assessed every
la
year,
de ECO, la de clima de cultura organizacional.
and this
Se me hizo muy interesante esta
assessment
dinámica, porque si bien es cierto el área en la que yo me desempeño, tal vez es pequeña, pero
tries
me di cuenta que
to
arrastramos
measure
problemas, como bien lo
organizational
comentaba la
environment.
doctora Carmen,
And
de
like Dr.
muchos
Carmen said,
años, de
that
mucho tiempo
we're
atrás.
driving with problems from
Y
way
lo
back,
que a mí
many
me
years
deja
back.
o me dejó este módulo es,
And
ok,
what
lo
what this
entendí,
module
ahora
served
mi
me
trabajo
for
es
is like I
compartir
already
esto
understood it.
hacia mis
Now my
compañeros,
work
porque muchas veces como
is
una
to
cuestión
replicate and
administrativa
share
decimos,
this
ay ya,
to
me
my
van a poner
peers,
cursos de dinámicas,
because
me van a poner a convivir
sometimes
con mis
admin
cotidianos, que
stuff.
no
I
es
mean, there's this
trabajar, o
course
sea,
in
tanto
dynamics
tiempo
I
en
want to
la
share
oficina.
with my
Entonces,
peers. What
cuando
I don't
realmente
want to do anymore is
entiendes
work or
la
be more time
importancia
at
de
the
estos
office. But when you
ejercicios, de
really
estas
understand the
dinámicas,
importance behind
que
these
la
dynamics,
finalidad es
these exercises, and
contribuir
that they're
y
purpose
brindar un mejor servicio
contributing,
tanto
providing a
como
better service.
servidores para
That's what they're there
servir
for,
a los
as public servants,
usuarios, a los
to provide a
derechohabientes,
great service
te das
service to the
cuenta
right
que
holder.
todo
You
va,
come to
o
realize,
sea, si los
or I
engranes
see this like a
están bien,
machine.
todo
If
va a
the gears and
funcionar
the
de una
cogs are
manera.
working
¿Y qué es lo que
correctly, everything works
afecta muchas veces
correctly.
o cuál es el problema que tenemos muchas
Because
veces
what's the problem that
como una
we
institución o
many
en el
times
área
have as an
administrativa?
institution, or at
El
least in this
clásico de me cae mal mi
administrative
compañero,
area,
me
is
cae
like
mal mi compañera,
I don't
pero
like
muchas
him, I
veces
don't like her, I don't
venimos
like
y
my
solamente
coworkers, and many
cumplimos
times we come
un
here and
protocolo,
we're just
cumplimos,
following a protocol, or
aunque suene un poco de feo, o sea, un horario laboral y esperamos
we're just there,
a recibir un sueldo.
punch
Sin
a clock,
embargo,
punch
cuando
out, and
realmente entiendes que
we're just
toda
waiting
esta cultura de organización y
to
todo el
get paid. But when you
trasfondo,
understand that
incluso
this
el
whole
trabajo
organizational
de las
culture and the whole
personas que
background, and
generan
even the
estos
work
programas, que
of
generan
people
estas
coming up with
matrices
these
de riesgo,
programs,
es como te das
generating these risk
cuenta y
matrices,
valoras que, o
it's
sea,
how
para que
you
una
come to
institución
realize and you value the fact that
pública, una
for a public institution, for a private company, you name it, for them to work correctly, all of us need to understand where they're coming from and the origin of the problem, obviously, and to be aware of the probable solution, and probably even focus on what we're here to do, which is our job. And I think that in that we'll be improving many things. So I'm really thankful for the knowledge that you've bestowed upon us. And my work now, I know this is trying to do multiplying effect to improve the way this institution works. Thank you. Jocelyn, thank you very much. And you're completely right in what you said. There's a lot of focus, obviously, on physicians, and especially now since they're the first line of respondents in a war with many casualties. But the admin staff working, if we didn't have that support, who would do the rest of the work? Physicians cannot possibly manage everything. And there's something else that's important because you're a lawyer. And you lawyers told me an action entails a responsibility. Every action entails some legal aspect, legal consideration, and every single decision made entails legal aspects. So we cannot think that only operational people should be in charge of responsibility of everybody to to do our work. There's secretaries, there's a lot of people, even people at the operational level. I mean, all the janitorial staff. I have always said that their work is transcendent because, I mean, if you have dirty bathrooms, nobody wants to go to the bathroom, and that decreases productivity, like we'll see in a couple of minutes with the indicators. But again, everybody has a huge responsibility. And actually knowing that you're working in an organization, an institution, in this case, Mexican Institute of Social Security. But like my peers before me mentioned, throughout Latin America, and peers from other institutions in Mexico, which are important, so like Instituto de Seguridad Social y Servicio de los Trabajadores del Estado, ISSSTE, and we have peers from there. And everybody comes from the institution, which we're very glad to have seen represented here, and that they feel with pride as citizens. I mean, but as users, I'm not saying because all of us have bad, bitter experiences, not so good experiences, but this definitely has to change at some point in time. And resource optimization works in every single area, and not only in the operational area. I mean, you are after seeing indicators, we see that everything can be measured. Even lawyers can be measured. I've measured them based on due process from each country. So there are a bunch of indicators that will help us make these decisions. And it's a good thing that you're really committed. It's a good thing that you see how the tools work. You need to use them. That's the only thing we request from you for this not to be a nice diploma course that will bring about a good experience. We actually need to measure ourselves, see how much transcendence this have. And I don't know, Randall, Carmen, do you have any comments for Jocelyn?
It has been very productive. I wanted to interact more with you. You. I know that I scold you. I have scolded you in this platform, but I am glad to see your face. I want to admire you for all your great work. Carmen, you have the floor. It's very interesting the way Jocelyn presented everything because oftentimes this is what is happening also in other institutions. And I am going to stand out one of the tools or one of the dimensions of the tool structure. Conflict is something sometimes generated due to the different levels in the positions. So we have to make sure if the functions of certain work are the necessary ones because that happens sometimes. Secondly, we have to make sure if the functions that they are developing are in accordance with the work that they are doing. All this clarifies communication, and sometimes there is an added value, activities. So it's a very relevant matter that she mentioned. So I wanted to emphasize on it. Very interesting. All the dimensions are very important, whether from this tool or from on another one. Somebody in the chat mentioned that the IMSS, we have another tool, and that's great because we need to analyze, prioritize, have a plan, and to monitor and have a comparison between the before and the after of the activities. And we're going to notice this with the indicators that we have. Thank you so much, dear Carmen. Randall.
Excelente, Jocelyn. Igual, su
Great,
punto de vista
Jocelyn.
es
Your
interesante y
point of
esto
view is
abre
very interesting
el
because
debate o la
this
situación de que siempre
opens
tenemos dos
another
tipos de funcionarios.
controversy. We
Una
always have two
persona que
types
está
of
interesada en que sea
staff.
que se,
One
que se
is like
incorpore, ¿verdad? ¿No?
Jocelyn,
A
interested
situaciones como
in
estas, las instituciones de nosotros son
engaged
medicalizadas, pero
in
también
this
tenemos el
type of
funcionario que dice, no me salgo de mi
activities.
perfil,
And other
que
times
dice,
we have
no voy a
other
hacer esto porque no
officers
me
that
toca.
are very tight.
Sin
They don't
embargo,
want to
la
do
pandemia
other things that
vino
are
a
not
reforzar muchos
included in
lazos,
their
a generar
role.
un
However,
trabajo
the
multidisciplinario.
pandemics
Vimos a gente
has
trabajando
made
en
us very
diferentes
creative. We
puntos
have seen
y
people working in
por
different
lo menos
areas.
tuvo que llegar una pandemia para ver a un
We needed
odontólogo
to have
llamando a
a
pacientes,
pandemics
a uno de
to
registro de
see a
médicos
dentist calling up
realizando funciones de
patients
otro
and
tipo.
another doctor
Como
carrying
le
out
digo,
other
siempre hay
type of
funcionarios
activities. We
de
always
ambos
have
tipos,
this type too of
pero
officers.
esta pandemia
Pandemic
nos trajo,
resulted
creo que espero yo,
hopefully
más cosas buenas
in
que malas
more
así
better
debería ser.
things, and this is the way
Al
it
final,
should be, because
creo
at
que
the end
todos
of the day
deberíamos trabajar
we
como
all
equipo
work, we all need to work
y eso
as
es
a
lo que nos va a
team,
permitir alcanzar
because with
todas las
this
metas que
attitude
tengamos.
we can
Muy bien,
accomplish
mi
any
querido
goal
Randa,
that we
Jocelyn,
set
ya
forth.
te cedo
Jocelyn,
la palabra ya para
you have the
cerrar
floor
esta parte del
to wrap
bloque
up
y
this
continuar.
can move on.
Gracias. Pues sí,
Thank you.
efectivamente son muy valiosas sus aportaciones
Your
y yo creo
contributions have
que
been
esto
very
lo
useful and
primordial, ¿no?
very
Tal vez ahorita
valuable.
con la pandemia
Maybe
y todo esto es
with the pandemic,
humanizarnos un poco más como
we have
servidores y si
realized
bien
that
es
we
cierto,
need
como
to
lo
be
comenta el
more
doctor Randa,
human as
es
public
en estos tiempos
servants.
donde se
And
ve
as Dr. Randall
realmente
mentioned, in
esa
these times,
colaboración de todos los
we have to
trabajadores,
work
tanto del
harder
área
on
médica, el cuidarse
collaborating
los unos a los
with
otros,
doctors, with the
también
staff. We need
nosotros
to
dentro
take
del
care of
ámbito
each other.
administrativo, si bien
We,
es
in
cierto,
the
no tenemos
administrative
una
environment, it
gran,
is true,
un
we don't
flujo de
have
personas, digamos, mucho
people
precisamente
that we
porque están
provide
suspendidas
services
varias
today because we
servicios
are in
legales, pero
lockdown
también lo es
and
que
many
tenemos que aprender
legal
a
services
cuidarnos
are
entre
in
nosotros. En
lockdown,
algunos
but we
momentos
need to take
trabajamos
care
por
of each
guardia,
other. Oftentimes we were
y lo mismo,
working
¿no? O sea,
um,
le agradezco
in
también a la
call
doctora
or in
Carmen
duties.
esa
And
parte o esa
I
aportación en
like
la que
to
si bien es
thank
cierto,
Dr.
muchas
Carmen
veces
because
el
she gave
clima
us a very
el
important
ambiente laboral
contribution.
a veces un poco
Oftentimes, the
delicado
working
o se torna
environment is
tenso,
very
es precisamente
sensitive,
porque
and you feel a lot of
desafortunadamente al
stress
no o al
because
carecer del recurso
unfortunately, when there
humano,
is a lack of
pues
human resources,
hacen trabajos, hacen
we
funciones que
have
no
to work
corresponden, ¿no? Sin
in
embargo,
other
pues
things that are not part of
tenemos
our
que
job
aprender
profile.
a
However, we
manejar
need
esa
to learn
situación
to be more
y pues
flexible and
sería todo.
uh,
Agradezco mucho sus
to
aportaciones
deal
también
with
a
these
usted, doctor.
situations. And that would be
Pues
everything. Thank you
muchísimas
all for your
gracias.
contributions.
Ha
Thank you,
sido muy
Professor.
interesante,
Thanks to
Jocelyn,
you all
porque hemos
because it
visto la
has been very
perspectiva de Carlos hace un
interesting,
momento,
Jocelyn.
de los dos Carlos,
We
¿no?
heard about
Y la
Carlos,
perspectiva del que
both
supervisa,
Carlos.
el que opera, la
We have
perspectiva
seen the
tuya de la gente
perspective
que está
of
atendiendo la cuestión
the caregiver,
de
the
legal.
surgeon,
Y
or
bueno, pues qué
people like
decir
you,
de Randall y
legal
Carmen que han
staff,
estado en
and
primera línea.
Randall
Y
and
bueno, no me resta más
Carmen
que
that are
agradecerles a todos.
first liner
Yo
staff.
deseaba mucho
We
tener
have
esta
learned
parte.
a lot about
Veo muchos
these
compañeros que dicen,
perspectives.
oiga,
I
yo estoy
was
subiendo la
so much
mano.
looking forward
Desgraciadamente,
to have this discussion with all
conforme
of you.
fueron apareciendo las
I've
manos, fue
seen a lot of
la gente de la
hand
conferencia
raised,
fue asignando los turnos. Si
and
queda alguien ahí
they
en la
were
lista,
assigning
perdónenos, pero
the
Jocelyn,
roles.
Carmen,
Sorry,
Randall,
Jocelyn,
gracias
Carmen,
por
Randall.
conocerlos a
Thank
los dos
you.
Carlos, a
Thank
todos
you
los
so
demás que
much
no los
for
puedo ver
allowing me to
físicamente.
get to
Gracias en
know
ese
each
sentido. Vamos a
other.
continuar porque si no se
And
nos acaba el
we have to proceed. We have time constraints. For me, time has fly. I don't know for you. For me, it has been a whisper in time. So, Randall, Carmen, would you like to wrap up?
Gracias, doctor.
Thank you so much, doctor. It was a great opportunity for me to share my work. This is food for thought, and I am so much looking forward to implement it in my work to see a lot of benefits. Oftentimes, this working environment is the only one that we have, and we are very motivated to give the best. But we are also users of these services, and we want to receive the best quality for us and for our um, people, right? So we have to do our best. Everything is important in the change of value. If someone stops doing their work or doesn't do it correct, everything is going to be affected. We're going to have risk and then harms in the health environment, as my colleagues mentioned. I mentioned the health area, the medical area, but we are all important in every area of every institution. Randall, thank you so much, Professor, for this opportunity to share my work with my colleagues and to be part of this table. And I would like to thank the Social Security of Costa Rica for giving me the opportunity to be part of this uh, diploma program. It has been a great opportunity to learn and to implement all these learnings in my settings. Thanks to my colleagues, to the panelists, because it has been very interesting. It is quite unfortunate that we cannot be present together. This is the new normality. It's interesting. We have to learn to enjoy it. And it's interesting to see that we are all connected from different countries. Thank you so much. It was very nice to meet you all. Thank you. Thank you. Thank you, both of you, for your great participation. You were very useful. You gave us a new perspective. You presented the problems that you faced, and they represent fully the efforts of all your colleagues. Randall, Carmen, thank you so much. And I am here with you because we are going to continue with the rest of the session. Let's proceed. And now I am going to share my screen.
Voy a compartir yo pantalla. No sé si la alcanza.
Can you see my screen now?
Se me aparece bien, maestro.
Yes, I can see it.
¿Sí se ve?
Yes,
Ahí está.
that's fine.
Ahí está. Muy bien. Pues bueno, vamos a continuar. La verdad
Let's
es que
proceed.
motivado,
I am
les
very
reitero mi
motivated.
agradecimiento a
Once
todos los
again,
que
I
querían
would like to
participar,
thank
y que
all
hubo
of you that
oportunidad,
wanted to
ya habrá
participate, and
oportunidad, yo quiero que
unfortunately,
sea en
not
algún
all of you
momento,
could have the floor.
pero de todas formas, muchas gracias a
Hopefully,
todos. Nos deja un gran
we
sabor de
have
boca. Y ahora hay
another
que continuar, y
opportunity
para
next.
continuar,
I am
vamos
very glad
viendo
to see
algunas
all your
herramientas que
interest.
complementen nuestro
Now we are
desarrollo
going to talk
organizacional, nuestro
about some
análisis y diagnóstico de desarrollo
tools that will
organizacional.
help us to
Entonces vamos a
complement
trabajar con
our
algunos
analysis
indicadores.
for institutional
Lo que vamos a ver ahorita, además de nuestra
environment.
inducción, vamos a
After the
una definición que
introduction,
son
we are going to see
indicadores,
some
su relación
definition
con el
about
DO,
indicators, their
y con base en su
relationship with
relación
the
con el DO,
DO,
vamos a ver que del
and
modelo de Fierro vamos a
from
tomar
the Fierro
precisamente
model, we are going
algunos
to
de
be
los
taking
aspectos que nos
some
indicaba
of
o
the
que nos
aspects
generaba la posibilidad de buscar
that
mayor
gave us the
información para los
possibility to look
análisis.
for more
Y de acuerdo
information
a ese modelo,
for analysis.
nos
According to
solicitaba
that
analizar el
model, they
direccionamiento,
were requesting us
los
to
indicadores, bueno,
look for
perdón, la
the
operación, la parte
direction,
financiera y la parte externa,
operations,
para lo cual en todo
financial,
caso
and
vamos a estar
external
viendo algunos
matters.
indicadores básicos.
So we are going
Sé
to
que
learn
faltarían
about some
muchos, pero
basic
bueno, es
indicators. I
solamente
know that there
abrir
are many
el
more, but
conocimiento,
this
como les
is
decía yo,
just a
hacer la apertura del
gateway to
conocimiento
knowledge.
para que al final del
I'm
camino,
just giving you some, and at the
de
end
manera
of
muy
the day,
clara, poder
in a clear manner, we are going to be able to identify the fact that this is just the beginning of the things that we are going to be working with. The first item, what are indicators? Indicators are a parameters to dimension and quantify different actions that are being carried out in an organization. And it's very important for us to consider this perspective. We are going to size, we are going to put numbers into all the things that we are working on. We are going to size and quantify things. An indicator should help us to identify things that are being doing well or bad. We have to develop indicators for every activity, processes, and actions, as Jocelyn was mentioning before. I was saying to Jocelyn that independent from circumstances, even lawyers can be measured. I have a friend that is a lawyer, and he says, no, here we cannot measure anything, but everything is measurable in hours, in time, in money. In fact, each areas has to be measured. They need to have their own ways to measure different aspects to see if expectations are being fulfilled, to see if the work is is been doing well or not. Within the indicators that we are going to address are the followings. I was, for example, if I tell you that today I did 20 things, well, you will think that there are many things that I did. And what if I tell you I did 20, but the reality is that I had to do 30? So then I was not as efficient as I could. I didn't fulfill my effectivity and effectiveness, and that's another indicator. I did 20 things. It was a lot of effort. Yes, yes. However, you were scheduled to have 30 activities. So an indicator is very useful because it is a comparison against something else. Fierro says that in his uh, institutional development, in the diagnosis, we have to identify direction towards where this corporation is going to, how they can reach that. And for that, we have the organizational culture that has to be measured. Careful, because we are going to see some parts of the organizational culture. Mission. How mission is going to be measured? Well, we need to measure within the mission how much are we in compliance with the mission. We don't have enough time to ask questions. However, I would like to ask you that. Do you know that a mission is not only a statement, it's an analysis about the user's expectations? That is our real mission, to fulfill users' expectations. That's the mission. Now, how much are we accomplishing this mission? This is what we have to measure through surveys, through questionnaires. It's not just a philosophy. It's not just a matter of drafting a questionnaire about what were your expectations, were they fulfilled, and how much did it take? No, no. We have to measure everything. Was it good, bad, or poor? Give us a score. In the case of the vision, let me tell you that vision has to be measured as well. But we need to specify that it's not only a pep talk. Where do I want to see myself in the next 24, 25 years? Well, we want to be the best institution. What does that imply? Give me figures to improve from 1,000 to 1,500 people served, to decrease red tape and processes, be more efficient, more nice with our users, to be more preventive, to have less cameras. If we had more schemes, maybe people wouldn't be organizing parties and then we wouldn't be so busy. So, as you can see, vision is to reach a point in 5 years, but you need to measure everything and to have scores, figures. Otherwise, it's going to be just a philosophical phrase. Beliefs, values can be measured with a similar tool that you use in the organizational environment. What do you want? What do you think? What do you want in the future? Are people engage in the organization? Are they really committed? Do they identify responsibility as a way to move forward? Or is just a matter of uh, getting to work and I get a payment and I have to do whatever I've been assigned to? The first part of the Fierro model has to measure all the aspects included in the institutional culture. They have to be measured in this way. And we have operational indicators as well. We are going to elaborate on each one of them. In the operational part, what the Fierro model is asking us to analyze, well, we have to analyze departments, functions, lines of command, working load. Why? Because if someone is doing a job that is not correspondent to their profile, well, during the pandemic, they are doing the best they can. But in other times, this means that this is not we are not broken down carefully, specializations, specialities, and this is generating problems. Functions have to be identified. But I am doing something that is not part of my job profile. During the pandemic, everybody is going to do everything. But in the future, they are going to say, no, I don't have to help you because that's not part of my role. Can you answer the phone? No, that's not part of my job description. So we have to analyze functions, lines of commands. If there is a duplicity of command, we are going to have problems. So we have to measure this as well as workload. Here we are going to have a lot of indicators. If workloads are not well limited, then we are going to have problems because some people are going to say that they are working a lot and others are not working that much and they don't have the right to the same salary. Interestingly enough, this would be generating an equity problem. What other thing this model is requesting to us? We need to have a financial diagnosis that can help us to work with incomes, budgets, expenses, and how profitable are we. For that, we need to identify indicators that will help us to answer all these questions. External diagnosis. This diagnosis presents the group of external factors that can have an impact in the institution's performance. Politics. If we could talk about health policies of the current administration, we will need weeks to talk about that. From there, the percentage of allocation to each one of them, the increase of population, demographically speaking. This is an ongoing factor. Every time there is a newborn, they have rights, they have needs of social security. Not everything has to do with health. Now it is a priority due to the pandemic, but they have the right to education, they have the right to basic services at home, and it's not always the case. The appearance of new diseases. When I gave this discussion, and when I talk about the appearance of new diseases, this is an old document. I never thought about a new pandemic. I knew that it could happen, but I never considered the fact that I was going to live in it. The appearance of new techniques and technology for treatment and conditions. This is going to modify also the external um, diagnosis. We didn't expect to have a new vaccination, and now we are noticing new vaccination schemes that we don't know how efficient are they going to be. So all these factors are being requested for the diagnosis according to the Fierro model and according to what we have stated in this diploma program. We were on agreement that we were going to focus on institutional development and growth, and how we are going to measure everything based in these indicators. For example, for mission. Mission can be measured in different ways. Mission, we know that there are several books about that that are telling you that the mission is the reason to be for an organization. And the reason for organization is to fulfill your clients and patients' expectations. Otherwise, that client, that people are not, those clients, that people are not going to come back. And sooner or later, they are going to be transformed or they are going to be disappearing. The mission is very clear. How much are we fulfilling and covering this mission? How much? Well, really, the institution has focused on that. And what are the indicators that we can use? Well, we can carry out surveys, interviews, and generating scales. Good, bad, poor, excellent. Is the same methodology that we used for managing the diagnosis that we discussed previously, the one that you developed quite well, and I am happy to see that it was useful for you. So if we take into account the fact that we had 100 people, 100 staff, well, the scores should be like this. Excellent, excellent is reached with 500 scores. Well, I was close to excellence. Then you have 499. You are very good, but you are not excellent. Excellent is the one that reaches 500 scores. The good one reaches 400 with a base of 100. Regular 300, bad 200, poor 100 points out of a 100 people survey, considering the 100% of the population. I noticed that there was there was a question. 100 people are really representative? Well, we need to make an estimate about the whole population and to take a sample. And if this is the sample of your area, this is representative of what is happening in your area. If this is a wider group, then we will have to use a statistic sample so it can be a representative one. Let's see the objectives. Let's go to that part. In the objectives, it is stating this.
Muy bien. Y vemos la función en la que se participa. Primeramente, la función en la que se participa en la misión.
The function in which they are participating within the mission. This can be a good indicator because maybe the mission has been designed by top managers, but the people had to be involved. They had to participate in their definition. So we can measure the total of employments that are participating in their definition between the total of employees. So we can measure how many employees participated in the design of the mission. So it can have a weight. It's not only a motivating phrase or statement.
This I've seen like two so beautiful phrases that nobody reads them. But if people actually participate, again, this is focused on people themselves to establish what is the user requires, and based on that, we'll be able to focus on that service. The example is very clear cut, I guess. If 150 employees participated out of 2,000, that means that we have to divide 150 divided by 2,000, and we multiply that 100 to come up with a percentage, and that tells us that 7.5% of employees participated in development of a mission. So is that good or bad? Well, will be as good as the largest volume of employees participate in the development. I'm not saying that they will have a decision in final draft, but they should at least contribute. So 7.5% is a good thing in as much as the participation increases. And the modification of the mission, because it seems that the mission was established once by the gods and is untouchable now, when it's rather the consequence of the daily operation and the perspective of our users. Now, we can also measure mission amongst employees, how much know the mission. And here we need to thank that we're not live, because many times when dealing with this, I ask you questions directly. I'll tell you what's the mission. You tell me what the mission is, and tell me what your organization, your institution's mission is. You know what? Painfully or regretfully, many people don't even know what the mission is. How would the indicator be? Well, employees that know it against total employees times 100, and that will give us a perspective. The example set here, only 32 out of 100 employees know the mission. That is to say, only 32% of the company knows the mission of the company, and that's terrible. That is terrible because if you don't know why you're waking up to go work with, well, then you're dead. And I mean, in the medical environment or medical field, many people wake up to help population. We know great physicians, but many physicians just tell people, okay, sit down. What's wrong with you? Oh, my headache. Oh, take this pill, and that's it. This bill because I have other people to tend to go. Are you going to run some tests? No, go next. What's wrong with you? So I'm not saying this applies to everybody. Few cases, but these few cases are the ones that sometimes might hinder our mission. If our mission is for people to walk away well tended after, well cared for, treated kindly, with humanity, and if you don't treat people as such, is that that means that they're not applying the mission. So again, that hinders the perspective of the institution and the work itself from the institution. Okay, next indicator, vision indicators. Like I mentioned, vision should have a projection. It should be backed up by numbers, percentages. A vision says being the best. It's very nice, but that's not telling us much, if anything. So we need to really ground it for people to know where is it that we're heading towards 5, 10, 15 years time. That vision is always something long term. And vision, since it's got a scope at a strategic level in the organization, it needs to be able to identify users as well as the volume of resources that they'll be using to care for that many users. So here, in the example, so the vision might be the number of people that we're going to care for in the future, or where someone says that their vision is ending hunger or decreasing in half of cases. If we don't have a percentage, if that's not backed up with a percentage, if we don't have a number justifying that, how is it that I have already arrived to my vision? How will I know that I'm actually there, that I arrived to what my vision is? So vision has turned into a phrase like being the best in 5 years. No, you're supposed to add numbers, increasing the amount of people cared for and properly cared for. When someone says we're going to end hunger, okay, give me numbers. There are 20 people, 20 million people starving. Okay, so let's decrease that number in 5 million. Okay, so that tells people where they're heading towards. Vision without numbers to ship, without anywhere to go. It's like, let's go out sailing. But if you say we're going to that city and it will take 4 days in going and getting there, and this is the route, so everybody will work towards the same goal, going or getting to that city 4 days away. So this the vision needs to be filled with indicators. So the point of the vision is indicator number of people to care for in the future. No, the indicator might be percentage of people without being properly cared for. That would be the indicator. It's not only the ones you're caring for, but the comparison. Okay, so I cared 1,000 people for vaccination today, yes, but you didn't care for other 5,000 who were left in the street. So what's the deal with that? Putting it at hunger, number of people without hunger, number of people with hunger, I mean starving, and percentage people starving, and without we can't cater. What percentage of people are going to improve in this item? How many people will remain starving in that situation? From the vision, and we're talking about things pertaining to social security, decreasing half the number of cases that we couldn't tend to in the past. So, and even statistics of cases left without resolution. So the vision should have numbers, numbers, and more numbers, because that will tell me. I mean, if the vision is properly calculated, it will generate objectives, and objectives in turn will let me know the resources I need to use, and why this needs to be optimized. And that's clear. Providing 100% of population with justice. We were just talking about the fact that we had our lawyers. Jocelyn was one of our lawyers, representing our lawyer group, who also took the diploma course. So here's an indicator for the vision to you, providing 100% justice. Okay, so I mean, first, what was justice as such, right? but at least going over cases of people. That would be another good indicator. And here we're going over indicators that will help us see whether we're on the right track or not. If really the organizational development is being properly managed or not. This is not pure philosophy for the sake of philosophy. Like we need to go down to the numbers to see whether it's true that we are achieving results. Here we have another indicator, very similar to the one we saw with the knowledge of mission. How many people, and there is very classic questions for people being certified in ISO 9000. I mean, and we're talking about the receptionist, and she has the quotes for mission and vision just in front of her, and then she's audited, and she's asked, "Do you know the vision of the company?" And she's like, "Yeah." "Oh, what is the mission?" Oh well, let me see. Like, no, tell me without turning elsewhere. Look for it. And we go back to the same thing. They don't even know why they're up in the morning going to work. They go to work because they're getting paid without really identifying major objectives stemming from the mission and vision of the company. And the indicators just like the other one. Employees that know it against total employees. And in this case, we might say that out of 1,000 people, 350 know the vision. That turns out 35% of employees knowing the vision. And that, in terms of vision, in terms of equality, that's terrible. Not knowing the vision of the company and not knowing the 5-year plan of the company, well, then you won't be gearing your effort towards the achievement of that goal. And that will be terrible because the levels here should be over 90% of employees actually knowing the vision, because remember that based on the vision you can establish objectives. And this is something that people tend to see separate. One thing, your objectives, and another thing is the vision. No, you use the vision to come up with the objectives. If I say that in 5 year times I will care for 100,000, probably the first year I will care 15,000, next 20,000. But if I haven't duly identified that, literally, how is it that you're going to know where you're going to? How will you better orient your work? How you're going to know how much you need to work every month, every week? Okay, so vision actually produces the objectives. Next indicator, and that is the objective indicators. Setting objective is the consequence of a vision again. And objectives, all of us know, should meet at least three elements, three key elements that should be achievable, clear, and measurable. Okay, this is also difficult because I've asked a great many people. I've asked, "Well, what's your objective in your office? Being the best employee." I mean, that's not an objective. That's a good idea. At best, that's your wish list. So how is it that I'm going to establish objectives? We also need to put indicators in this which are extremely achievable, number of people cared for, good, number of claims within the period of time, and it should be achievable because you cannot demand someone or just one person to care after 2,000 people. No matter the calculation, you can only properly care for 150 people a day, something like that. So you need to make a calculation for objectives to actually be achievable. We're requesting to optimize resources so that you can care for more people. Of course, we cannot ask you for something unachievable, but within something that's achievable, you need to strive for that. That's why, I mean, the techniques and the tools that we've seen, the diploma course, and especially here in the organizational development portion of it. I mean, if an objective is achievable, clear, and measurable, we'll have to analyze it. And one of the main indicators is achieved objectives divided by total objectives that were established. And this is harsh. It's tough. In the large majority of countries, and more so in Latin America, we're deadly afraid of indicators. And this is obvious because if I establish an indicator, I'm prone to being measured, like objectives which are measurable. And that really frightens us. Somebody measuring us. But we have to do it nonetheless. And I need to measure how many objectives were achieved and establish how many objectives. And that doesn't only performance assessment. This serves in organizational development to see whether people are meeting their objectives and if the objectives are correctly calculated and if the objectives haven't actually been achieved because of things inherent to the organization or if it's the employee. But the fact that I've achieved very little, way too many, I mean, this information is really transcendent. And here we have an example. Solved cases for the year 2014. And that this example dates back many years. Or achieve sales of over 200,000 units by 2014. You need to set an end date. You need to set a number and to give them a time frame. So these are the objectives. And again, this objective should be achievable. We cannot just generate objective out of political reasons. This need to be able to be measured. Next indicator. These are operational or performance indicators. And like I said, this is the second part of what Figueroa requested in his model for organizational development. Like we saw, we already went over objectives, mission, and vision. Now, how can we achieve this mission, vision, and objectives, ladies and gentlemen? Okay, we need to work based on our performance indicators. And performance indicators obviously we will have resources and we will need to optimize these resources. And in our case, they are not very broad. And even worse, and volume of users to be cared for in themselves will keep growing. Now imagine with the pandemic, it's crazy. Now, which performance indicators do we have? Let's go see these operational indicators. We will take a look at this in depth in closing. And this productivity indicator. Okay, so productivity equals generated production. Production because this comes from the production area. But really, this indicator we can use in admin and operational areas. It's not only based on finished products, but really any result that we can come up with. That's why this productivity indicator has been used in the production area of companies, but afterwards it was used to analyze pretty much everything. It's fair to tell you that there was a modification to the law in Mexico, an amendment to include productivity indicators, which unfortunately hasn't become a reality because I know that this touch upon many interests, union interests and so on, but this indicator is being used in many places and also a matter of reward for people increasing their productivity. And we'll see why, because it's not only generated production. Here we're talking about results obtained, and we will see that in just a minute. And all that divided between the investments. The investment that you were able to generate, and we will work with this in later on. And this indicator in turn has a counter indicator. The counter indicator is the cost per unit. And cost per unit is nothing other than this formula. And you'll come to realize that most of the indicators are presented as divisions. I'm not saying all of them, but the large majority are. Why are these indicators divisions? Because of what I just mentioned a while ago. An indicator that you cannot contrast against something else is worthless. In this case, I need to compare, to contrast what I've generated versus what I've invested, and a large majority of indicators work that way in that form of comparison. That's why most of them are divisions. I'm not saying that these are the only indicators, but most of them are divisions.
Es el contraindicador de la productividad. Es decir,
cost per unit is a counter indicator of productivity. If productivity increases, the cost per unit will tend to drop. And this will save and even optimize resources. So we will work with that in just a while. But it's important, really important, you know how to use it. And today, at I don't know, 2 p.m., you disconnect from the session. You need to finish here and start implementing this indicator now, right now. And you'll see how this works. We have this other indicator, which is really fashionable because of COVID. And this is the percentage of used capacity. We're seeing this, and painfully so, with hospital beds. We had the second wave, which is a mere consequence of everybody not taking care of sanitary, not caring for. And we saw the second wave of coronavirus during January and February. And again, this is just the consequence of that neglect of population. In January, and we have some other variations of the same virus, but this was a little bit of negligence by the population. And we were not measuring this based on deaths, which is a total indicator of a pandemic, the number of deaths. But we were actually measuring this based on the number of beds, hospital beds being used. Today, I mean, we still have a bunch of people dead. Thousands of deaths per day in each country, or at least 500 as a mean. So imagine having 500 people dying out of the whole population every single day, and we're not in wartime. And you know that makes you reflect upon things. So one of the harshest indicators has been the installed capacity. And how you calculate the installed capacity. The capacity currently used divided by the total installed capacity, in this case the hospital beds that we have, but it could be pretty much anything multiplied by 100. And well, here's a calculation here. The total installed capacity planned at 100%, 200,000 units a month. Nevertheless, only 100,000 units were used. That's why it's been established that we're working at 50% of installed capacity. 100,000 divided by 200 times 100, and that gives us 50%. So in COVID times, if we talk about hospital beds, we're not even talking about this. And I don't have to, I mean, I'm preaching the choir here. You work in hospitals, a lot of patients are sitting there in chairs with an oxygen tank outside a given area because they didn't have enough hospital beds. So installed capacity has overpassed us. And let's not talk about ventilators. Because painfully so, we saw ventilators as it's a huge possibility of improvement that we see worldwide. People going to ventilators don't necessarily represent a high percentage also of people getting out of using ventilators. But now, production defects or operation. And that's yet another division. And that's effective production divided by total production. And we could use these numbers in the service as well. The problem is that we don't really want to use these indicators in service. But I could say people not properly taken care of versus patients correctly taken per day. It's like the doctor didn't do this, or there are many people who get contact with the patient before they reach a physician, where the receptionist, the girl in the information booth, security officer. So it's not only talking about production, I mean the defects in production, but also defects in attention, and that's a similar indicator. So me telling you that I had 100 people complaining, I would say that that's a lot, but I cannot say this is a lot or little that I can compare it with the total out of 1,100,000. I mean, it's okay. It's like it's heavy right now. I mean, effects upon vaccination. How many people are getting sick after vaccination? If I mean, them telling you that 500 people were had adverse effects is not as representative if I told you that 1 million people have been vaccinated. So, in indicators, when you contrast one number against the other, that will really tell you whether something is good or not. Because there are a lot of indicators, but what's important is the interpretation of said indicators. Moving on. Staff turnover. I would love to ask you how your turnover rate is like. Probably even talking about physicians. But what about janitorial staff, cooking staff? And well, we're talking about hospitals because we're living, but Carlos and Joseph, they work in office spaces, not necessarily in the operational areas. But what's the cost to an organization? Just recruiting personnel, recruiting staff, it's huge cost. Why? Because these are man hours of selection, recruiting, and training of new staff for them to walk away on you. So how are you going to measure this? People quitting divided by total of employees. And with that, you get your turnover rate. And we also need to identify why people are leaving. Sometimes due to working conditions, not even because of payment, wages. Sometimes because they're being mistreated at work. Not so much so for wage. So see the importance of the organization environment analysis. Yet another indicator, mean work times real work hours per employee. Nobody wants to get a look at this. Maybe the operational area this is not so noticeable, but in office space, damn. I don't know if the whole country or throughout Latin America we do have cases. You gets someone into the office, and the first thing he does is, checking all social networks. And I mean, that person used to be in a computer, and then the company's organization blocked that person from going to social network. But now, everybody has their own cell phone. So doing this is even more complex or more complicated. And how many people we see that they leave work at 10 p.m. Oh, poor guy. He came in, she checked in at 10 a.m. and he put in like 14 hours. No, he's just making extra hours because that guy came in at 10 a.m. But he checked all social network. He went to get a cup of coffee at 11, and he started working at 12, and then he went out to lunch at 2, comes back at 4, and he gets another coffee. And unfortunately, I mean, those of us with this dumb vice of smoking, you need to take into consideration smoke breaks. So, how many real work hours is he putting? So that happens a lot in offices. I hope that's not the case. Well, probably it's not the case right now with the pandemic, but be wary of this. So, how would that indicator look like in terms of an equation? It's total real-time works for all staff, and we're going to measure this against the total employees. Total employee time, and that's harsh.
We have to measure how many lost time do we have from the staff. Or let's talk about financial indicators. Financial indicators, in some cases, are not identified in the operation, especially when we are talking about governmental government institutions. These are not uh, very clear, but it's important for us to identify them. One of the most interesting financial is the ROI. How many, how much money is recovered from the investment. For private hospitals, this is a very basic indicator. Maybe in the healthcare systems and in the governments is not that noticeable. How many profit has been gained vis-a-vis the investment. I got 100 and I invested 90. It means that I had how much? Because here the result has to be higher than 1. Because if it is higher than 1, then the result says that I am recovering my money. If the result is higher than 1, of course, I recover my investment, my money, and if we have 100 of profit, 90 of investment, it would be 111. I recover my investment. 1 peso invested and cents for every investment. This is a very important indicator for private corporations. How much are they recovering for every peso or dollar that they invested? Another important indicator, the even point. Many books say that this is the moment when they start having profits, and that's true. However, we have to identify that the only thing that is being paid 100% are fixed costs. Fixed costs can make a company or a country go to bankruptcy because these are the costs that have to be paid whether you have uh, income or not. Salaries. I would like to know what would you do if and the payday you go to the ATM machine and they say, there's no money for you. And today is payday.
No quiero ni pensar cómo se pondrían todos.
I can imagine your
Bueno, los
reaction.
costos fijos son estos,
Well,
los que se
these are
pagan
fixed costs,
vendas
the
o
ones
no
that have to be
vendas,
paid whether you
tengas
sell
ingreso o no
or not,
tengas
whether you
ingresos.
have income or
Esos
not.
son los costos
These
fijos.
are fixed
Y la
costs.
fórmula del punto de equilibrio, si se fijan, trata de
Are the,
acabar
and
con
the
ese costo
formulation
fijo.
for
Aquí lo
the
podemos ver.
breaking even point is
Costo fijo
this one.
total
Total
entre
fixed
un
cost
precio de recuperación, que en este
between
caso
a
sería tal vez el
recovery cost
ingreso por
that
cada
maybe
paciente,
is the income per patient,
menos tu costo variable unitario. ¿Qué integra el costo
subtracting
variable
the
unitario?
variable unit
Bueno,
cost. What does
son
it
todos los
comprise?
insumos para operar.
All the inputs
¿Y
for
por qué es
surgeries.
variable?
And why
Porque si
does
tengo
it
más
vary?
pacientes,
Because
pues
if I have
necesito más
more
insumos.
patients, then I need more
Si
inputs.
tengo pocos pacientes,
If
necesito
I
menos
have
insumos.
fewer
Por
patients,
eso
I
es
need
variable,
fewer
eso es lo que le da lo
inputs. That's
variable.
why it
Y el
varies.
costo fijo es
And the
fijo no
fixed
por
cost
un monto.
is fixed
El
not
costo
because of
fijo
the
es fijo
amount.
por su
The fixed cost
obligatoriedad.
is because
Por
it's
ejemplo, la renta es
mandatory.
un costo
For
fijo.
example, paying the
El
rent is a
costo de
fixed
tener
cost.
oficinas
The cost of having
es
an
un costo
office
fijo.
is a fixed
La
cost.
nómina en la que están
Payroll,
ustedes, señores, es un costo fijo.
it's a fixed
Y
cost.
se tiene que pagar
And it has to be
haya
paid
o no haya dinero. Por
whether
lo tanto,
they
con
have
Carlos
money or
Zúñiga
not.
de Ecuador, que
I
él es el que
I'm
fiscaliza los
sorry for
recursos.
Carlos
Pero
Zúñiga because he
haya
is
o no haya dinero, se paga el
oversighting
costo fijo.
resources.
Lo
But
siento.
no matter
Y el punto de
how
equilibrio es
many
eso.
resources you have
¿Cuántas
fixed
unidades
costs. And the
necesito
breaking
para
even
salir
point
al
is to
menos
identify
tablas?
how many units do
Y
I
por
need
eso
to
la
have a
fórmula,
breaking
costo fijo
even point.
total
And
entre
why
o el
we have
ingreso que
this
se tiene
formulation.
menos
Total
lo que me
fixed
cuesta
cost,
atenderlo. Y lo que
income,
sobre será para pagar este
subtracting
condenado costo fijo
what I have to
que
pay
es
for
el que acaba
giving the
con
service.
las empresas.
And the fixed cost can terminate a
Muy bien.
company, can end with a company.
Vámonos a este otro.
And let's talk about
Y es que
this
en la
other
actualidad también
element
está tan
that
de moda
currently is very
el
trendy,
apalancamiento.
leverage.
Y como dice su definición, se define como el uso que
It
hace
is
la empresa
defined
de
as the
activos
use of
y pasivos
assets
del
and
costo fijo en un esfuerzo por
liabilities
aumentar los
by the
rendimientos
company
potenciales
in order to
de
increase
los que invirtieron
potential
su lana,
yield
¿no?
of
Que en
the
este caso sería el
investors.
gobierno.
So in this case, it's the government's
Ahora, el
money.
apalancamiento abusados.
Leverage. Be
Yo
careful.
voy a tener este recurso, pero significa
I
que
am
me
going
están
to have
prestando,
this
a eso se le
resource,
llama
but that
apalancar.
means that they are
Y yo necesito
lending
saber
it to
cuánto
me.
de
So
eso
that's why
pertenece
it's
a este
leverage.
pasivo,
And
que
I
es,
need to
no es
know
un
how
pasivo,
much
es
of
una
this
deuda, pues.
belongs to a debt,
¿Cuánto
to a
pertenecen a este
liability,
pasivo contra el patrimonio que se tiene?
vis-a-vis the
Y
patrimony that
tenemos un
we have.
ejemplo, ¿no? Una
This is an
maquiladora
example.
tiene deudas, un
An
pasivo, pues,
outsourcing company
y
has
nos está financiando
liabilities
nuestros acreedores,
financed
nuestros
by
proveedores por 2
debtors
millones dólares,
of
pesos,
$2
lo que
million
manejen cada uno de
pesos
ustedes
or
en su
whatever is
país.
the local
Y el
currency of your
patrimonio con
country.
el que se cuenta es de
The patrimony
25
that you have
millones.
is 25 millions,
Esto significa que tenemos un
a leverage of
0.08. Es
0.08,
decir, que
0.0.
nuestra deuda está representada
Our
por
debt
8
is
centavos de
represented
cada
by
peso que
8
se tiene.
cents of every
Cada peso que
peso
tú
that
tengas
we
en tu
have.
bolsa, 8
Every
centavos no son
peso that
tuyos.
you have
Esto significa
represents that
que no
8
solamente
cents
los
are
debes,
not
sino que
yours.
alguien te está
Not
ayudando
only
a,
that
a
you are
financiar tu
in debt,
operación.
but someone is helping you to finance your operation.
Y en el caso de gobierno, pues el
In the
gobierno,
case of the
además de lo que
government,
aporta, pues a
the
veces se ha
government,
visto
besides
financiado
the
en algunos países.
contributions that they
En
make,
México tal vez no
sometimes
tanto por el
they are
esquema
being
legal que
financed
tenemos, pero en
by
otros países
other
sí,
countries. This is not the
donde los
case in Mexico
recursos, pues
because our
obviamente vienen
legal
de una
framework.
secretaría, así como
But in
nosotros,
other
Secretaría de
countries,
Hacienda, etcétera.
the resources
Pero en otros
come from
países
the
también
Ministry of
entra el
Treasury, for
apoyo
example. And
gubernamental y
other
también les dan
times,
acceso en un
they
híbrido
have
a
access
un
to
apoyo también
a
de
hybrid
privados.
scheme,
Entonces es
receiving
importante saber qué tanto estamos
money from the
apalancados para
private
saber
sector.
cuánto de
So
ese
it's
dinero
important to know
realmente es
how
nuestro
much
y cuánto
leverage
realmente se
do
debe.
we have, to know how much money do we owe.
Y nos vamos a esta que son muy interesantes, la solvencia y la liquidez. Señores, ustedes podrán ser solventes.
Solvency and liquidity. Maybe you can be solvent,
Pero tal vez no son
but
tan líquidos.
maybe you don't have that
¿Esto qué
much
significa?
liquid resources. What does this mean? Maybe I can receive my money on payday, but I don't have cash to pay for my daily duties. This results in liquidity problems. But I'm going to have money when I collect my payroll. And maybe I am going to collect a lot of money. That means that you are very solvent. But meanwhile, you are not liquid. You have no liquidity to pay for your short-term expenses. How do I estimate the solvency of a company? Well, I am going to strike out the debts. No, sorry, the money that I have in banking accounts and the money that I have to pay for my midterm expenses. And I subtract the inventory that I have, vaccinations, for example. And this is what I have to pay for my issues, what I have in bank and in the cashier. This is going to be divided between my debts in the short term, 3 months. An organization has an asset of 12,500,000 pesos and an inventory of 2 million pesos, debts of 6 million pesos. So out of these 12 million, I had to subtract 2 millions and I have this to be divided amongst between 6 millions. So my solvency is 1.75. So for every peso that has to be paid in the short term, they have 75 more cents. I pay that peso and I remain with 75 cents to be able to pay for these liabilities. The difference with liquidity is that this is in the midterm, in the short term, 1 or 2 months. Liquidity is about today, as we speak. So how much money do I have right now to pay what I have to pay right now? Well, today is the due date for paying for energy. How much money do we have to pay for that energy bill? This is what we need to know. And this ratio is talking about the asset that generates liquidity. How much money do you have in circulation? And here we have the example. 12,500,000 in asset, and currently we have a 4 million debt. The liquidity is 3.125. So for every peso that I have to pay immediately today, I have that peso and 125 remaining to face other circumstances. This concept is the one that is missing many times in clinics. They don't have liquidity to pay for inputs. Yes, when they get the money, they will pay for that. But sometimes in the daily operation, liquidity is not being well calculated and they don't have liquidity to pay for what they have to pay every day. Let's talk about external indicators.
Dentro de los indicadores externos pues hay muchos que tienen que ver con la toma de decisiones que estamos haciendo. Y si se fijan, todos estos siguen siendo parte del modelo de Fierro de desarrollo organizacional, que hay que tomar en cuenta. Por ejemplo, todo esto para el diagnóstico. Dentro de los indicadores básicos económicos, tenemos, por ejemplo, el Producto Interno Bruto. ¿Ok? Y el Producto Interno Bruto es el valor total de todos los bienes y servicios de un país, por la economía de un país, en un periodo determinado que generalmente se mide por año. Con la pandemia hemos visto que tenemos dolorosamente una caída del Producto Interno Bruto de muchos países. De muchos países. Y esto dolorosamente nos está generando que si de por sí ya traíamos rezagos de pobreza, ahora hay mucho más problema en este sentido. Hay mucho más problema en este sentido. ¿Por qué? Porque ya no hay tanto dinero que se esté moviendo y por lo mismo no hay tanta gente que esté comprando y eso genera que muchas empresas no estén vendiendo. Y cuando ese círculo vicioso se empieza a dar, empiezan a correr gente y esa gente tiene menos dinero y esa gente compra menos y entonces esa gente a su vez va a propiciar que eran clientes de alguna otra empresa y que también va a correr a su gente porque entra en problemas. Esto es terrible y también puede influir en la toma de decisiones de su organización. El ingreso per cápita. El ingreso per cápita no es otra cosa que este mismo Producto Interno Bruto dividido entre el total de la población. Este indicador, ¿para qué nos sirve? Pues para medir si la gente puede pagar o no nuestros servicios, si puede pagar o no un tratamiento, si puede pagar o no. Yo ahorita, y esta es una de las críticas que he hecho a mucha gente, que me perdone, ¿no? Yo veo a mucha gente saliendo ahorita de ciertos niveles socioeconómicos altos, los veo saliendo de fiesta, veo cómo comparten en sus redes sociales que están en los grandes centros de vacación del país y a nivel internacional, y los veo disfrutando muy bien de la vida, y no es que me dé coraje en ese sentido, o envidia, que tal vez sí un poco, pero más bien es la molestia de que de repente regresan y dicen, oh, me enfermé de COVID. Pues sí, pero el señor tiene dinero suficiente para comprar los últimos tratamientos, ¿no? Yo no sé en cuánto estaba, pero al principio aquí en México el famoso que Remdesivir o no sé cómo se llama ese medicamento para el tratamiento estaba carísimo y no había. Y estas personas, claro que lo van a tener, pero ellos en el camino van a contagiar a muchas personas. Y dolorosamente su personal de servicio, que es de un nivel socioeconómico más bajo, se va a ir en transporte público enfermando a otras personas y enfermando a su propia familia, y ellos no tienen para contratar eso. Y a la gente que tiene muchos recursos, aunque sí ha habido muertos, son los que menos muertos tienen porque tienen para pagar tratamientos muy buenos y además están mejor nutridos y demás, y siguen dándose la vida de locos cuando están contagiando a mucha otra persona, sobre todo al personal de servicio. Y esto es terrible porque el ingreso per cápita de la población, sobre todo el de los niveles más bajos, el ingreso es mucho menor. Y aunque el ingreso per cápita es de todos los niveles socioeconómicos al mismo tiempo, este indicador sí nos ayuda a decir que un país pudiera o no comprar algo. Pero si lo analizamos por nivel socioeconómico, no todos. Y ahorita en la pandemia, pues sí, es muy triste ver que en lugar de que todos estemos confinados por mutuo propio, algunos países han tenido que hacerlo a través de medidas muy estrictas, ¿no? Y en nuestro país, pues aunque se les convida a la población dolorosamente aquí en México, sabemos que hay gran necesidad de salir a trabajar de muchos segmentos, pero también vemos muchos otros segmentos que no tienen necesidad y que se la han pasado súper bien. Bueno, es un decir, pero se la han pasado contagiando a medio mundo porque nadie les ha exigido que tengan medidas restrictivas más fuertes, ¿no? Pero claro que influye el ingreso per cápita en la toma de una decisión, en la toma de un tratamiento, en el no contagiarnos, ¿no? Dolorosamente. La balanza comercial es otro indicador que puede afectar. Por ejemplo, el volumen de exportaciones menos las importaciones, eso puede generar que un país empiece a tener deuda con otros países, o puede ser que esos países le generen tanto ingreso que le ayuden a que haya mejor calidad económica, bueno, que haya más desarrollo económico y eso otorgue mejor calidad de sueldos y demás a la población. Entonces, esto también es importante porque nos ayuda a ver si el país está teniendo ingresos o no y que nos puedan ayudar en las tomas de decisión, si va a haber más ingresos para impuestos y si con eso vamos a poder atacar esquemas de seguridad social o no. Y tenemos aquí un ejemplo muy sencillo, exportaciones de 80 mil millones contra importaciones de 45 mil millones y nos arroja que tenemos saldos positivos de 35 mil millones, lo que indica que nuestra balanza comercial es sana y que estamos teniendo más dólares que entran o euros que los que se están yendo y eso beneficia en términos generales a la economía del país. Esperemos que también a la población, ¿no? En términos generales. Y tenemos también el índice de precios al consumidor en México. En otros países se manejará algo similar, que es un indicador que nos habla sobre la inflación. Y no es otra cosa que comparar el precio de las cosas ahorita contra el precio de las cosas antes. Y eso multiplicado por qué tanto ha subido o ha bajado. Y en México manejamos un índice de precios al consumidor que engloba los principales productos de consumo del país. Y ese índice nos va diciendo si hay un crecimiento o no. Si hay un crecimiento o no en este sentido. Finalicemos comentando que es muy importante el tener los indicadores, porque con estos indicadores, además de que podemos manejar un diagnóstico más fuerte como lo pide el modelo de Fierro en su desarrollo organizacional, también nosotros tenemos un panorama más claro para tomar decisiones, porque a veces estamos tan metidos en solamente nuestros indicadores propios de desempeño que no vemos lo que está pasando afuera hasta que el golpe ya lo tenemos encima, ¿no? Y bueno, aquí vendrá la bibliografía, voy a dejar de compartir un momento. Déjenme irme para acá. Ahí estoy. Y vamos a irnos a nuestro último indicador. Déjenme ver dónde lo tengo. Ahí está. A ver. A ver, ¿lo alcanzan a ver, maestro Luis?
¿Es correcto? ¿Se alcanza a ver, maestro?
Perfecto, muchas gracias. Ya estamos por finalizar, ¿eh? Vamos a terminar, como les decía yo, con una parte ya muy, muy importante que me gusta mucho trabajar, ¿no? Como bien decía nuestro módulo, crecimiento y desarrollo organizacional, hemos visto todos estos indicadores para medir el crecimiento, hemos visto estrategias para ello. Bueno, este es su servidor, cuando dice mi esposa que esa foto es de hace como 100 años, yo quiero pensar que son menos, pero bueno, aquí estoy para servirles, muchas gracias. Y estamos para servirles, pero bueno, independientemente de ello, el mejorar el desempeño en el desarrollo organizacional, como les decía, necesita de algunos indicadores. Y que ya lo vimos, ya lo platicamos básicamente, es uno que quiero que todos trabajen. Uno que quiero que todos, a partir de que en unos minutos más nos despidamos, quiero que lo empiecen a trabajar ya. Nos va a ayudar como no tienen idea. Y en las políticas de los países más desarrollados, este indicador que es muy fácil de entender, un tanto más complejo de que la gente se deje calcular, pero algo que hay que entender y que quiero que con él enfaticemos y terminemos nuestra sesión del día de hoy, que es los dos indicadores, la productividad y su contraindicador, que es el costo por unidad. Decíamos, la productividad son las unidades generadas, los casos atendidos en el caso de ustedes, las personas que han atendido, contra los insumos, contra lo que se invierte para atender. En este caso, tenemos un ejemplo. ¿Cuántas unidades generadas o casos atendidos? En este ejemplo serían 2,500. Yo que ustedes ahorita sacaba una plumita y empezaba a hacer, imprimía la pantalla a reserva de que puedan tener acceso a la grabación más adelante. Impriman ahí la pantalla porque esto es importante para que lo hagan de una vez. Quiero saber cuántas unidades generadas tienen cada uno de ustedes al mes. Ahora, de eso, ¿cuánto de eso ha sido los insumos o la inversión que se está dando en su área? Por ejemplo, recursos humanos, estamos hablando de sueldos. Y de capacitación, incluso este curso entraría ahí. Este diplomado entraría ahí. 350,000, por poner un ejemplo. El costo de la materia prima es de 28,000 y el costo de la energía eléctrica es de 10,000 y de combustible, si es que se utiliza, de 9,000. Estamos hablando de un costo de los insumos de 397,000. Y ya tenemos las unidades generadas, que son 2,500, ¿no? Entonces, ¿cómo quedaría la productividad? La productividad quedaría como 0.00629 y un montón de numeritos. ¿Y por qué dices, por qué lo pone tantos números? Pongan nada más los primeros 4, los primeros 5. Bueno, señores, déjenme platicarles. La productividad es un indicador tan fuerte que al principio empezamos a trabajar con ella, pero luego nos exigimos incrementarla mes con mes. Y en los primeros meses hacemos algunas cosas espectaculares. Dejamos de gastar en cosas que no eran tan importantes, empezamos a trabajar más fuerte, más rápido, que esto es lo que demanda precisamente un escenario pandémico como el que estamos viviendo. Pero llega un momento que el incrementarlo mes con mes, después de tener más de un año de estarla subiendo, pues ya no está tan fácil, ¿no? Y entonces peleamos porque el incremento pueda llegar hasta en este punto. Por eso es que muchas veces la productividad, pues sí, hablamos de estos dos primeros, pero generalmente se puede ir hasta el último decimal, porque a veces ya no hay forma tan fácil de incrementarla. Ahora fíjense bien, el costo por unidad de cuánto nos saldría, que es el contraindicador, es decir, es la fórmula al revés. 397,000 entre 2,500 casos atendidos. ¿Esto qué me da? ¿Esto qué me da? ¿Esto qué me da de indicador? Me dice que por cada persona atendida le costó a la institución 158,80 centavos. En este ejemplo, claro. Y también puedo medirlo por cada uno de los elementos, ¿no? La productividad de manos, 2.500 casos atendidos entre lo que me cuesta en recursos humanos. Costo por unidad. De estos 158.80, 140 son de recursos humanos por cada persona atendida. ¿Se fijan? Es una división muy sencilla, pero los datos que arroja son fortísimos. Ahora, fíjense bien, si una estrategia de intervención como las que se proponen en el desarrollo organizacional nos cuesta 50,000, se debe de tener alguna mejora, ¿no? En la producción o en los casos atendidos. Pero obviamente hay que medirla. Fíjense bien, aquí se incrementaron las unidades adicionales. Teníamos 2.500, se incrementaron en 500, ¿no? Pero también nos costó la intervención. Sin embargo, se incrementó la productividad de 0,062 a 0,067. Significa que sí hubo un incremento en la productividad. La estrategia de intervención que nos costó 50,000 pesos nos generó 500 unidades adicionales, es decir, perdonarán aquí se nos fue un cero, pero son 500 personas adicionales a atender. ¿Y esto qué significa? Que la productividad se incrementó, porque aunque yo invertí más recursos, pero también incrementé, por ahí sí tengo contadores abusados, porque este es un dato muy importante. Luego, mis queridos contadores, sé que cuidan muy bien los recursos, pero a veces hay que medirlos con estos otros indicadores. Se vea que aunque se paga más, se obtienen mejoras. En este caso se pagó más por esta estrategia de intervención que nos llevó de tenerlo en 397,000 a tenerlo en 447,000. Y tal vez alguien diría, no, pues ¿cómo crees? Salió carísimo. Sí, pero en lugar de atender a 2.500 personas, estamos atendiendo a 3,000. Y esto significa que el costo por unidad bajó a 149, cuando antes lo teníamos de 158. Es decir, la inversión que se efectuó dio resultados. Señores, a ustedes les cuesta mucho trabajo tramitar recursos. Este es también, además de que nos sirve para de estar atendiendo con 158.80 por persona, ahora lo estamos atendiendo a 149. ¿Se fijan cómo podemos medir incluso nuestra estrategia de intervención de DO a través de este indicador? Obviamente, también se modificó la parte de recursos humanos, ¿no?
Also, the HR portion was modified,
Mejora
and there was an improvement
en la parte del costo por unidad de 140
in the cost per unit
a
portion of 140 to 133.33.
Señores, no me resta más que
So, ladies and gentlemen,
agradecer
I have
el
nothing
favor
but
de su
thanking
atención.
you
Déjenme
for your
salirme un
attention.
poquito de aquí. Y no me resta más que agradecer el favor de su
I can only
atención
thank you for your attention
y de decirles que estoy muy orgulloso del trabajo que han
And to telling you that
Espero
I'm
que
really
todo esto
proud
que
of
hemos
work that
visto y
you've
que
done.
se ha
To
enfocado
telling you that
precisamente
everything
a lo que
that we've seen
planteábamos
today
desde un principio en el
is focused on
módulo
what
y
we
que se
talked about in the
planteaba en la
beginning in the module.
intervención del día de hoy, lo
And
hemos
what we set
cumplido.
out for ourselves in my today's
Y
participation,
todo esto se ha
we've
vinculado
met,
con el
and all
desarrollo
this
de
is really
nuestro
linked
manejo del desarrollo
to
organizacional.
the way we handle
Señores,
the
perdonarán que
organizational
hayamos
development.
todo, ya vieron el tiempo, se
So
va como agua, pero yo les agradezco y
we're
espero
done
que todo esto les sirva
for
de
today.
inmediato.
I
Muchas
hope
gracias
that
a
this
ustedes por
serves
todo su
you
esfuerzo
right
y
away. Thank you
gracias a
very
la
much for all
conferencia
your
por
effort.
seguirnos contemplando cada año desde que iniciamos con este diplomado y que veo que va creciendo y creciendo y
And
creciendo.
I see how this diploma course
Gracias a
is
todos
growing and
y
growing,
aquí
and
seguimos. Ya para
well, I
despedir.
wish you nothing but success. Thank you very
Gracias,
much.
maestro Díaz. Agradecemos su participación y la de sus ponentes invitados por compartir con el alumnado que
Thank you very
finaliza
much for
este
sharing
diplomado y con la membresía de la conferencia y
with
público
the
en general
students this diploma
estos
course
temas que
and
tienen un gran impacto al
audience in
interior de
general.
las organizaciones
These
de seguridad social.
topics that have a
¿Desea
lot of
cerrar con algún comentario final antes de terminar las actividades del día de hoy, maestro?
big effects towards the end.
Solamente reiterarles que continuamos en el diplomado con más actividades, que
Well,
todo obviamente suma.
telling you that I hope we achieve more activities, that everything adds up, that knowledge is accumulative, that all the interventions you're doing on daily, I mean, to add up to what we've seen so far. And of course, the challenge is large. You're living it, you're suffering it right now. And that there's no bigger motivator than using what you're seeing today. So that will help you in turn in your management, and especially people you're caring for in your action. So again, my thanks go out to you
La verdad, mi admiración
and my
por lo
admiration
que se está viviendo y porque ustedes cumplieron a
because of what you're
cabalidad
living
en
and
tiempo y
because
forma con el diplomado cuando
you
vimos que no era fácil hacer los diagnósticos, cuando vimos que no era fácil en este preciso momento hacer todo lo que hicieron y yo sí se los
were able to
agradezco
finish to
y se
duly
los
finish the
reconozco.
diploma
Un
course
verdadero honor,
out of
un
sheer
placer y ahora
hard
sí
work.
me despido.
So it's been an
Muchas
honor, my
gracias a
pleasure,
todos.
and with that,
Seguimos en
I bid you
contacto.
farewell.
No es un adiós, es un hasta luego.
This is not
Y esperemos que a través de la
a goodbye.
conferencia
To see you
sigamos
soon,
todos en
and
contacto.
I hope that
Luis,
we'll keep
un
in
abrazo
touch
enorme.
through the
Abrazo,
conference.
maestro, que esté muy
Luis,
bien.
greetings, warm
Muchas
greetings.
gracias.